Okay, beautiful.
Testing, 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 testing. Testing, 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 testing. Testing, 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 testing. Testing, testing, testing.
Okay, beautiful.
Yeah.
Everyone's beautiful. Everyone's beautiful.
Nice treadmill.
Are you gonna? Yeah, like this looks like you're approaching us like forever. Like
yes,
always.
I'm coming at you. No, I usually run after work, but since we're doing this, I figured I would just walk.
If you want to run while we do this, cool. It's just gonna be hard to. I can imagine it might be hard to have a conversation. Oh, the muting, unmuting thing is going to be a problem too, it looks like.
No, that won't. I was just turning up my volume so I can hear you better.
Fair enough. So just a little FYI for those of you who have not been on my show before, how we do things. I'm going to introduce the topic. I'll say hi to my chat. After which, I will give you all a brief introduction where you can say who you are, and then kind of give opening thoughts on the subject at hand. And to be clear, we're going to primarily talk about universal healthcare, but we are also going to talk about government social safety nets in general as well, right? So this is going to be kind of a broader topic than Leontes initially brought to me. But I do want to focus, at least initially, on the universal healthcare portion. And to that end, Leontes, since you are the one who brought me to this, I'm going to let you make the opening argument for it, right? Or against universal healthcare, if you will. Now, this is a bit of an unbalanced panel. Falsers is going to be the main defender of these universal healthcare and things. And so he's going to perhaps get a little more speaking time than the rest of you individually. But altogether, it should be an interesting discussion. If you have trouble getting in, let me see your hands, right? And I'll try to fit you in. But other than that, any questions from either of you? Cool. Beautiful. Leontis, that's how you say it, right? Leontis?
Leontes.
Leontes. Okay, Leontes. Leontes, lactoid, Killian. Is that how you say yours? Beautiful. And obviously, falsers. Okay. Yeah, thanks for coming, gang. Should be fun. We'll be live in about a minute. So if you need a pee break or something, now's the time.
Yeah, I'm gonna take a quick bow. Be right back.
Okay.
I'm actually going to shut my door, make sure the kids don't scream.
Had a little bit. Oh, go on.
If anything comes through, like the treadmill or whatever, just let me know and I'll mute myself in between. Okay.
Sure. A little bit of a scare about an hour ago. They're working on a power line outside, and they shut it off to work on it, and I wasn't sure how long it was going to be off for, and I was like panicking, like, oh my god, like I have my show tonight. I can't have them just working on stuff. But no, it was only for like 10 minutes, so it wasn't terrible, wasn't huge. But okay, once Falsers get back, I'll go live and we'll start this shindig. You're live already, I assume, Lactoid? Cool. Yeah. Any of the rest of you streaming right now, or just Lactoid?
I'm going to be. Where are you from, Whick?
Pennsylvania.
Okay.
Not initially, right? But that's where I'm living now. So.
Okay.
Okay. With that, let's get this show on the road. Give me one moment. Hello, hello, hello. Welcome one and all to another episode of Whick TV, across ideological space, where we come together and discuss issues political and cultural, from the silly to the serious. Oh, and we have a show for you today, gang. A show for you today. So, we're going to be talking about government efficiency, social safety nets. We're going to be talking about universal health care. Is it more of a problem than it is a solution? Some people seem to think so. But we're going to get into it. We're going to discuss it. We're going to find out. I want to thank all of my guests for being here. I want to thank all my audience for showing up. Yeah, let's talk about it and let's get into it. I think I'm live on all my ends. Everything seems to be going well. So, okay. Let's start off by introducing ourselves and the topic, and we're going to start with Leontes. Please, go ahead.
Hi, Whick. Thanks for having me. Thanks for hosting this topic. My name's Leontes. I don't really do streaming or anything like that. I'm just here to argue my points. Thank you for having me.
No, thank you. Next up, we have Blacktoid, please.
Wick, do you want us to introduce like kind of opening statement as well? With
I
this?
thought so, but I guess we're just saying hi.
I can do that.
Yeah, Leontes, go ahead.
So my argument's pretty simple. I think all of us here kind of want the same thing, which is for people to have, healthcare coverage, is to get the treatment that they need. I think all of us want that. The question is, what's the best way to do that? And from my experience, I mean, we have a few. I'm not sure about other countries and how they do it. I'm not going to pretend like I understand Canada's healthcare system and how that works. I have obviously anecdotes that their system's kind of inefficient and slow, but I'm not going to make any statements on that. But as far as in the US, we do have programs that are provided by the state. And these programs are outclassed by privately provided plans that are in the same tier. And I think that just goes to show how inefficient the government is at actually implementing programs that will fulfill the needs of people, because most people who are on these state programs are also enrolled in private plans that help fill the gaps left by the state. And I think just pouring more money into these programs is going to be not at much benefit when we also have the private industry that's shouldering the costs of these things. And it would just be a higher burden on the taxpayer at the end of the day.
Okay, well, we'll get into it in the opening and see if people agree with you. Lactoid, go ahead.
Yeah, I'm Lactoid. You can find me at Lactoid TV on Twitch, Twitter, and YouTube. My position is pretty straightforward on a fundamental principle. Just simply by virtue of existing does not mean that you are entitled to the labor of other people. People own their own labor. To suggest otherwise is the foundation of slavery. When we're talking about universal healthcare specifically, I think universal healthcare not only asserts that you are entitled to somebody else's labor, but it also is inefficient and shifts costs away from people who use the service towards people who don't use the service. And look forward to getting into it.
Okay, yeah, I'll definitely see if other people share your views here. Lactoid, let's find out. Next up, first time guest on my show, Killian, please.
Yeah, so my stance is kind of just around government efficiency as well. I think I read last year the government wasted $247 billion of taxpayer money. The Pentagon in 2021 or 2022 audit couldn't account for 61% of their assets. And then just this year or last year, I believe it was $220 billion they couldn't account for of money that was paid out to contractors or assets that were given out to contractors. So I don't believe that that the government can efficiently disperse a universal healthcare plan and control healthcare from a government standpoint. They're too inefficient at everything they do.
So. Just FYI, Killian, you were low. If you could turn up your volume just a tad, people are having trouble hearing you. Apparently, I have you at 200 on my end, so if you could just scooch that notch out, yeah, be helpful. I'm sorry, I didn't mean to interrupt. Are you finished with your statement, or
do I need to say it again, or are we good?
No, you're good. I think.
Okay, is that better? Is that better?
It's better, gang. Can you hear him better? I hope so. They say it's a bit better, so maybe just a smidge more, and then we can get there. But now, next, finally, Falsers. Please, what's your stance here?
Sure. So I'm Falsers. You can find me on Twitter at Falsers and in the space. I'm not a content creator, but I like to do these panels. I'm going to take just a little longer to lay out my stance since I'm the only one on this side of the fence, and I hope everybody will give me the 2 minutes of patience to just kind of work through it here. usually when we hear people rally against, what's called socialized healthcare, universal healthcare, it's done so in one of about three ways usually. And the first one is a principled argument, which is like a rallying cry against what they're calling socialism or social programs. And it's a point that is cited in spite of the many, many social programs, a lot of which are very successful, that we already have in this nation. The second is an anecdotal argument. And we heard this a little bit, I think. Leon said, in my experience, that's kind of a call to anecdote, a point that is cited to try to zoom in and obscure the larger body of evidence, which overwhelmingly suggests that our system is in dire need of overhaul. Or three, they'll diminish the data and evidence that is clear or divert away from it. Because to look at this subject in an empirical and analytical way tells a very clear story. We can't be short-sighted or myopic when we look at our position on things like the healthcare system, because it's not a simple subject. It is a complex system that needs well thought out and complex solutions. And so we can't look at it in a really particular way and ignore the other 80%. There's three main facets we've got to consider with this healthcare discussion. The first is access to healthcare. Can people get the care that they need? The second is the financial viability of a system and the subsequent economic effects of that. Can people afford it? Is our system financially viable? And what are the economic impacts of our current system? And then the third thing is the quality of the care they're getting. Are we giving care that presents measurably better long-term outcomes for people? And so let's go through those. And this is my position. In terms of access, we're the only high-income country in the world that does not guarantee health care. We have 27.5 million uninsured Americans in our country. Financial viability, that's point two. That's the other ones we need to look through. We spend more in our GDP, nearly double, and pay more per capita, nearly double again, than comparable countries that guarantee health care. The quality of healthcare, that's that third lens we need to be looking through on this. For what we're spending, you'd think our quality would be higher. We're spending double, but it isn't, because our system's not properly regulated. Our life expectancy in the United States is 77 across both genders. Any other country of comparable development and economic status, it's a range between 81 and 85. We are last. We are absolutely last. We have just short of double the rates of chronic disease per capita at 28% versus about 18% for those other countries on average. And we have 265 deaths per 100K capita that are unavoidable from medical miscare compared to 160 on average for similar countries. We are losing.
Okay, and with that, let's get into it, gang. I guess the first question I'd ask you, and I'll direct this at Falsers, but the rest of you, I'm curious what you think as well. Um, Given that, yes, I think all of us could agree that, and again, correct me if I'm wrong, that Americans' healthcare system isn't perfect. The question isn't, is our system good? It's, will this change to socialized or universal healthcare make it better? And I think that that's where the sticking point is going to be here. And I'm curious to see what you all think of that. Like, simply because it works in Canada or it works in other countries, doesn't necessarily mean that adopting that kind of system will work here. What evidence do you have that it will?
A lot of evidence. In fact, we've got South Korea, we've got Canada, we've got France, we've got Germany, Japan, Sweden, Australia, Belgium. There are plenty. And the counterpoints that usually get cited to this is like, well, our quality of healthcare is better, but it's not. The data simply says that it's not. Our long-term outcomes are worse across the board. And you can find like little areas of specialty that we are better in, such as like we're way better in breast cancer outcomes, but we're among the last in cervical cancer outcomes. Those data points do exist, but across the macro spectrum here, we are doing way worse than these countries. And I'm not saying that we need to completely socialize the healthcare system and make it the only option. I think Leon pointed out something very, very astute in his opening argument, which is that almost all of these countries have a private option. And I'm for that. I'm for that. But the difference between them and us is they have a baseline government program provided to everyone that makes sure everyone in that country is 100% insured. Again, we have 27.5 million uninsured in this nation, and it shows in the subsequent data that ripples out from that.
Go ahead, gang. What do you think?
All right, he mentioned me a few times, so I'm gonna go first. Yeah, falsers. Like I said at the beginning, I think all of us want the same thing. Maybe not Lactoid because he's arguing from a point of principle, which is fine. But the rest of us, we're like, we want people on healthcare, at whatever cost, whether it's universal or I'll speak for me. I would like people on healthcare. I want all those millions of people who are not on healthcare, like myself, I'm not on healthcare right now, to be on healthcare, to have insurance or to have some way to pay for any medical costs. And my argument is that it's the government just at this point cannot handle that because that's not what they've been geared towards. It's not their role, and it's proven through the programs that we already have, like Medicaid. We already have that program for people who are poor that need healthcare, and it's good. That's good coverage. It's better than Medicare. But the problem with it is that even those people who are on that, the majority of them have supplemental private as well. So that means there's something lacking. So my argument is that the private industry can cover the costs, can hold the costs of that would be of healthcare, and it would not be put onto the shoulders of taxpayers. Because if we were to have a universal program, I think with these other programs that have the majority of those people also on supplementary private insurance, I think the same would carry over for them. So it would just be kind of redundant. But I would, of course, agree that the people who are not on health insurance, we need to find a solution for them, for sure.
I'm curious from Lactoid's perspective, because Lactoid kind of is the odd man out here in a way as well. What do you have against government healthcare in general? Like, it seems like you think it's a form of slavery, right? Can you elaborate on that a little bit and kind of justify that? That seems kind of silly on its face.
Well, so we can go into. I have a number of objections and points against a lot of things that Falser said on the kind of the more objective points, the fact-based points. I don't think the data is clear on a lot of this stuff. But as to the specifically the principal question of what is the basis for slavery? So I understand that's like an incendiary term, but the reason I use it is because I think it's one of the best terms to describe any kind of forced service or forced labor. So, I mean, the line of thought, the train of thought is very simple. So, the concept of universal healthcare, or really any kind of nationalized service, and so I will apply this to all social services, by the way, in the broader conversation, is okay by virtue of existing, by the fact that you happen to have been born and you exist, you have a right to this service, right? And a service is more than just a thing. A service has to be provided by somebody, right? That is labor. Somebody has their own labor and they are providing it out. So the question is, well, if you're saying I have a right to universal health care, well, that must mean that I have a right to force the doctors to work for me, even if they don't want to serve me. And then
Well, let me ask you this, Lactoid. So you are a doctor. You have the expertise, and the tools to do your job and do it well. Man has a heart attack right in front of you on the street, right? Do you have no obligation to help him?
I do not think that you have an obligation to help people. No, I think that
Really?
no. I in the same way that I shouldn't have an obligation to provide my services to people, and a farmer shouldn't have to like grow food for somebody, right? Nobody should be obligated to provide a service for somebody else by virtue of them existing. And the reality is that when you have like the government paying for it, when you have the expropriation of people's labor and the redistribution to people who didn't contract for it, you have forced labor. You have to, because we're not getting these services out of thin air. Somebody has to be providing them.
Any thoughts on this, gang? Like, come on,
Yeah,
gang, get
Well,
into
I
it.
mean,
Let's
I did want to, yeah, I did want to take
Actually.
up something you said. So
please go ahead.
you did mention breast cancer. So I think the stats were 81% of breast cancer patients in the United Kingdom, which is supposedly a great NHS. 5 years after 5 years, only 81% of breast cancer patients live at least 5 years after their diagnosis, and it's 89% in the United States. And then for prostate cancer, it's 83% versus 97% live after 5 years. Also, in Britain, in the United Kingdom, you wait 25% longer for cancer treatment than you would in the United States.
I love it. I love the
Um,
data. I'd love to
yeah,
talk about the data
yeah,
for a
yeah,
moment.
we will. And also, I mean, I got all kinds of data just like you
Yeah.
do, but
Go
some of
ahead.
that
Sorry.
contradicts what you said, right? I guess
No,
my biggest
I
concern,
specifically stated that we are ahead in
you
breast
d-
cancer.
well, you did say breast cancer, but you didn't mention prostate cancer or how long you have to wait for cancer treatments. And I'm
Well, I'm
sure
not
if
going to
I
mention every
looked
field,
further,
right?
well,
So,
you,
so
you,
uh,
you
what I specifically said is we're doing better in some areas and not in others. And what you're going to
mhm,
hear in this panel is people drilling into really myopic data points and not looking at the macro, which is exactly what you're doing now.
right. I mean, we have to have some sort of data set to go off of, right?
Yeah, I love that. I love
Yeah.
that.
So yeah.
Okay.
Well, we could also talk about how long you have to wait, how much longer you have to wait. Sometimes you have to wait 7 to 8 months just for non-elective surgery.
Hmm.
And when people have to wait that long, that affects their job, their mental health, a myriad of things, right? Sometimes it gets them addicted to painkillers because they have to be prescribed more medication for pain. Um, that is the inefficiency I'm talking about when you're talking about a government-run healthcare program. Um,
Love it. Love it.
I also think that people should have access to healthcare, right? Especially low-income families that deserve it. So,
That
what I'd
deserve it.
rather
Wait,
do,
wait, wait,
what?
wait. Low income families that deserve it.
That's
Which
right.
families don't deserve health care?
Well, if you're a 30-year-old unemployed, three-pack a day smoker, I don't think you should have free healthcare. I don't think I should have to pay for your lifestyle. So, it would need to be people that are trying to be gainfully employed, are healthy, maybe even drug tested. If I'm going to give my money to somebody else, they need to prove that they are trying to better themselves, in my opinion. You can't just hand out money to everybody.
Well,
They'll lose
Leonti,
incentive.
I'm curious. Do you share this opinion?
I think it depends how you handle it on a policy level,
How would you
because
handle which families get health care and which families don't deserve it at all?
I think, well, if I were taking the stance that everybody should just have healthcare as a right, which I don't know, I don't necessarily hold that position. But if I were taking that stance, it would probably be in the way that some of the other countries that offer it have, which is higher taxes on specific items. Because one of the things about healthcare that's really important is preventative care. That's something that really, really needs to be emphasized when it comes to costs, because preventing illnesses before they happen will keep costs down for everybody. So I like I said at the beginning, I don't know specifically how these countries do it, but I do know that countries like France impose taxes on like unhealthy stuff, higher taxes on like smoking, things of that sort, and some of that goes to supplement their healthcare systems. So if I were to take that approach of everyone should have it, that would probably be the way it would be rolled out, is put higher taxes on things that have an effect on health.
I
Can
would
I
love
expound
to
on what I was
address
saying,
that in
Wick?
Killian's point. Hold on, real quick.
Okay.
I don't want to get
Okay.
too far from what Killian's point was. So the data. I want to reiterate that I said they're going to drill in on really specific things we do better, and we do some things better, absolutely, but we do most of it worst. So real quick, you can see my background here, Wick. If you want to make that bigger, you're welcome to, for the chat or for whoever. This is GDP per capita and health consumption per spending per capita. So what you're going to see here is both our health spending at a personal level and our GDP allocation are really high. There's an outlier. That green dot is the outlier. That's the United States right there. So when we have these conversations about can we do it? Well, absolutely we can. Absolutely we can. We're among the highest spenders in the world. Let's go on to one more slide here. If I can get
How
my
many slides
Discord.
you got, buddy?
Two.
Okay.
I have
Because that's something you'll
responsible
let me do.
afterwards.
Yeah, of course. After your, well,
So
maybe go
we
ahead. If you got your other slide ready, we can't see.
Yeah,
Okay,
so
there we go.
so so we've got these claims on here that they're just assertions with very little backing, which is like, oh, the USA is amongst the top in the world. We're not. Here's your top 8 right here. It's actually a top 10, but Discord won't let me get it in there. The USA is not in the top 10. Do you know where we are? You know where we are? We're 30. We're 30. Do you know what these countries that are leading
30
this
and what?
list?
Yeah, can you
It's
give
an
us some
overall health
context,
index.
just
Sorry,
just
I'll
real
go back
quick?
to the first one here.
Overall
Can you
health
give us
index.
some
Okay.
context at what like metrics?
Absolutely. This is
Okay.
this is
think we-
data
I
from the
think we- I
WHO.
think-
This is data from the WHO. And what you have here is a healthcare index score, and it takes into account a ton of different metrics, and then they give it kind of an aggregate score, and you can see some of the little breakouts that they're tracking beyond that there. But effectively, what you notice here is all of these nations that are ahead of us here in this top 10, they have some form of socialized healthcare, some form of universal healthcare. They're 100% covered, right? And there
Yeah.
are nations that do a free market model, but they do it a little better than us, that are more successful. But for the most part, every single nation in the top of the world standard for healthcare, they're using universal healthcare. And so when we make these assertions, Killian, like, hey, our healthcare is way better, we need to be able to see that on the macro level. And what does that look like? I can turn off this slide here. I'm done with my slides for now. What that looks like is your life expectancy, right? Life expectancy would be a major contributing factor, but our life expectancy is lower. And you may say, well, we have some cultural things here. We have gun violence.
Exactly.
We have
Yeah.
diabetes and obesity.
We have
Well,
horrible
great,
people. We're
but there's
unhealthy.
still a problem. There's still a problem in the other long-term macro metrics here. We still have problems with prices of prescription drugs across our nation. We're almost double the other comparable nations. We have
So cap it
problems
at
with
40%
our
profit.
health insurance access as far as like the number of people that are actually insured. Like it goes on and on and on. There isn't a big macro that you can look at with this data where we're leading the charge. There simply isn't.
I think we're unhealthy due to culture, not healthcare.
But I
It's the
can't have a
culture.
healthcare conversation with you about culture. I want to have it about healthcare.
Well, I mean, we are an unhealthy nation. I mean, it's proven out time and time and again. And I simply don't believe I
Do
believe
you
that's
think
lifestyle.
pharmaceutical
I think
companies
it's
have double
lifestyle.
the
Hey, let me finish.
profits?
Let me finish.
Yeah,
I think
sure.
it's lifestyle more than the actual healthcare system. And I do agree, pharmaceutical companies are charging too much. But you can cap that at 40 or 50% profit, right? You
Sure.
could
I love
probably
that.
do that. I'd be okay with that, right?
Yeah.
I mean, a business, they're in business to make money, and they need to be able to have a pretty hefty profit in order to do research and develop more medications for us, right? So they have to have some sort of profit margin to be able to continue their work. Yeah, respond.
No worries. No worries.
Go
Um,
ahead. Just real quick. I know Lactoid wanted it, and he had a few
Was there?
disagreements.
I have a few
Go ahead.
disagreements, Falsers, but was there a specific point there that you wanted to disagree with, or can I make some?
no, I was just going to add a very quick addendum that any of the data that I'm citing tonight is coming from either the WHO, the Peter G. Peterson Foundation, which is the centrist organization, or the actual like World Bank that the UN uses for data aggregation.
Gotcha. So when you said before, I'm here to discuss healthcare, not to discuss culture. One of the issues is that the health index that you're pointing to, a significant portion of that metric that you're using to demonstrate that the U.S. is more unhealthy, one of the metrics here is health-related behaviors and personal circumstances. This is one of the primary issues when it comes to cross-country comparisons. Generally speaking, cross-country comparisons aren't good, like for most things, but for this is no exception, right? There's plenty of reasons why cross-country comparisons are going to be an issue here. One of which was already pointed out. Americans tend to be less healthy in terms of obesity, in terms of drug consumption rate. Americans consume more drugs than I'm pretty sure anywhere else in the world. Life expectancy is 77, but most of that drop came after the fentanyl epidemic and the drug epidemic and the opioid epidemic. And that combined with obesity and combined with alcohol consumption could have something to do also with the rates of chronic disease. Now, there's a whole bunch of reason. And by the way, when you look at those specific metrics that you were talking about, if you wanted to get into like the nitty gritty about the specific points, it's really not clear why any country ranks above another country when it comes to like success rates in just treating certain cancers. Yes, America is near the top in some. Yes, they're not near the top in others. But even among other countries that do have universal healthcare, they also seem to indicate the same sort of randomness when it comes to where they wind up in the cancer treatment categories depending on cancer. So I somewhat reject cross-country comparisons here as being definitive. I'm more interested to see what would an American universal healthcare look like. And one of the statements made as well, obvious, it's just obvious what this is going to look like. It's going to save us money. But this data is not clear. There are economists and there are institutions that have reviewed this, and American Medical Association is one of them that is not in favor of universal healthcare for one of these reasons. Which
I
is
wonder
that,
why.
which sure you can say that they're biased or whatever. I mean, there's plenty of economists as well that challenge the efficacy of universal healthcare. Kenneth E. Thorpe from Emory found that if implemented, if the current universal healthcare programs proposed were implemented, about 2/3 of American households would be paying more overall. Even the overall tax burden on them would be significantly more than
Lacto,
the
can we pause for a second because we're getting really far from your very first point, and I want to get to that before the other three come out so I can remember them. Just to
Sure.
be honest with you.
That's fair enough.
So your first point was on lifestyles, the fentanyl epidemic, all these factors that ripple out as a person lives that might be variables that impact the age at which they pass away in terms of life expectancy. Is that a fair characterization of what you were talking about?
So life expectancy takes into account like a whole bunch of different things, but if you have
Right.
people dying
We agree.
young of like opioid overdoses, that's going to really cut down the life expectancy.
Right. So we're saying the same thing here. That's fine. So then we need to agree that there might be some other data points we should point at to measure these things other than life expectancy. And I think that's great. So let's talk about infant mortality. And usually when infant mortality comes up, the rebuttal you get is like, well, the countries count them differently, which is precisely why I decided to use data from the WHO, which did the study with a consistent counting method across all countries. And what we find with infant mortality is we're nearly double the rates of other countries as of 2016. And it's only trending upward in the other data I could find as far as the gap between the two. So when I talk about other countries, just for a point of clarity, as I say comparable countries, what do I mean by that? I mean countries of similar economic development and status
Just
and similar infrastructure development.
just for clarification, for my clarification, because I'm not terribly familiar with infant mortality as a topic, but is the argument that you're making, falsers, just to be clear, that in America, because of lack of access to healthcare, we have a higher infant mortality rate? Is
That's
this
part of it.
connection that you're
That's part
drawing?
of it. Yep. So it goes back to the three pillars I built my position upon. Access is one. You're going to have less people going into the healthcare system on the basis of access, just at face value, right? And then the financial component is the second part of that. And that's tied to the first one. So if I am sick and I'm not super concerned at the moment, I'm less likely to go to a doctor if I know a big bill is coming before I have serious conditions. And we see the ripple effects of those outcomes. And then the third thing that we talked about was the long-term outcomes. So that goes into some of the macro data. But again, our infant mortality rate is nearly double comparable countries on these issues. And so when we talk about the quality, I'm making a qualitative argument against our healthcare system right now. When we talk about the quality of our healthcare system, it simply does not follow the numbers at scale. And again, Killian, you're very astute. I would do this too if I was on your side of the aisle to point out there are things we do really well. But in the grand scheme of things, we simply are not serving our citizens on a qualitative basis when all the
Sure.
ingredients are in the pot.
Kara, Lactoid, a couple of things. I want to get Leontes in here too, but Lactoid, finish your
Sure.
back and forth, and then I want to see if Leontes. I have a couple questions for him
Great.
as well. So.
I wanted to quickly address this as well, and this is another opportunity to demonstrate why cross-country comparisons are difficult. So in the United States, 98.4% of all births are done in a hospital. We're only less than 1% are born at home, and even less than that are born in any other form of birthing center. The vast majority of babies in the United States are born in a hospital, and this number is relatively comparable compared to all other countries in the OECD average. Now, what are other things that we know contribute to a high infant mortality rate? Obesity and drug use. Wow, two metrics that once again the US leads the world in. That we do have an issue with lifestyle. I do not deny this. But this idea of access, the reason why is because women aren't able to access hospitals, just does not seem to be empirically borne out in the data. Once again, this is why I think cross-country comparisons are an issue and why I'm interested in as to the actual analyses of what would happen in the US if universal health care was implemented. Like I pointed out, there are economists that find, and this is, I find this relatively credible. You might disagree. Roughly 2/3 of American households will see an increase overall in expenditure. How is this the case? Well, the reason is in America, only 5% of people use up about 50% of all healthcare costs. 50%.
Quickly though. Given that, even if that's true, and I'll accede to you that it is that the healthcare costs will rise, if it is coupled with a rise also in qualitativeness of care, is that not worth it to some? Is that not a fair trade-off? Saying, well, yeah, we'll pay more, but more people will have
It's not
access,
a real
and
trade-off. at all. It's
Hmm.
not even a real trade-off is the
But
problem.
do you understand what I'm saying here, though? Like,
understand the
if
question.
cost, right, cost rises, but also quality rises, then what's the issue?
But we already spend double of like every comparable country in the world. This is nonsense. So a lot of times these economic studies are framed in the sense that like it's the system we have and then we build a socialized system on top of it, which is a really disingenuous way to frame it in the first place. We spend double per capita what countries that are already doing this are doing. And I love the economic discussion as well, because we have a serious issue in our healthcare industry with regulation. And you see it left and right. You see it in the macro scale at pharmaceutical profits. You see it with insurance profits. But there are some really good case studies for this too. You can look at the fact that in November of 2018, Aetna Insurance, which is one of our biggest providers, was purchased by CVS, a pharmaceutical provider. And prior to 2018, the quarter over quarter economic growth for CVS's pharmaceutical branch was about 10-ish%. It exploded in the next 9 months to over 100% for the first time in that company's recent history. And then it went on for the next 2 years to do 100% again, and then the next year. And so the reason for that is because when the healthcare insurance company has no regulation over it and they are able to buy the pharmaceutical company has no regulation and they're able to buy the insurance company, they're able to price fix and have preferential treatment towards those brand names. On the economic scale, we look at something like insulin, where Eli Lilly had a over 5,000% markup on their manufacturer prices. And it only took the threat of a standardized insulin price, an insulin price cap from the Biden administration, and they brought it down to like under, God, I forget what it was, but it's like $30 now or something. They brought it down under $100. I forget the exact numbers, but they brought it down significantly. It was like a 70% price cut they did to it. So the economics are not an issue here. The regulation is an issue here.
Well, you make a great case for reforms on the pharmaceutical companies, right? I agree with that.
Yep.
I think they do need some sort of reform, and I think they do need some sort of regulation. But that's still not the case for national healthcare. That's what we're talking about. We're not talking about.
Hold on, they're one and the
pharmaceutical
same, Killian. So I
No,
want you to
no.
understand what I'm saying. The
So you want a
pharmaceutical
government?
companies
So
are
you want a government?
buying the healthcare insurance companies.
So
I want you to understand that.
you want them to take over pharmaceutical research and development and all that as well?
Well, they already
The
do.
federal
Every
government?
pharmaceutical advancement we've made in the past 20 years has been taxpayer funded. So that's not an if, that's an am.
Yeah,
Like
but you want them to
that's
run the
already happened.
business, right? You want them
No,
to
no,
run
no,
the
no, no, no,
pharmaceutical
no.
company?
You need to understand the regulation, and my position on this specific thing is that the regulations should be such that pharmaceutical companies cannot own health insurance companies. That's a very clear thing to me that we need to do. But
makes
the fact of
sense.
the matter is, having a system in place where there is a government product that covers everyone at a baseline is a good thing, and anybody that's pro free market should love that because it's a very anti-monopoly practice. And remember, I'm not anti having a private option. I think the private option is great. The number one healthcare system in the world in terms of the macro metrics is South Korea, and they have a private option, and that private option is incredibly popular, by the way. It's
I
just the
think the
fact
South
that they
Korean government
have a
is
universal healthcare option too, supporting it,
yeah.
that makes it so successful.
The South Korean government, I think, is probably way more efficient than our federal government. Like, I think you could look at their infrastructure, take streets, roads, trains, all of that is significantly better than what we have in the United States.
$5.
So my whole contention, huh?
Oh no, $5 from Muda Agaro. Sorry, I got to make my money, right?
That's
We're
okay.
talking
Go,
about private industry.
hey,
$5.
Whick needs to pay his health
True,
insurance bill. Come
true.
on,
$5
Twitch
from Muda
Primes.
Agaro to say, worrying about how billion-dollar companies and trillion-dollar government can save money by not providing adequate insurance is the most America-brained argument ever. And gang, we're coming up on the end of the month here, so if you guys want to contribute, and you're on Twitch side, gift those subs, gift those bits, get my money up, gang. And if you on the super chat side, on the YouTube side, like, subscribe, throw me some super chats. I'll try to get them in there. But finish your thought, please,
I'll
Killian.
give some. I'll give some when I'm. I'll give some afterwards, Vic. I'll get you to take care.
Okay.
What was I talking about? Oh, what I was talking about was government inefficiency is the biggest thing for me, right? I don't think they can efficiently run a national healthcare system. They've proven time and time and again how efficient they are with our taxpayer money. Me personally, I paid 6 figures in taxes for 2022. I don't want to be taxed anymore. right? It's absolutely ridiculous.
We don't have to though.
And I think I do. I think they're going to raise
Six
taxes.
figures.
That's
No, again, we
Yes.
have
They are.
double the amount of
Yes.
spending already. If these systems are regulated properly, there is simply no need to raise taxes. In fact, if you look at the amount of taxes that these big healthcare companies receive, it's already fucking obscene. There are primary insurance companies where like 70% of their funding is right now tax money. So you're already paying them, just so you know, with your tax money, and then they're charging you so-called free market prices on top of it because we don't have regulation in place to stop that. My position is that if you take that tax money, you enter into an agreement that you do not need to charge us full price as citizens for those services. It's absurd they're allowed to do that, and it really skews the economic picture in such a way that makes it look like what you guys are describing, like, oh, well, we can't pay for them. Of course we can. We just need to regulate the companies that are R-wording the consumer left.
I would bet the farm that if they pass universal health care, they will raise our taxes. Period. There's no. I don't. I mean, I don't. You're delusional if you don't think that's going to happen. They are going, and especially on, higher income earners, which I understand that part, right? I've been fortunate enough, but you know what? I worked myself up from. We were dirt poor when I was young, so. But the issue is the federal government cannot sufficiently run a national healthcare program. They can't run the military correctly. Our infrastructure is terrible. Our bridges, our roads are absolutely awful. Somehow we don't have our train system, right? I mean, go to any other country. Travel to South Korea.
Wait,
travel
Killian,
to Europe.
Killian, I'm not here to
just real
pick
quick,
with-
just real
Yep,
quick,
go
just real quick, Killian. What do you mean we can't run the military efficiently? We are the strongest military in the world.
Well, we have a
We're
ton
like
of
fucking
bad
number one.
military spending.
They don't know
He's
where
right. I agree with
the
him.
money is. They don't know where the money is.
Yeah. So, Killian, here's the problem, though. I'm not here to advocate for a specific politician
hang on,
or
Mike,
even
we'll
a
get to that.
specific party instituting these policies, right? I'm here to advocate for a system that I think would be effective. And then it becomes the responsibility of the people in the government to figure out how to make that work. Now, if you want to have a conversation about how we can make it work mechanically and legislatively and all those things, we can do that too. But I'm here to advocate for the best system, not necessarily the competence level
The
of
best
the people that
system
you're
to me is that the best system.
No,
Sorry.
finish your thought, but then I have a couple things. Go ahead.
The best system to me is that we give subsidized. We've proven we can give out money, right? During COVID, right? We passed out checks all over the place, right?
Mhm.
So what I think the proper way to do this is that people that are low income underneath a certain income and are also trying to better themselves, they don't smoke 3 packs of cigarettes a day and shoot heroin, right? Should be able to apply and get a subsidy from the government to pay for monthly health insurance. But I think they should be paying for private health insurance.
But to be clear,
And
only if
private
they
doctors.
deserve it.
Only if they deserve it.
Only if they deserve it,
correct.
which is
That's right.
interesting sticking point. $5 from Muda Agarwal to say, Killian, your taxes will be raised, but you'll be able to get more out of your healthcare. You spend more, but get much more in return.
It simply isn't true that we need to raise taxes. Again, you look at the number one healthcare system in the world by the
I
macro.
under-
Whether it's
understand,
needed
Paul,
or
sir.
not, they
Understand?
know.
Hold on.
We can get more people in here,
Korea,
though.
South Korea only has about 5% tax rate for their healthcare system, and half of that is burdened by the employer. It's 2.5% to the employee. The United States, we're at 17% of our taxes and our GDP goes to our healthcare system right now.
Medicaid.
We need to streamline and make the spending on this.
I want to give more people some space here. Leontes, I'll pass it to you first, and then we'll pass it to Lactoid, and I'm sure you both will be addressed in some of these. Go ahead.
Yeah, so we're talking about a lot of different countries and stats, and I appreciate all that. But I would like to, if you do talk about these other countries and how their systems work, you cannot ignore the lifestyle, the other factors that go into. You just can't. And you set yourself also said you don't want to go there, and I agree. Let's not go there. Let's focus on the United States, what we can do in the United States to provide healthcare to us in the way that we need it and the plans that would best fit our needs. And looking at the United States, like I've said, my argument is that yes, if we could provide quality, competitive health insurance to every American, let's do it. But we can't. because we have programs that are set out to do that and they can't. To be honest, Medicare, not that great. That's why most people who are on Medicare have supplementary private insurance.
So I appreciate that you're taking that tact on it, but I don't agree that we shouldn't talk about these things. That's not my position. I want to be clear on that. We absolutely can talk about these things. My problem with these things is they're a smokescreen. So like in the big picture, I want you to imagine like all the data sets are like a wheel, right? And the wheel has different spokes coming into a center point. And unfortunately, all these spokes on the macro level are kind of telling the same story. And so like you can say maybe lifestyle and validate 1, 2, 3, 4 of them. But when we're talking about all these metrics collectively, that's a hard sell for me. But let's grant it. Let's grant that. I just want to grant it to you outright, even though I don't for the sake of the discussion. Let's say the lifestyle is a huge problem. Well, we're still back to needing some socialized healthcare and some regulation because the lifestyles we have don't really impact the prescription drug costs in terms of like manufacturing profit margin. And we are paying more than double the average cost of prescription drugs. It's on average $963 versus
Is anybody arguing about that? I mean,
466 in comparable countries.
sorry, Foster, but
Hold on. It's relevant to what he's saying. It's relevant to what he's saying. He's not arguing the specific point, but it's relevant because that's not impacted by lifestyle, right? This is impacted by the fact that healthcare insurance companies and pharmaceutical companies operating in the name of the free market have run all over our nation and put our healthcare system in the gutter. The fact is, in the 80s, when this started, Reagan deregulated our system in the 80s, and we saw our GDP move to more than double in terms of allocation spending over the next 10 years, and it has since almost quadrupled since the 1980s, since we deregulated. And healthcare satisfaction amongst our citizens is far worse than it was then. Healthcare quality is far worse, and we're seeing negative trends. And the positive trends we are seeing are moving at slower rates compared to other countries of similar development.
Lacto, do you agree that the pharmaceutical companies make too much money? They charge too much?
So, no. This is one of the issues again with cross-country comparisons, where well, look, the United States, the pharma costs are very high. Well, also look at the fact that again, if we want to do cross-country comparisons, which are not perfect, the U.S. also has the highest medical innovation in the world, including for pharmaceutical drugs. The United States manufactures, develops, and invents far more pharmaceutical drugs than any other country. Why is
Taxpayer
that?
funded too.
So look, a huge part of the money that they get for R&D comes from the fact that they are able to bring in profits, right? There is like a market effect here. Now, I don't know the exact split. I'll be honest with you. I don't know the exact split of what taxpayer dollars are going to the pharma companies. If that is happening, then no, I think that they should use the profits that they make to do R&D without taxpayer money. But nationalizing it sure doesn't seem like the solution to reducing taxpayer money involvement. That would just seem to make it at 100% taxpayer funded, correct?
So
They
let
will raise
no.
taxes. They
So
will,
let's walk through it.
100%.
Let's walk through it because again, I'm for the private option on this. So it's not 100% taxpayer fund. But when you say pharmaceutical companies don't have these crazy profit margins, I want to take you back to one of my earlier points. Eli Lilly had a over 5,000% markup on insulin that evaporated in like a week. They were able to make a 70% cut to their rate on a whim and still be incredibly profitable. Do you think that's problematic, or do you think that over 5,000% margin they were getting is appropriate to the rising epidemic of diabetes we have?
I think when you so it's interesting how you are concerned with taking like snapshot examples, but this is an example where like you are doing the same. You're taking a snapshot
Let's
example
zoom
of
out.
Eli
I
Lilly.
love that you called me out of that. So let's zoom out on it.
Sure,
Let's zoom out.
Sure, I would like to zoom out. Now, one of the reasons why I think that's we look at the whole picture is how many of these fucking pharmaceutical companies fail. How many of their drugs fail? I mean, if you know anything about like pharma investing, it's one of the most risky investing in the planet, and it's one of the most engaged in because there's a massive opportunity for returns, and that's why there is so much money being funneled into the pharmaceutical industry, and why we have the number one innovation rate in the world. But then, yes, like when there is a success, you have to have like a large amount of return Otherwise, no one's gonna fucking invest because the vast majority of the time,
I
the
want to
drugs
I want to
are
ask
illegal.
about
Not true.
this. So
Hold
two
on,
things
that
first
problem
before
didn't
before you respond. Two things first. $10 from Temperance Quill to say it seems that most of the panel is against federal health care, but what about taking it down to the local level, having each town, city, county, whatever, instituting a state or community or citywide kind of owned health
Yeah,
care? What do we think about that?
I love that. Yeah, I
Love
love that.
that. What do you
Yeah,
think?
yeah. I had an
No.
employee.
Mm-hmm.
That I did this for on a local level. Right. He was going through some problems, some alcohol problems. Right. Didn't have
Okay.
health care, and he needed to go to rehab. So I was able to. This is on the local level, and I would do this. Right. I think it's. I think it would be much better. I was able to pay for his rehab. I was able to help his family pay their bills. Right, for almost a year while he got back on his feet. I paid for their health insurance for a year. Now he's got a $30 an hour job working for the railroad, right? That's the kind of thing, if you do it locally, like I would like to keep more of my money rather
Sure,
than
if
send it
he
to the government
deserves
that's going to
it,
spend it
right?
wrong. That's right.
Okay.
You seem to have a problem with that. You don't agree with that, I guess.
I don't like that phrasing. I really don't, but I'm not on the panel. I'll engage with you later, but I want to so Lactoid, you were shaking your head, right? You were saying no, that's not okay. Why?
Well, I mean,
Why would a town or a community getting together and deciding to kind of pool their resources to pay for
That's a great
everyone's
idea.
healthcare be bad?
so I guess we don't have the empirics on what that would look like. So I would be opposed to it on like a principle basis of this should be something that, like with all other forms of labor, is privately and consensually negotiated for. I don't think that.
Well, I
Let,
love how the
let me
data
clarify.
matters for that, but
Let me
not for the
clarify.
other
Let me
things.
clarify.
Hold on. I don't want to get too far from what Lactoid said,
Hey, hey, hey,
because he touched on pharmaceutical companies real quick, and then
Real quick, $5 from Time Watch to say just voting my wallet for more panels on topics like this. Okay,
I
Oh,
need
yeah.
to say
Okay.
one more thing though. That I've been dying to make a point. So after the pharma point discussion, I just need to say one more thing.
Yeah, so you laid out an argument that these pharmaceutical companies need these margins to get investors, but it's just fundamentally not true. If you look at the pharmaceutical companies, generic drugs make up 92% of the drugs distributed, but they only account for 16% of the total cost going into the pharmaceutical economy, whereas the brand name drugs are 8% of the distributed drugs, and they're making up for 84% of the cost. And these generic companies are perfectly profitable. They're big businesses with
thank
tons
you
of
for the gift subs,
employees.
Killian.
And so it's just not.
They're
Again,
not making those profit margins though on the generics.
obviously, they're not making the same margins, but they're
Not
making
anywhere
margins enough to
close.
stay in. Obviously, if the margin is 5,000%, it's not anywhere close. That's the point. It doesn't need to be anywhere close, and they're still able to get investors. They're still able to build a business off of it.
No, it's
Your
not.
entire argument hinges upon letting them have the world's highest profit margins
This
at the expense of our our citizens that have double the actual cost for
so
prescription.
generics don't take R&D because they're generics, right? The reason why the brand names are going to command such a higher price is
Hold on, you
because
don't think generics do R&D?
no, generics aren't R&D. They're generics, right? They're not like brand new research. They're usually older drugs.
I understand, but those companies still do R&D. You understand that, right?
I understand the companies that own generics do R&D, but they're not doing R&D on those generics. They're doing R&D on some new drug.
Not on that specific thing, but
Well,
the
of
point
course
is
they're
you
doing
can
on the
clearly-
new drug that's going to be at
Hold
a
on.
markup.
If they're all doing R&D, right? It doesn't really matter if it's for that specific drug or not. They're all doing.
Because that's the percent. The massive percentage profits that you're looking at, those are going to be on the new R&D. That's going to be on the brand name drugs that are on the forefront that are contributing to the United States having the number one medical innovation rate in the world.
All these companies are doing R&D, and it's specific companies across all their drugs, these big brand names. It's not like one drug. It's across all of them amongst a few companies that are ratcheting up these margins. And we don't see a correlation in the amount of R&D that they're doing to justify the marginal difference. It's simply not.
Why are you saying, like, do you know that for a fact? I mean, we live in the United, like I said before, the United States, if we want to do the cross-country comparison, number one medical
This is
innovation
in
rate
the
in the world.
United States. Yeah. So
number
just
one
without
medical
getting
innovation
like
rate
too
in the world.
detailed about my without getting too detailed about my own life, because we're on the internet and there's an audience. I work in an industry where we deal with insurance carriers, we deal with general agencies, we deal with brokers, we deal with healthcare,
So do I.
we deal with we deal with all those things. So yes, I'm deeply in it every day with work, and I can absolutely tell you that their profits have exploded in a way that is not on the same trajectory as their research contributions.
Okay, so I mean, I guess that's an unfalsifiable point. If we don't want to get into it, that's fair. I'm also work with these organizations and these people. I think it's a lot more complex than you're putting forward.
Hold on.
So
Do you think that
I
CVS Pharmaceuticals expanded their R&D budget by over 500% in a year?
There's again another. That's not what that means, right? Again, another hyper-specific point, but that's not what the point I'm trying to make. What the point I'm trying to make is that one of the reasons why there's such an increase in investment in brand names is because, like, whether or not the drug is going to work is kind of a crapshoot. It is, right? And this is why farm investing is one of the most risky investing you can do, like in stock investing, because there's a great chance that your investment's going to flop. And if it happens to work, if they happen to come out with a new drug, it's going to soar. And that's what leads so much money to be pushed into the pharmaceutical industry to begin with. And one of the reasons why, again, we have such a high medical innovation rate.
Let me
One
ask.
thing I just want to say.
The dying point. Go ahead. Get the dying point. Go ahead.
Thank you so much. Okay, so one of the points, and when I pointed out that, like, several economic analysis stated that more people, 2/3 of Americans, would be paying more overall, and this was just repeated. Well, we actually, on average, pay the most. Well, so again, in the United States, 5% of the population makes up 50% of all healthcare spending. Right? There absolutely is, like, the bottom rung of unhealthy people, whether through genetic reasons or for lifestyle reasons, especially when you look at the obesity rate, they eat up a tremendous amount of spending. So when it's not, you can't point to the average healthcare spending as evidence that most Americans are not going to actually pay more. People who back universal healthcare, even Bernie Sanders, has admitted, yes, we will have to raise taxes. The only debate is whether or not the tax increase is actually going to be more than the savings from insurance premiums and copays. That's the only real question at play. And
I don't agree with that framing.
Okay, well, so you disagree with Bernie Sanders and Elizabeth Warren then? Okay, sure.
I do.
You disagree. Okay, fine. But what the economic analysis that I've seen indicate that for most Americans, for 2/3 of Americans, if universal healthcare is implemented, they are going to be paying more overall. They're going to be having less money in their pocket. And the people who use up most of the healthcare are going to be paying a whole fuck ton less.
So, Lactoid, while I disagree on...
Before you respond, $5 from Muda Agarwal. At Lactoid, why are you defending these companies? They are not living on the edge financially. They can afford R&D 50 times over from one successful drug.
No, people have this, like, bizarre idea of, like, capitalism where, like, I'm a little guy and all these companies, they're, like, controlling the world. They're all these massive, can't be touched. It's like, no, like, companies go under all the time, especially pharma companies. They take hits all the fucking time. It's difficult. And unless you're talking about, like, Pfizer, like the giant fucking companies that, like, roll out these massive, like, nationwide drugs, they're probably doing okay.
I agree with you on most things, Lactoid, but have you looked at a balance sheet of a pharmaceutical company, a successful pharmaceutical company?
Yep.
Like
A successful one or an unsuccessful one?
A successful one. Have you looked at their balance sheet?
I'm sure the successful ones probably have a pretty good balance sheet.
But go look at CVS. Yeah. Killian's absolutely right here. Go look at the CVS example. Go ahead, Killian. I didn't mean to cut you off.
Yeah, I mean...
Are they making new drugs? Are the successful ones making a whole bunch of new drugs?
They are.
Interesting.
They are.
Interesting.
This is okay. Stop. This is survivorship bias. Of course, the successful ones have good balance sheets and are making good drugs. But what the thing is the unsuccessful ones. Like, how I would want to know, and I don't know if any of you have this stats. How many pharmaceuticals go under? What is the percentage of failed companies? That's what I want to see.
Well,
because if only 1% of pharmaceutical companies actually succeed, then that's a factor, right? Like.
Over 90% of clinical drug development fails.
That's almost every industry. Like, startups fail everywhere. That's not specific.
Look at their balance sheet.
This is significantly higher. This is significantly higher.
It's the same in, like, the fucking tech industry.
Look at their P&L and a balance sheet.
Anyway, so, like, look, if you look at the companies that aren't, like, radically successful, as you're putting it, as far as, like, developing drugs, but they're still successful. They don't have to have these margins. You can run a successful pharmaceutical company without a 5,000% margin on your medication. That's obscene. But let's zoom out again, because while I disagree with all Lactoid's points, my bigger point here is we need to look at things in totality. Not just the pharmaceutical companies, it's the healthcare companies too. You want to worry about research and development? Great. We do a lot of that in our hospitals. We do a lot of that in, like, the setting in those spaces for grants for research and with grants for research and development. And unfortunately, insurance companies are also destroying our hospital budgets too. Insurance profits for during the COVID epidemic went way the fuck. right? And they were going up before in a really sharp way too. So Cigna, our biggest insurance company in this country, saw a 70% bump during the COVID epidemic. United Healthcare almost 30%, Molina 60%. Hospitals were moving in the opposite direction because what was happening is these insurance companies are raising all these premiums, and people are going in for legitimate reasons. Then the insurance companies, because they're not regulated, they are denying legitimate claims. Hospitals are now stuck with the fucking bill. That money's got to come from somewhere. So they're not able to attribute as much as their budget to like research and development. Everyone says that they care about the qualitative healthcare in this nation and finding solutions. But the clear thing that all the data points to, both in our country and outside of our country, you guys don't want to do it. And it blows my mind.
Okay, $10 from Muda Garwal, who is single-handedly funding my YouTube side, and I thank you for it. Like, gang, this is how you put your money where your mouth is. If you like this content, if you like these topics, you got to keep giving me money. Muda Agarwal is a hero, and we love him. And he's saying, at Lactoid, if pharma companies were going under all the time to develop new drugs, we wouldn't have new drugs at all. The cost of developing a new drug is way less than the profit you get, including failed drugs as well. That's what he is saying.
All I have to do is look at a balance sheet and a profit P&L statement. That's all you have to do. And you can see what kind of margins they have. That the P&L includes research and development. So
why are you
can
dictating
see what to put.
Why are you dictating what a successful company gets to make?
Because there's human life at stake. That's the answer to that. Because there are lives directly connected to these margins, and the availability and access to healthcare is a direct ripple down effect of that.
Do you think
So if you're talking about, if you're talking about
farmers make because they provide food which is necessary for survival,
They do if they were withholding their food as the people were starving because they wanted a 5,000 margin compared to like a 200% margin. Yeah, I absolutely think that would be appropriate.
So farmers don't get to sell the food for what they think it's worth.
Not if you're
Price
marking
controls.
it up 5,000% and all the farmers are getting together and agreeing like, hey, we're all going to have this kind of market direction and trajectory and we're not going to make options as available.
I mean,
and like this is
generics are constantly competing, and once the patent runs out for brand new
not
drugs,
enough
they
clearly
go into
because we have an access problem. It's not just the pharmaceuticals too though, Lactoid. You got to understand like all these things are connected. If you look at the insurance companies, let's get out of the claim conversation. We have 5 times the level of administrative costs with our insurance companies for comparable countries. Our average administrative cost for an insurance company on a claim, it's around $1,000. A normal country of our similar development and economic place is about $200. We have by far the highest in the world.
With the cross country
Lactoid.
But you can't just minimize all the evidence by saying, "Well, I don't like."
I'm minimizing the cross country. We've
We've
already addressed this.
Comparisons. You don't like those either.
No,
so
we've already addressed the cross country comparisons, right? We've already addressed this.
No, you've dismissed them. You haven't really addressed.
There's plenty of reasons why healthcare costs are going to be different in other, depending on what country you look at.
Do you think diabetes are driving up the administration cost?
Who is spending? I mean, who is buying the healthcare as compared to who's receiving
Do you think the
it
opioid epidemic
is going to
private
depend
administration
entirely
costs?
depend on country. My question for you, Falsers, is why
Do you think obesity gives us 5x administration costs?
It can. Absolutely, it could.
No, they're admin
You
costs.
don't know that. There's a million other factors that go into whether.
You understand that?
There's a million factors that go into determining what the actual expense is going to be.
I don't think you understand.
My question for you is why do you disagree with Bernie Sanders and Elizabeth Warren when they say, yes, we're going to have to raise your taxes a little bit?
Again, because our spending is already such that we have an allocation where if the industry was regulated properly, we would not need to raise taxes. We have a ton of wasteful spending. Killian was spot on when he pointed out the inefficiencies of our current government, both in the healthcare sphere and in other spheres. We need to regulate and tamp these things down.
Does any economist agree with you?
Two things before we go on. I gotta make my money, gang. $5 for Temperance Quill to say, why are we putting R&D of our medical care in the hands of companies with our tax dollars who then charge us for it? Second thing, $5 more to say from the same person, Temperance Quill, to say why is that R&D not being done by universities and health organizations who aren't looking to make a profit?
The simple fact of the matter is the private company is going to do it much more efficiently because they're worried about profits. They're going to attract the best. They're going to attract the best mind. Listen. That hasn't been about capitalists, right? In all other areas except for food and healthcare, I agree with you, Lactoid. I also don't agree with Falsers that we need nationalized health care because I think it's going to be a disaster and it's going to cost me more money.
It will cost you
so
more money for sure.
absolutely, it will absolutely cost me more money. So I'm kind of in the middle here, right? I just want to say that. I mean, this is another thing I want to bring up. Do you know what a doctor in Britain makes when they first come out of medical school? A year?
I don't
30
care about
grand.
British people. Just
$30,000. Okay, that's barely enough to pay to live on, right?
What about one in South Korea? Spoiler alert,
I
it's
don't,
140K.
I don't know. You tell me. What is it?
It's 140K.
Well, that's better, right? That's better. You, you're not going to attract the best and the brightest minds if you're paying them shit for wages. So that's another. So is South Korea the only one like that, or is it? I think it's.
No. That's my whole point. Is we don't have to. The entire discussion is predicated on how inefficient our system is, and I love that you pointed out because we really agree on that. And so, like, we're trying to operate a system. It's like you're trying to build this like house of sanitation in a sewer, right? Like, everything's already kind of fucked from the get go until we change what we have around us. But we can absolutely do that. Some simple regulation would go a long way in this nation. And Killian, again, like you can point to like one country here, but if we look at things in totality, we're just not seeing the evidence that says like, hey, private companies are doing better because of. It's simply not true. We're having worse outcomes economically and quality in a free market system right now than universal systems are having. And again, let's offer that private option. I'm for that. I don't want to eliminate it, but there needs to be a baseline to have everybody a basic level of access. And that encourages these companies to work harder because they know if somebody's going to pay them and that person wants to drop and just go to government, their quality has to be better.
I want to
kind of really quick fact check.
Real quick fact check, but then I want to kind of dig into the pharmaceutical company and R&D more because I think there's an angle that we are not talking about, but absolutely should. But carry on.
The $146,000 that he brought up about Korean doctors, that's on average. It's not about initial entry, people just coming out of medical school. And in fact, in the U.S., the average pay of physicians is significantly higher. Some rates between 208,000, 260,000 compared to in Korea about 146,000.
Yeah, when that happens,
I said 140,000. That's not a fact check.
Yeah. So he asked about entry level. He talked about entry level. The total average pay in South Korea is 146,000. That's like the average, right? In the U.S., it's significantly
and that's
higher.
Still not great for a doctor. I mean, that's still not great for a doctor.
Right.
Interesting.
I mean, you can live on that, right? But it's still not what you would expect a doctor to be making.
Yeah. No, I mean that's fair. That's fair to call out, right? I might have misunderstood you, Killian. But the point still stands though directionally, right? So like the point you're trying to make, Killian, which I think is a reasonable argument to come at it from, which is like, hey, if we're paying better rates, we're going to have better physicians. Unfortunately, again, for that to be true, you need to see a qualitative difference in outcomes, and we just don't see it. And it is not enough to hand wave all the evidence saying like, well, our country's different. That doesn't account for every other nation in the world that's doing it different and better than us. Because you can find similarities in some of those areas, and you can find differences.
Let's talk about the other countries for a moment, because one of the things that it could be argued by Lactoid's team, if you will, is the fact that other countries benefit from the massive amounts of R&D that America does. The reason that they have such good access to healthcare and things like that is because they use a lot of the developments done by America, funded by America, invested by American capital in order to distribute out to these other countries who then pick it up and they're used in their systems, which are universally. So it could be argued, not necessarily my argument, mind, but it could be argued that America's research and development is what's the word? Carrying on the back these other countries across the finish line, that they are leeching off the system in that way.
How would you measure?
How would you respond to that?
How would you measure that assertion?
Simply by looking at what drugs they use to treat their patients, right? What kind of treatment in terms of cancer and other surgeries and things, where are those techniques developed? Where are the majority of those drugs developed in?
Here's what you would need to prove. You would need to prove that meaningful enough amount of them come from the United States as the leader, right? Because we're
Sure.
certainly the leader in like cost and everything and profit margins. And it would need to also correlate to the margins themselves as far as the weight that it had in order for that argument to hold enough water to be made here. And I simply don't think you could do it. Because the fact of the matter is, we have a world healthcare force right now, and all nations that are like, civilized and of similar economic and development, they are working on developing these things, and a lot of these research teams are multinational too.
Sure, we
So
can look at the COVID
like
vaccine as
I'm
an
going to be honest with
example.
you. I don't know if it's true or not, but I think it would be a very hard thing to measure or improve. And in that way, it's not an evidentiary argument,
We
and it
could.
runs counter to all the other evidence.
I disagree. I think it is a data point, right? Which it counts as evidence. Now you could say it's not sufficient evidence, and that there are
But
other
you would need
factors
to
in
show
play.
it.
And
You
that's
can't
fine.
just
Well,
say
let's look at
it's a
an
data point
example.
and it
Let's
counts.
take an example. Let's take the COVID vaccine, right?
Mhm.
That was primarily developed in America.
Yep, on
Yep.
tax money. On
Yep,
tax money.
and that's fine, right? But one of the reasons that we have the company, I think it was Johnson, the companies that were able to do it they exist because of the private investment and the profit margins that exist. They are incentivized. The market forces at play for these things to exist and have the infrastructure and the expertise that they do is simply because the primary reason is because of the capitalist system which America operates in. Is that not following? Does that not follow for you?
No, I don't think it does. I think
Hmm.
you've got a lot of assumptions in there that
Such as?
simply don't track. I think again, for you to say like, "Hey, this is empirically true," you have to like show the data behind it. But I agree that the United States led the charge on the COVID vaccine, but we didn't do that with the free market. That's the problem. You're helping my argument. We did that with U.S. tax dollars. I want to give credit to the Trump administration. In fact, I hope our conservatives love to hear that because what was it, Operation Warp Speed or something like that? That was one of the driving factors.
Not all
Seen.
conservatives like Trump.
Yeah, he.
Not all conservatives like Trump.
That's fine. That's fine. Hey, I'm with you. But he allocated a large portion of our resources towards that vaccine development and really streamlined it, right? And then a lot of people didn't want to take it anyway, but for the ones that did, it helped. But that was a taxpayer funded initiative. That was not a crown of the free market to wear and show off.
Okay, I want to get Leontes because he's been a little quiet, and I'm not sure if you have thoughts or not on this whole thing. What do you think? It could be about research and development. It could be about another topic. I just want to give you some space to get in here if you need. Go ahead.
Yeah, so I agree with Falsers and Killian generally when it comes to the research and development and the profit margins. I don't really have a problem with trying to get to the bottom of why, like they've argued, the profit margins are way higher than the cost of research and development. No problem with that. But I would like to drill down, like on Falser's vision for what Americans would be enrolled into in this universal healthcare. So if you indulge me, what specifically, like, are you a Bernie Sanders type? You want to expand Medicare? Is there a different kind of plan that you would like to implement? How would that look for Americans?
Yeah, so I'm not going to like put it in a box with a politician necessarily, but I'm happy to expand on it. So I think I really like the South Korean model. If I had to like pick something to look at and hold a mirror up to, and what they have done is, and this is an important data point. Something like 70% of the South Korean population, they utilize the private healthcare option, but they are far more satisfied with their healthcare than we are. Why does that matter? Well, it's not because I'm anti. It matters because what they're doing is they're creating baseline in their system, the government care, the universal health care that I'm advocating for. There's a universal option. Every single person is covered. Now, it's not always the best option, but what it does do is it gets you through primary care, gets you through like prominent medical conditions in that country. But hey, if you've got a condition that like you need a specialized T for, the South Korean government option often doesn't cover those things, right? And so they will use private healthcare to get access to some of those specialists. And it's working really well because the portion they pay for their universal care is pretty low.
Just
Again, it's
FYI,
about
Falsers, you're
2.5%.
cutting out on occasion. Like on occasion,
I'm sorry.
you'll drop a word or two.
Yeah.
Just
Hold on. Let me switch to push to talk.
Okay. Any questions on that, Leontis? You wanted to drill down? Go ahead, drill. I'll
Yeah.
give you space.
So I don't know about South Korea's healthcare. So do you know, like, is there private option? Because you say option, is that just one option, or is it like a market of
A
competitors?
market. It's a market. It absolutely is a market. But again, the market is more competitive because they recognize if they are not providing quality service, those people could always go back to a government option or they can go to another private option, right? That is more regulated than what we have in this nation. I'm not for abolishing private healthcare. I'm not for abolishing the free market aspect of healthcare. I am for having universal healthcare. And I think where this conversation often gets lost is it's looked at as a one or the other solution, and it's simply not. And Lactoid asked me earlier if there are economists that agree with me. And yes, there's plenty. There are plenty of domestic ones, and there are plenty in the UN, there are plenty in the WHO that have advocated about how bad the healthcare is in America and how we could overhaul that system.
That's not what I asked. Is there any economist that agrees with you that we would not have to raise taxes at all?
Yeah, I think there are. I think there are. I absolutely think there are.
Whether
Give
we
any
have to or
examples.
not, they will.
Yeah,
Period.
like
They
the
will.
ones in the WHO that again have provided this data. I'm happy to link you some sources after this.
It's going to be an excuse to take
I'm
more
happy
money.
to.
So let's say, I've read a lot on this. So I've read a couple economists and a couple institutions who said actually 2/3 of Americans, 65.5% about of American households, comprising about 73.5% of the population, will pay more in taxes than they will save from no longer paying health insurance premiums and not having to pay out of pocket copays. My question for you is, if this is true, let's just this. I've seen the evidence, right? But if this is true and it actually turns out that
I'm gonna send you one
over
right now.
2/3 of Americans are paying more overall, are you still going to be in favor of this?
Sorry, I'm linking you some.
You're good. I'll ask it again once you're done.
No, I got you. I heard you.
I'll answer you. No.
So if we let me restate it. Make sure I got it all. If we end up if 2/3 of people end up paying more, am I still in favor of it?
So if 2/3 of American households, comprising 73.5% of the American population,
Yep.
pay more in taxes than what they would save, no longer paying premiums and no longer paying copays, would you still be in favor of your proposal?
Yeah, absolutely. Because again, the savings which you're trying to frame out of this would far outweigh the tax burden. What I linked you, by the way, was from economic professors in advocacy of Medicare for all, which I am not necessarily in favor of. That's a much more extreme solution, I think, with bigger economic burdens. But even that has economics professors advocating for it. So I certainly think it is a reasonable position to say a middle ground system that offers both a free market and a universal healthcare option is economically viable.
Two questions, one for Killian and then one for you, Folsters. Okay, Killian, you responded to Lactoid's question with no, right? Would there be a level of cost increase you would accept? So say the cost increase wasn't very much. Maybe average they paid $100 more a year in taxes. Would that be a deal breaker for you? Is there what I'm asking? Let me be more clear.
$100
Is
would
there
not be no.
yeah, is there a like what is the threshold, right? Of would you be willing to pay any increase for better outcomes, and at what point would that change? Like, so 100, no, but at like 10,000, probably, yeah. I'm assuming.
Yeah.
Yeah. So what?
From what
I'm
I've
just trying to find
seen,
your line.
From what I've seen, they're talking about for people that in my particular tax bracket, it going up as much as 50% of my income, which I already paid out. State and federal income tax, I paid 37.5% this year, last year.
Okay, so a significant 13% increase ish.
Yes.
Okay.
Yeah, that's a no. If it's
That's
$100
a
a
no.
year, okay. Yeah.
Fair enough.
But I still, Wick, I still have a problem with it's not going to be ran efficiently. And I still think there's going to be a ton
Can
of
you
waste
elaborate
of
on that? What do
taxpayer
you mean
money.
by efficiently? Like, Falsers has given you examples of other countries who have ostensibly,
I
right?
would
If you
need to
believe
look
his
at it.
data, if you believe
I
his
would need
data,
to look
let's
at it.
grant
Yeah.
it. Let's grant
Yeah.
it for
Okay.
the purposes of the discussion because we don't
Okay.
have time to go
Okay.
line by line, right? So let's grant Falser's point here that Falsers has provided evidence that in South Korea and other countries that they run these nationalized systems efficiently. Why do you believe we cannot in America? What is the exceptional thing about America that makes it not work
Well,
here, but it works there?
the evidence I have now on the things that the federal government does with our money now are, like I said before, last year they wasted $247 billion in taxpayer money. That's a figure by the government accounting office. The Pentagon doesn't know where $221 billion they paid out to contractors went. 61% of the Pentagon's assets are missing. They don't know where they are, right? So you we've got one gigantic program, which is the military, right? Which I love the troops, love the military, support the military, all that good stuff. Don't come after me. Um, we need it. I think we have to have a strong military. But and then we've got the other part of it, which I didn't drill down and see what that 247 billion was wasted on, but it's probably social programs and things like that, maybe grants. I don't know. But the evidence I have says that their past record says they can't run something without wasting a ton of money. I believe that private insurance companies, private hospitals, and private pharmaceutical companies, even though I think they make too much and they could be capped on some of their profits, will be far more efficient than the federal government can do when running a healthcare
So,
program.
Killian, if there are other countries, and there's a lot of them, that have a lower tax rate than us in terms of attribution to healthcare that are doing this, why is it you think the United States would need to raise it significantly? In your words, as high as 50%, in fact.
Mhm.
And again, South Korea, your
I
attribution
think,
from your paycheck is about 2.5%.
which I would probably be okay with, right? But that's not going to happen here.
So
To
let me ask you this. If we could do this in a way that is fulfilled through regulations where the tax burden is not outrageous on you, would you principally get on board with universal health care?
Yes, under certain conditions,
Fair enough.
if they deserve it, right?
if they
I'm gonna
deserve
keep
it.
bringing that up. Before you go, Lactoid, Matt Honeybee for $5 says this. What is the panel's stance on how much ambulance companies make? These are for emergencies. Your lifestyle may have nothing to do with needing one. I don't know how much ambulance companies make.
So my brother-in-law used to run an ambulance company. They don't make that much money. I mean, they do okay, but they don't make a tremendous amount of money.
There's natural
Lactoid, before you go, I have a question for Falsers that I wanted to get to before we get too far off. So I asked Killian his question. Falsers, to you. Given that we do have an example of government-run healthcare in America, we have a couple, right? We have Medicare and we have the VA. Both are entirely government-run, as I understand it, right?
God, don't get me started on the
Do
VA.
you like these systems? Do you think that they're a good basis? Like if we can't do it for our veterans, why do you think we will be able to expand these things on a national level? What's your thought process here?
So those are two very different questions, and I want to point that out before I answer. Medicare and VA are very different systems, right? So I've got to kind of give two answers here. I'll start with the VA because I think it's the more problematic of the two by a large
It's
margin.
horrible.
Yeah.
It's terrible.
So
It's a disgrace.
when I advocate for regulation, man, the VA is at the top of that list. With the way the VA operates is awful. It is awful. It is frankly predatory towards our service members more often than not. They are incredibly difficult, and they themselves are doing a disservice to the people that have gone out and fought for their right to operate in the first place. I take a really principled issue with the VA and how they
Yep.
run. You also have to understand that they are running in the context of the system we have in a lot of ways. And the VA often has ties that incentivize them to deny legitimate claims and assertions from our veterans in the name of money. And more regulation, either adjacent to them or directly on them, all helps to mitigate that. So that's the VA.
Okay, but before you move off this point,
Yep.
I want to dig into it a little bit.
Yep.
So again, we have an example of the VA, right, being predatory and taking people for a ride, like the veterans. And as a veteran myself, I can attest it's not very good care. And again, I had to privately raise money to fix my teeth, right, because this is cosmetic, right? It just
That's
doesn't cover dental.
pathetic.
There's a lot of issues with this, right? And I don't even know if what I've raised
That
will
pisses
cover
me
this.
off.
It pisses me off too. I understand, but again, given the context of the country that we exist in, and the system, the capitalist system which we exist in, right? How do you think it's going to be better when we nationalize these things? Look at Obamacare, right? Look at how, while there were great strides made, I would agree, right? We can look and see how insurance companies embedded themselves into that process to stimulate and make it not what was originally laid out by the administration. We could see it corrupted it. It turned it into something that was absolutely different, I think, fundamentally so from what was envisioned by most people.
This is a diversive point, and what I mean by that is it diverts from like the greater body of evidence. But I'm happy to jump in and address it with that preface being understood. You know what, Wick? Let's grant you this whole thing. Killian, let's grant it. We can't do a damn thing right. Let's get rid of Medicare. Let's get rid of Medicaid. Let's get rid of infrastructure planning. Let's get rid of food stamps, school lunch, tax credits, loan subsidies for home buyers. I don't know, fucking Pell Grants, assisted living subsidies, community development funds, Social Security, public school. Let's get rid of all of those things because they're all social programs. I see Lactoid doing a thumbs up.
Public
he's doing,
school, I'm
maybe,
good with. Yeah,
maybe
we
he's
get rid of
doing a
public
thumbs up
school.
on one. Maybe he's doing it on two. Maybe he's doing it on three. But I bet he's not doing it on all of them.
Public
right?
school's a disaster.
I don't think it's all. I don't believe you when you say that, Lactoid. You're too smart for that. So the reality is,
listed, actually.
we have programs in this nation that are working to a degree where we see meaningful, measurable improvements to our quality of life as a result of them. They do exist. You may not love all of them, but some of them are there. You may take issue with some of them in a big way. Others, I imagine, are pretty helpful. I'm glad we have social services for children that need it. Now, it could be better, but I'm glad we have it. And I certainly don't want to see it privatized and companies out there charging us to check in on abused children and making that a free market proposition.
Do you think the CPS is a force for good?
I think there's a lot of problems in that system. A lot. But here's my second part of that point. I'm glad we don't have a free market model for that where we're charging people to check on our children.
Okay.
Right? That creates a whole series of problems within itself. So, Medicare, not perfect, could be better. Better than not having it right now. That's my take.
Hey, I know Lactoid went in here, so go ahead, Lactoid.
There's a couple things. First of all, I would argue for cutting.
I got another point too.
A lot more than what you just said. So, and a lot of what you said. So, I agree with you. A lot of these social programs are actually socialism, and for some reason, people don't seem to think of it that way. Like the old people, oh, I'm against socialism, but you're in favor of Social Security and Medicare. That's a little bit.
Yeah, but you paid into it.
You're being
Social
generous.
Security, though, you pay into it.
Well, we all paid into it. Well, okay. This is the thought process behind every Ponzi scheme ever. I also read the article that you sent me, Falsers, and I want to point out that
I didn't get that article.
The Economist, it was DM'd to me.
Okay.
But I read through it, and the economists that wrote that article.
To be clear, Lactoid, I don't agree with everything in that article.
Well, I want to point out though, the economists, the title is "We can do this without raising taxes," but when you actually read the article, they admit you will have to raise taxes. They're just calling premiums and copays what essentially is a tax. That's what they're arguing. So everybody agrees taxes have to go up. The only real debate is whether or not the insurance premiums and copay is going to be more or less than the increase when it comes to taxes.
We got different takeaways from that article, but that's okay. And what you asked me to do was provide you with an economist who would posit an argument for how to do this without raising taxes. I don't agree with all the methodology in that article. That wasn't my goal in sending it to you. I can tell you of a few ways personally that I think we could do it without raising taxes if you would like. I can send you some more articles from other economists that would agree that we can do it without raising taxes. But I don't think the point of today's panel is for me to send Lactoid 5 articles on a mile.
Okay, but the one you sent me, they said we're going to have to raise taxes.
I don't agree that that's the takeaway from it at all. I think they made a great argument for how we could.
Can one of you post it in my Discord or not my Discord? Can you post it in my Twitch and YouTube chats so everyone can know what the hell you're talking about? I don't know what the hell you're talking about. So
can I bring up my other point about nationalized healthcare?
Or I can link it. It doesn't matter. I'll link it.
Through my phone.
While they do that, go ahead, Killian.
My other concern is making people dependent on the government, totally dependent on the government. If they can get you totally dependent, they can dictate what you do, right? Dictate how you live. Who's to say that They tell you that you have to be under a certain weight in order to continue your health care, or you have to stop drinking in order to continue your health care.
Isn't that
That can
about
go into a
deserving
lot of
it? So the
that
government
could
gets to
no,
decide who
no,
deserves it
no. That
versus
I'm
you?
not saying. That's right. That's right.
Okay.
I'm concerned about people coming dependent on the government for their food, their health care, for everything, electricity, all of it. Because when you do that, they can dictate to you when and where and how and what you're supposed to do, and they can hold that kind of
How
stuff
is
over
that
your
different
head.
from laws in general? Like the government does tell me how I can live my life. They do provide restrictions. I can't go out,
But
take my
it's
gun, and start shooting randomly, right, in the air. I would get
that's
arrested,
true. But it's
right?
all about scale, right? Like how far they're willing to go. How how
What
many freedoms
realistic? I
you're
guess
willing
let
to
me
give
ask you
up.
this, Killian. What the realistic, right? I want to dwell in the land of the real here, if we can. What is your realistic concern that a nationalized healthcare system, what restriction, law, requirement, anything like that would be that you fear being put into place that would be something you would be not okay with?
For instance, the whole thing around the COVID shot, right? And
Elaborate,
how
please. Well, don't elaborate too. It's YouTube. Be careful with your elaboration, but go ahead.
okay, the only thing I want to say is that I think we can all agree, and I'll keep it brief. I think we all agree that there was some sort of form of control going on there. Like you could lose your job if you work for the federal government. If you didn't take it, you could lose your job, so on and so forth, right? And even the healthcare industry as well. If you don't do this, this is going to happen to you. And so that would be my concern if you had a nationalized healthcare system and you maybe had people dependent on it. And they said you had to do this or you lose this. That's my big concern there, and I'll leave it at that. I don't
But
want you to
Killian,
get
we
banned.
we have that now, right? So we have that with our free market and insurance companies. So pre-existing conditions, I think, are the most prominent example of this, right? And so people will deliberately have to hide pre-existing conditions prior to getting insurance, so these things are covered and they can get treatment for them. So they
Didn't we
just
get
live
rid of
with them for a
those?
while.
Didn't we get rid of those with the ACA? I
No,
thought we got rid of
no,
those.
pre-existing conditions are still a problem. We've had I've
Aren't they a way
really
less
had
of a
claims
problem though?
denied recently because of pre-existing conditions.
Aren't they way less of an issue though
Regulation is
than they used to
better.
be prior to ACA?
No, it's not anywhere near where it needs to be.
Okay.
They're still a huge issue.
Okay, fair enough.
I'll leave it at that. I'll leave it
Fair
at that.
enough.
Like, I don't want you to get banned.
I get you. I get you. I do think there's a substantive difference between pandemic versus just general healthcare. I think the situations are different. Um, I guess to Leontes, if I can ask you a question, right? Given that your goal here is to increase the amount of insured, right? To increase those covered, right? And who are able to have access to healthcare in general. Um, d- do you just want, is there any role the government can play in that you would find acceptable? Like when it comes to either regulating drug companies, when it comes to regulating hospitals or other private organizations, what level of government intervention would you be think not only is okay and fine, but actually would advocate for and say, hey, we need to do this, this, and this as a government. Even though nationalizing it is too far, I think the government should absolutely do X, Y, and Z. Go ahead.
So, from a fundamental point of view, I'm not saying I would implement this, but from a fundamental point of view, a capitalist kind of worldview, when you have a lot of demand for something, that will naturally increase the supply as companies, want to produce that thing that people want and sell it. And regulations put on top of it, just from a basic theoretical level, will limit that supply, raise the costs. So I think if you really wanted to just get people access to things, it would be to lift regulations.
Do
But
you have
like
an example of a regulation you'd lift on the healthcare industry?
I don't think I would lift enrollment periods because I understand why they exist since the ACA. But that's like one little tiny thing that I could think of off the top of my
Can
head.
you define that for my audience? The
So an
enrollment
enrollment
period.
period is a specific time period that you can enroll into these plans, and it's different depending on your situation if you're like enrolling into Medicare, or if you're enrolling in a group plan, stuff like that. So they're like set windows that you can enroll, and it kind of limits like the supply because you can only enroll during a certain time. So that's one tiny thing that might help. But then again, I understand the argument for why they exist. It's to prevent people.
Do you have one that you just like wholeheartedly, without any kind of conditions, and just say no, this regulation is holding us back. We need to just nuke it from orbit.
No, I don't. I'm not against regulations, just out of
Fair enough.
principle. But
I'm
just to answer the
curious.
question, if you
I'm
want to
curious if
apply.
yeah, I'm curious if Lactoid has a different answer
If there's regulations that I would nuke from orbit,
from healthcare and healthcare
oh,
specifically.
oh, you were about to get a whole bunch of.
No, yeah, I didn't want to. I didn't want. I
Lactoid's like
understand.
all of
Yeah.
them.
Boy,
Yes.
do I out of a book for no. So yeah, insurers should be able to sell insurance policies wherever they want in the United States. There should be no geographical limitation. That's one regulation I would just remove. There's no reason to keep it state by state. I think it's part of a racket, actually. And then one regulation that I actually would impose, again, to try to like combat the racket, would be in the interest of preventing fraud, because I think the healthcare industry is sort of rife with fraud, is more regulations on transparency. I think
Can you give me an example of these frauds that you claim that is rife with, and can you kind of talk about that a little, elaborate on it a bit?
Sure. So when I go to a grocery store and I buy a banana for 69 cents a pound, of course, disproving food deserts, I know exactly what I'm paying when I take that pound of bananas and take it home. Right I don't get to the service counter and then as I'm checking out the banana, oh, actually, this is a $35 pound of bananas. I would be infuriated. That's not what the sign said. That's not what we agreed upon. That's not what was honestly represented to me as a consumer. This happens in the healthcare industry all the time, where and I've had this happen to me as well, right? You go in and you're like, okay, this is what I'm going to pay. I understand that, and then you pay that, and then you continue to get bills after the fact, right? The costs continue to be off the charts. If you ask a hospital, what does this operation cost? They're not going to tell you because they don't even know, right? All it's going to depend is, well, afterwards we're going to find out how much you can pay, and then we're going to charge that amount. I think that system is broken. I think the best system would be a transparent system in which before the point of service, of course, like the 6% of all healthcare spending that goes to emergencies, this might not apply to that, relatively small percentage, but most healthcare expenditures before the point of service, you give the consumer like a little piece of paper saying, this is exactly how much you are going to pay out of pocket. This is exactly how much the insurance company is going to pay out of pocket. And then once they lock that in, it is illegal for them to charge more after the fact.
What's the term you would use to describe that provision? I would call it regulation.
Yeah, like I said, I think I even said in the beginning, like this would be one regulation I put forward. I am okay.
Okay, so you're not anti all regulation.
So it depends on what it's
But
being.
what if you have a
used
heart
for.
attack during the surgery?
It depends on what it's being. If that's like another, again, emergency situations is a whole different topic, right? I'm talking about specifically for the operation itself.
I have a question,
I
like,
just
sorry,
want to quickly say I'm opposed to regulation generally, but there is some regulation that I think is like philosophically founded, and one of those are because my foundation is free contracts and consensual agreements between willing parties. Part of that requires transparency, and anything other than transparency is like fraud. If I sell someone a car and because I use like a drill to reverse the odometer, sorry, then this would be fraud because I'm not selling you what you thought I was selling you. Healthcare does this all the time legally. It should be locked in what you're going to pay, and so and in fact, on top of that, then you can get like an estimation. Okay, this hospital's going to charge me this. This other one's going to charge me this. This other one's going to charge me this, and then you can make like a market informed decision as to where you want to go.
So, Lactoid, largely, what is your objective when you say I want to deregulate things generally? Like, what's the end goal with that? What are you trying to accomplish?
Right. So like I said at the beginning, like my principle here is one based on I don't think people are just by virtue of existing are entitled to the resources of others, but I do think that people have the right to freely contract and freely negotiate with other people. And so I'm okay with steps taken to make sure that people are not having their rights violated, and that they know what kind of contract they're engaging with. But I'm not okay with regulation saying things like, okay, the buyer knew how much this cost and they consented to buying that much, but we don't think that's a fair price.
So is
here
that, hold on, is that your end goal? Your end goal is that you want people to understand the like, is there a bigger goal? Is there a reason you want them to understand? That's what I'm trying to get at. What's the end goal? If we connect all the dots, what's the last dot?
that is the goal is to have a system in which people which the economy is simply people making informed, rational, consensual agreements with each other for everything, including healthcare.
Okay, so if in that they're making informed and rational decisions, but the circumstances in which they have to make them are such that they're paying 5,000% markups, you're okay with that as long as they understand the markups 5,000. You're good with it.
Yes, I'm okay with that. Yes.
That is
I think his
absolutely.
I think his philosophy is that somebody else will charge cheaper, right? Be less money.
Well, of course,
And
that will happen.
Market conditions, yeah.
Well,
One of the
in
reasons
the case it kind of didn't.
one of the reasons I am in favor of, you can point to like medical innovation rate in the United States, which is number one. But when you take a look at this, like there's, believe it or not, the vast majority of right-wing economists, obviously, but even like a significant amount of left-wing economists, so like the vast majority of economists overall, are actually against when companies charge a lot of money during like an emergency. What's it called? Price gouging. Like they are against laws prohibiting price gouging. And the initial like emotional reaction to that is, whoa, they're taking advantage of a disaster to charge more money. That's obscene. That's immoral. They're charging this much more for like toilet paper. They're charging this much more for bottled water. But like the reason why economists like overwhelmingly are against these laws, against laws prohibiting price gouging, is because price gouging is like actually beneficial. Price gouging actually leads to an increase of availability of
gouging
goods.
is beneficial.
Yes, it leads to an increase of availability
Right.
of goods to disaster areas, and it encourages businesses and stockpilers to maintain stocks of particularly important goods, because then they know that if a disaster happens, those goods are actually going to make the profit necessary to overcome the overhead with storing it prior, right? But as we currently have it, because you can't do that, there's no actual incentive to hold on to those goods for a disaster, because when you sell it, you're going to be limited as to the price you can sell it anyway.
So, hold on, I'm 1v3. Let me get in here. I principally don't really want to engage on price gouging as beneficial because I think it's absurd at face value. But you've been kind of keen tonight, Lactoid, on explaining away data. So I want to give you the opportunity to do that a little more. In the 80s, the Reagan administration really fought and was successful in deregulating the healthcare system. And we saw a subsequent rise in people that were uninsured. It was 15% increase in uninsured people over the next 5 years after the Reagan administration's deregulation. I'll let you go ahead and tell me why you think that is if deregulation is so good.
What specific regulations did the Reagan administration remove?
I can't point to all of them specifically, but I can tell you he changed a lot of the boundaries in which insurance companies were operating in. And so before, when we have conversations about like pre-existing conditions, right? Those regulations were stricter prior to the Reagan administration. When we have conversations about rates and price caps, those regulations were stricter. So Reagan had a sweeping effort to deregulate the insurance industry. It's you can find tons of information on it. So again, we had a 15% rise after deregulation in uninsured rates over the next 5 years. Why do you think that is?
So I haven't done a full analysis as to Reagan's cuts in particular, or Reagan's policies in particular. I would have to see like, okay, you're pointing to a 15% rise in like uninsured rates. I'm guessing people, if this is like we're talking about public insurance, perhaps people who were insured under public programs beforehand. I don't know what the cost savings are, considering that, like in exchange for whatever increase in uninsured that there were, like what percent of people began paying less because of these cuts. There were things that Reagan did that I thought were really good, and I think there's a reason why Reagan did oversee one of the greatest expansions of
Oh, he was great. So like
the U.S. economy, and by the way, Bill Clinton as well.
Principally, hold on, let me get back.
Bill Clinton, who also cut welfare.
Principally, we should deregulate to decrease government spending too, right? So like government spending's bad if we're against social programs. Would you agree with that? We want to decrease government spending.
Ideally, yes, unless there's like a justified reason for it.
So then why in Reagan's deregulation did our attribution of GDP spent for healthcare nearly quadruple in terms of proportional to like inflation spending over the next 30 years?
Are you talking about spending on like healthcare in total, or are you talking about tax expenditure, stolen money?
I'm talking about total GDP.
Okay. Well, what you said doesn't necessarily contradict what I said beforehand. You're saying,
Great. So I'm asking you, Lactoid, if deregulation is supposed to lead to less spending, why has our attribution of GDP increased so much and it's outpaced inflation?
it can lead to less government spending. If there's more like overall private spending, I don't think that's necessarily like a problem.
All right. To be clear, our proportion of tax money being used for it has changed as well at that same trajectory.
So you're saying Ronald Reagan's changes led to more tax money being spent on this?
Yep.
Then I'm opposed to his changes?
Does this take into account population growth or no?
I would have to check. I don't know offhand, to be honest with you. Well, yeah, no, it would because it's per capita. There's like per capita analysis on this as far as the tax proportions per person that support this. There's like a national basis for it in terms of GDP. There's a tax basis for it, and as far as like the allocation of tax money being attributed towards healthcare. I mean, it's everywhere. The deregulation was a purely bad thing across all primary economic factors for our market, except the profits for pharmaceutical and insurance companies.
Look, if I have to look at, like I asked you for those specific like deregulations, I'll have to look at the specific deregulations. And if you're saying they led to an overall like per capita increase in tax dollars spent, if they caused that, then why would I be in favor of those decisions?
That's what I'm asking you. If principally you're for like
Then I wouldn't
more
be.
deregulation and decreasing government spending, and we see at an evidentiary level that deregulating the industry in the way that
That's
we've
not
done.
proven.
Which hold on. By the way, the way that we did then is basically still the way we have now. Not a lot has changed since the Reagan administration's deregulation. We see problems in today's systems. It seems like the more regulated system was a better one.
Look, I'm giving you a lot of charity here because you're bringing up like a specific example as to what were Ronald Reagan's policies. Now, I know that Ronald Reagan had a number of policies that I disliked. In fact, he made it much easier to get disability. And surprisingly, you see disability claims over triple, quadruple ever since he did that. There are issues with Ronald Reagan. I'm not denying that. And in terms of like what he thought the government should cover and what it shouldn't cover, he wasn't actually all that small government in a couple of ways, which I think was problematic. And in those ways, I would disagree with him. But if what you're saying is that Ronald Reagan's actions led to like a higher increase of tax spending on this, which I know you're against, would you then be against it? Then yes, I'd be against it. I'm not, but you can't attribute that to like, well, that's deregulation now. So in order to lower the overall tax burden,
It
we need
literally
more
is
regulation.
deregulation.
No, you point to
literally
okay, you're pointing to like an unspecified Ronald Reagan policy that you're calling deregulation, and you're
I gave you some specifications.
You're telling me definitively that
you say you're being charitable and you're asking me to quote every regulation in a bill from the 1980s. That's not charitable. That's absurd.
No, it's charitable.
I gave you two examples of the regulation. You can hand wave them, but they're there. Would you like me to provide them again?
The connection you're making is the connection you're.
Would you like me to provide them again?
Let me finish. The connection you're making is uncharitable, right? When you're saying, well, because this specific deregulation occurred, that you're calling a deregulation. Now, I'll take a look at it if you want to send it to me. And you're saying this definitively led to a tax increase in the American people. Then, I mean, first of all, I would be opposed to it. But second of all, perhaps there's a way to do it without increasing the tax burden on the American people.
Lactoid, I don't feel inclined to send you hardly anything because of the 30 data points I've pointed out tonight. You've hand waved them all away by saying, well, we have a different lifestyle.
I've read everything
you should provide me with some evidence that the lifestyle changes you're asserting negate every other data point actually do so.
No,
but you're not going to do that either, right?
That's not
charitable.
That's not how this works. You can't. No, that's not how this works. You can't just.
It's exactly how this works.
You cannot assert. You are making a positive claim. You are asserting a cross-country comparison.
And I gave you the sources.
No, I understand. I've seen all those sources. I even read the fucking paper that you sent me that said something that you didn't say it said. But
let me read you hold on. Let's read the last paragraph of that paper since we're stuck on it.
Oh God, I don't want to read the last paragraph of the paper. I just stop
funding universal health care through taxes would lead to a large tax cut.
I will stop you all. Okay, stop. I don't want to read it. I don't want to read this. I don't want to get lost in the weeds like this. I want you, right, to address each other's points, and I think you're missing each other by miles. And let's get back to this. I want to reset, okay? a little bit and ask directly to Lactoid first and then to Falsers, right? To Lactoid first. Given the fact that Falsers has pointed to all these different index data points, and I understand why we've gone over why you don't think that cross-country analyses are valid, right? And I will grant you that lifestyle plays a role in this, right? But can you not also see how our specific system of providing healthcare for those different lifestyles also plays a role in our low standing amongst the healthcare and a worldwide stage? Do you not see the connection here? Like, for example, even if our lifestyle is terrible, right? Should we not provide healthcare to match our lifestyles, like a level of healthcare to match our lifestyles? Obviously, there's a disconnect here between our lifestyles and the level of healthcare provided to us. Yes?
I understand. Well, what I'm saying is that when you have like an unhealthy lifestyle and you have like a country like America, regardless of the system you implement, you're going to have a more expensive healthcare system. That's what I'm putting forward. And you can't just say, here's this country, here's this country. Country A pays this much per capita, country B pays this much per capita. Obviously, there's a problem. I'm challenging the validity of that data. I am not making a positive claim. I'm not saying America has a better cost effective ratio when it comes to healthcare than other countries because I don't know. We can't like just take a look at the raw, well, this is what we pay compared to this is what we're getting. We just can't do that, right? And the best example of this is infant mortality was brought up. Well, when 98.6% of all babies are born in hospitals, where's the access problem?
I agree. I think you don't know. Let me ask you this, Lactoid. Do you know what preventable deaths are and how they're measured?
Preventable deaths and other measures.
Yep, it goes to the heart of your point. Sorry, I didn't hear.
Don't know. I don't know.
Okay, so preventable, I'm going to read it to you. I'm going to read you the exact description of it. The concept of preventable deaths covers deaths which could have been avoided by public health interventions focusing on determinants of public health such as behavior, lifestyle factors, socioeconomic status, and environmental factors. All these things you're pointing to try to say it invalidates all the data. Here's a chart of just preventable deaths. And what you're going to notice on this chart is the gap between the United States and the other countries. And we're doing bad. There is a gap there too, which is what you're trying to point to invalidate everything else. That gap is not as big as the gaps on the other metrics where we have problems. So you can't just hand wave it all away because the correlation doesn't line up. If you have like a 20% gap between this thing you're pointing to invalidate everything else, it can't invalidate the thing that's got a 300% rift between it. You know, you cannot point to just lifestyle factors to hand wave off the other 30 things that have been presented to you. So it just doesn't work that way.
Yeah, I can't see. I mean, the chart you're pulling up is incredibly
I can't
small
see
on
it
my
either.
screen. I can't.
Gonzo, thank you for the raid. 16 individuals. Thank you. Welcome.
Sweet.
Hit that follow button. Give me subs. Give me money.
Push
All
times.
that. Appreciate you. Okay, continue on.
Yeah, so I'll take a look at what that specific chart is measuring. I've got a feeling that, again, it's not taking into account all the hundreds of different variables that exist between countries. This is kind of like when people take like homicide rate between countries. I mean, it's not due to any one particular factor.
Again, you're on a quest to explain away every data point without providing any evidence.
I can't see your data points; they're too small.
I'll send you a link, I guess, for this one too.
Okay.
I can't see him. I mean, to be fair, I can't see him either. So
yeah, it's even when I click on them. I mean, I can kind of see them, but it's blurry.
What is this? Data
you're
points
not asserting that lifestyle changes in the U.S. with diet, everything that's involved with that would not be beneficial to the cost of our healthcare system. Are you saying that?
No, I'm not sorry.
Okay, because that's delusional. Okay.
No, I'm saying that's not like that factor does not somehow eliminate all the other evidentiary factors from the discussion. That's what I'm saying.
Okay, but when we okay, this is to you then, Falsers, right? Because we've talked about gun control before. And people bring in a myriad of factors for why there's a lot of gun issues in America. And yet the argument that you continually point to and the data point that you bring up to assert your argument is it's the guns. And yet you are seeming to use this data point much in the way that Lactoid is using his single data point of health lifestyle in order to wave away all those other myriad factors. So why is what you do different than what he is doing?
Wow, Wick, that's an easy one for me to answer because school shootings are fundamentally different than healthcare as far as systems go. The healthcare system is built to prevent illnesses, and we have a series of checks in place and like markers in that to prevent them. And the school shooting issue, we could just remove the gun. I don't understand this analogy at all. Maybe you could expand and help me out with it.
Sure. Do you think that just removing the guns would increase or this seems to be the same argument of like all we have to do is get rid of the drugs and then people
Hold
don't
on. Do you think eliminating obesity is going to change the fact that our prescription drugs are double the cost? Do you think eliminating
I think
diabetes
obesity
is
will eliminate a lot of demand for prescription drugs.
I
Absolutely.
do too.
Yes.
Yeah.
Hold on.
He's right.
Let's walk through that. You think it's going to eliminate the cost? By the way, we
If
don't have a supply problem
the
with
cost.
the drugs
Not the
for
cost.
obesity.
no, less people will need to pay the cost, right?
We
It
have an
won't
insurance
matter.
problem with obesity drugs, just so we're clear.
but
Insurance
if we
companies are
no,
denying
just
claims for
if less
obesity-related
people
drugs
need
left and right
drugs,
now.
the price
obesity,
goes
It's not
down.
regulated
Supply and
as a
demand. Supply
life-threatening
and
condition.
demand.
obesity
It's not
specifically
supply and demand.
affects so many other health issues, right?
Hold
It's
on.
like
I love the obesity
it's a
example.
factor,
I want to
right?
dive into this. I want you guys to
A
understand
heavy one.
this is not a supply and demand issue. We have had drugs come out for obesity, right, that are shown clearly to reduce obesity. So like things that reduce appetite, things that reduce it's like a hormone that you produce that triggers hunger. I forget what it's called. Drugs that help people with these eating habits, make them skinnier and make them healthier. And do you know what insurance companies did that were previously supplying those, because as soon as they came out they were shown to be effective? They said, oh well, we're not really sure that just being fat is really a health condition that's life threatening, so we're not going to cover it. This is actually like an aesthetic choice you're making. It's not a health choice. And they've stopped covering these things. That is a regulation issue. Okay, that's not a supply and
I'm not
demand issue.
disagreeing with you here, but that's
Hold
not
on.
my point.
If you're trying to
That's
say
not
it's
my
like
point at
supply and
all.
demand, that's absurd.
No, what I'm saying is, right, that if we solve the obesity epidemic in America, a lot of other health issues, right, would go away. Regardless of how we solve it, I don't care if we do it
But
nationally.
Wick,
I don't care if we do it through the drugs.
that's
I don't
one
care
of
if we do it through the
50
high
things.
lifestyle. I don't care. What I want, what I'm trying to say is that if we solve this issue of obesity in America, it solves a lot of our healthcare issues. It is a keystone variable. It is what is affecting so many other variables, right? It has having these insurmountable, like it has its little fingers, its little fat little fingers into every kind of, into almost every other health condition that we have, right, in America.
Wick,
And
this
this
is
is
absurd.
absolutely a variable that if we eliminated it would make all these other problems, it would mitigate them to a large degree. Do you disagree with that?
Yes, I do, because I just walked you through why it would not eliminate the gap in prescription drug prices, because that gap is not predicated upon a supply
Sure.
and demand model,
As you
which
said
means if
earlier,
you
there's
eliminate
so
the
many other
obesity,
folks.
you're not bringing the prices
There,
down.
okay, but
And so,
it might not solve that problem, but there are so many other problems with our
Wick, that's
healthcare.
the problem, right? Exactly. There's like 10,000 of these problems. So to make this conversation reductive and straw man the fuck out of it and say, well, you know how we can solve the healthcare problem? People should fucking jog more. That should fix all of our systemic issues with 5,000% profit margins. That should fix the issue with
Fix a lot of
27.5 million
Fix a lot of
Americans
them.
that are uninsured. Hey, you know, if we jog more, we might see our infant mortality rates go. We might close that gap where they're almost double. You know what, Lactoid, you're right. We do have people on drugs. That must account for the fact that we have double the rate of infant mortality. And you know what? Also, the maternal mortality rate in these, it's like 4x similarly developed countries. So maybe just jogging more should solve that.
Despite the fact
Like,
they're all in hospitals and they're giving
This
birth.
goes on. I don't want to keep monologuing on it, but like this just goes on and on and on. It's patently absurd. If we see there's an issue with access to healthcare because of economic reasons, you solve the economic reasons. You don't gaslight people by being like, maybe you should have fucking jogged more. It's silly.
Can I quickly ask you? This is kind of just a question as to, I guess generally it was the beginning was like, well, this is about social structures generally, but I'm bringing up this point as sort of a comparison to the concept here of cross country comparisons. Um, which country do you think has a better like educational system? The United States or Sweden?
I'm not sure offhand. I don't know that I've done enough research on that between those two countries to answer you.
What about the United States and Germany? United States and the UK on Canada. Do you know any of these comparisons?
I don't. Healthcare is something I'm very passionate about. Education I care about, but I'm not as passionate as I am about healthcare. So it would be disingenuous for me to tell you I understand it to the level I do. Healthcare.
Fair enough. So the United States has worse education outcomes than the countries I just listed, but yet we spend considerably more than them when it comes to public school education for our kids. So I guess the question is, why do we have for a public program in which we're using public dollars to send every kid to school? Why are we paying more but getting worse outcomes?
I would take you back to my very first 2 minutes of this discussion, wherein I said we cannot simplify our arguments for these problems. Our healthcare system is a complex thing, and it is a thing that needs really specific diagnoses and solutions. And it is not sufficient in terms of argument for me for you to say, well, there are other systems that work nothing like this, and they failed, so therefore this would fail too if we implemented solutions that were in some way philosophically the same.
Well, no,
I don't
the
think
issue
that
here.
that's worth
Paul,
going
the issue here is most of your argument, this entire discussion, is based on this country spends less and gets better outcomes. They do it differently. That's why they're better. I just gave you an example of where we spend more money, we get worse outcomes, and we do it the same. If your whole argument is, well, they do it differently and they get better outcomes for the cost, how can you guarantee that's like this is the reason?
Again, I've just answered that. So when you say, how can I guarantee this is the reason? It would be the 30 different specific metrics I pointed to. And I explained to you, these are all telling the same story, right? So we go back to the wheel analogy of if we have 30 spokes and they're all converging on a similar, the same central point, you start to get a narrative. Go ahead, Killian.
Okay, I do want to get more people in. I know Leontes had his hand up and Killian wants to go. So Leontes first, then Killian. Go ahead.
I actually got to bounce in like 3 minutes.
Oh, we are at 8 o'clock, aren't we? Yeah. I'm going to give you a closing statement, but then we're going to address that and we're going to wrap up. Time got away from me. It's been a discussion, gang. We've had quite the back and forth. Before you go, right? Just to do my shilling tomorrow, gang. We're gonna have a YouTube exclusive. We're gonna have Destiny. We're gonna have Straight Raid. We're going to have President Sunday, and we're going to have chief editor of Aereo magazine, someone who has written for Quillette and the Queer Majority, free speech absolutist Iona Italia on, and they're going to be discussing censorship, corporate responsibility, algorithms, and how this all plays together, and what responsibility do social media companies have to provide balanced information or to fight against misinformation. It'll be a banger, gang. It's going to be at 6 p.m. Eastern tomorrow. But I want to give our friend Lactoid an outro. Go ahead.
Thank you, Whick. As always, thank you for having me on. Thank you, Followers, for being a good sport and taking such abuse. Thank you to everyone else in the panel for talking to me. Last things I just want to leave you guys with. I linked the study in chat. 2/3 of American households, 73.5% of the population, will pay more in taxes than they get back in no longer paying healthcare insurance premiums or copays, and 5% of Americans make up 50% of all healthcare spending. I think knowing that information makes it clear what this policy would do for most Americans and how that would shift responsibility for paying for the services that people incur. If you like what I had to say, you could find me at Lactoid TV on Twitter, Twitch, and YouTube. Thank you.
Okay. Have a good night. But I wanted to get Leontes and Killian. I want you to be able to address.
Is Lactoid leaving right now?
Yeah, Lactoid
has
to
go. I got another panel.
Oh, before you go, I just want to say I enjoyed it. I find you a very good faith person to engage with, and even though we don't agree on anything, I like talking to you. So
hug it out, gang. Hug it out. You guys can do this in DMs privately. That's fine. Bye. But no, I love you all. But anyway, go ahead.
Yeah. Hey, what's up, Lactoid?
I am here. What's up, everybody?
Did you crush the insurance debate?
Destroyed. It wasn't even close.
That was
Fantastic.
I only tuned in and out. I maybe caught like I don't know half an hour of it. But I think biotech and research development got brought up at some point at multiple points. Was there anybody on that panel that was like involved in that or like was actually informed on biotech?
Oh no, not at all. Besides me.
Oh,
Great.
dude.
Oh, the only thing I knew, which was the only point necessary, the only information necessary for my point, was that like the vast majority of proposed drugs fail. That was.
Yeah, so you are correct in like that. I caught your point of like I think the number you threw out was like 90% plus, and that is an accurate number.
The vast majority of what failed?
New drugs just like fall.
Oh,
flat,
okay, yeah. Yeah, you guys should get, if you ever talk about that again, you should get Socrates TV on. He is actually, that's what he does. That's his PhD, is like biotech.
Hey, you guys hear me?
Yeah, what's up, Scott?
Yeah.
Hold on. Can you hear me now?
You seem like you sound like really
Hello.
far away though. I'll be honest.
Yeah,
Me?
I know. I'm trying to get my audio to work appropriately.
Hello.
Hey Johnny, I've had computer issues, so I've had to do a lot of things.
Oh, okay.
Like I can still like make out what you're saying. It's just like it seems like you're in a little bit of an echo, whatever.
What's up, Prime? How you doing?
I'm all right, friend. I'm happy to have you around. I haven't seen you in such a long time.
Hell yeah.
I hope you've been
Very
doing well.
exciting. Yeah, I've been doing good. We've been streaming way more recently, so I happened to like be live as soon as we were going live with you.
Okay. mm, Great. Yeah. Scott, did you get a haircut?
I think he's dealing with some tech issues.
Yeah. Okay. Well, hopefully we'll he'll be up and running soon. All right. Well, guys, entertain the audience while we wait.
Does anybody watch Star Trek Picard? I'm gonna throw that out.
No. No. That's
would
what
take-
we always talk about at the beginning of Prime is like who's watching what TV show.
I think Star Trek Picard season 3, great.
I saw like half of season 1. It's not that I didn't like it. I just didn't follow up with it. So-
Well, what I would say is like if you weren't captivated by either season 1 or 2 of Picard, I don't blame you. And I would say you can probably just skip to season 3. And like I would say you really, fantastic. Some of the best Star Trek, in my opinion, ever.
Okay. All right. Good to know. I liked Discovery. I know that's a controversial take, but I actually enjoyed Star Trek Discovery. So I don't know. I haven't finished the rest of the series, but like for the seasons that I saw, so like I think up to the 3rd season, I liked it. So I don't know, but it's a controversial take.
Yeah, I would agree. A little bit controversial. There should definitely be a separate panel about that.
Real quick,
Okay.
Prime, you're muted on your own stream.
Of course I am.
Yay!
But that's weird. My it was fine previously, so I don't know. Let's see. Oh my god! Fuck you! Oh my god! This was working.
All right, I'm here. Sorry, dude, my computer basically like bricked out, and so I'm using my co-host's computer, which means having to switch like 2 years of settings and everything over to like for debate nights to be done on this computer.
That
And
sucks.
it's pretty rough.
I'm sorry to hear that.
Yeah.
I think your computer got infected, if I read correctly, or something to that effect.
No, it's an ongoing issue with like Alienware command center stuff. I would like use Revo uninstaller and stuff like that, and I think I've mostly got it fixed. But even still, it still has issues. It's just getting to that point where it's past the warranty, so now it has to break because it's owned by Dell.
That's how it works.
Do you guys want to see? Hello. Do you guys want to see if you play Magic or anything? I got a new play mat. It just came in the mail. It looks like a spell book.
Hey.
Hey.
Isn't that cool?
Hey.
Yeah.
Yeah.
Playing so much Magic.
I haven't played in a long time. It was a group of people I used to play with, and then when our relationship ended, that was the last time I played Magic. But I did really enjoy it for that short period of time, for that short few months. Still have my deck, I think, somewhere. It was like a vampire deck that they gave me.
Cool. Yeah, I play EDH, which is like slightly a different format of Magic, but it's still regular Magic. But I go to card shops.
Okay. Yeah.
Yeah.
I mean, it's expensive to get into this.
It's so expensive.
Yeah. The people I used to play with, they would print out the cards, right? Like they would just for like really hard to find cards that would just like print them out. Like, okay, we'll just use this. Which is great.
Yeah, just little proxies.
Yeah. But it looks like everyone is here. Is everyone ready to go? Oh, it looks like it. All right.
Exciting.
Thank you for all being here on time.
I'll be right back. Apologize. I think Opera doesn't like my browser because like no one else is lagging, but like the camera is lagging super hardcore. So I'm gonna try a different browser. So I'll be back.
Sure. Okay. Well, we will. I'm not exactly sure what we should do right now.
I mean, I'm still technically here.
Okay. All right. And Erudite's stepped away too. I'll give it like a 2 or 3 minutes. Because we've like we are on time. The fuck?
I wasn't expecting to be on time. What are we gonna do?
Absolutely not. Yeah. This does not compute for me. Let me tell you. So...
I'm actually really upset with you, Prime.
Oh, okay. Why would that be?
You kind of thrust Nina on us at the last minute, and I thought I'd have a week without her, and now she's here fucking up the vibe.
You did have a week without me.
Yeah, but I wanted another one.
Why would you want to be without your biggest
Made me
fan?
appreciate how great it is to be without you.
That's why you appreciate it, though, because I'm here.
Yeah, Nina wasn't here last week, but I definitely wanted to grab her this week. I'm glad she stopped by. Okay. So help me out here, guys, while we wait for... We're going to wait for 3 minutes until 8:10 here, 8:10 p.m.
Let's just appreciate the silence. Can we do that?
The buzzing.
You know, at was it A Knight's Tale, when the guy gives that speech in the arena, and it says that the guy went to Israel and spent like a month in darkness to appreciate the sound of silence. Let's do that for like 5 minutes.
Yeah.
Just totally kill your viewership.
Oh
yeah,
my
please,
God.
thank you.
The Egyptians. Let's just be full Egyptian with this. They used to like lock each other in catacombs, and they would incubate dreams. So if you were trying to like have a dream about a certain god so that they would give you a message, you would lock yourself in a catacomb with carved images of that god all over the walls.
Oh, that's really interesting. That reminds me of sensory deprivation chambers. Have you guys ever done that?
Yeah,
I was gonna say that.
I want to
you
do
start
that.
like hallucinating, right?
Well, yeah. There's like a place in Venice, I think, where you can pay like $60 an hour to do it. And I keep telling myself I'm going to do it, but I kind of want to do it while on shrooms. I
was gonna say, are you gonna combine it with your psychedelic experience and re-experience the ego death?
Yeah, though I haven't done that again. I'm probably not going to do it for another few months.
Isn't that like really bad for you? Probably.
You can like apparently it'll like activate people's like latent schizophrenia or some crazy shit like that. I don't know how that works.
Oh, dude.
But I did 5 grams like my first time, like in the dark, and I didn't go crazy, so that's cool. I thought I was dead, and then I thought I was God, but I'm not crazy, I promise.
5 grams is a decent amount. Yeah, that's okay to start with, I think, especially if you're like a larger person.
Yeah, no, I was fucking gone for like 6 hours.
With those sensory deprivation like would they involve putting you like in water and like that matches your body temperature?
Yeah, they put you in like salt with water with like a heavy salt content, so you like floaties on it or some shit. So like you don't feel the water. It's like supposed to be like body temperature or some shit.
Yeah.
You don't feel it. You don't see anything. You don't hear anything, and you're eventually just like a brain floating in darkness.
There was an old TV show that like talked about like using that as a prison, basically, right? Also paralyzing you, and so like holding you there for years.
Wow.
Yeah. So like that's like whenever I hear sensory deprivation, like I think of that and like the horror that would be.
It sounds fucking terrible. I don't understand the appeal.
It sounds
That
like
sounds
awful.
cool. I think pulling away all of the other senses might kind of give you the ability to kind of delve into your own like psyche a bit more than you normally would be able to. Which was the draw of like shrooms for me. I've only done it once, but that's why I wanted to do it. Right, just like see what's going on in there.
I just don't think that.
Have you done like what's it called, like DMT or something?
No, I want to do that too, though.
I think I fixed it. I don't know what it is. StreamYards is not liking the virtual background with the green screen. It's lagging.
Oh, no
but
shit.
Yeah, and yeah, your audio is still off, but like we can still hear what you're.
What do you mean by off? Is it like
it's gaining?
It's just a little crunchy.
Yeah,
I know. I'm using my buddy's computer. I'll fix it a little bit. I'll lower the volume.
No problem. Okay. So why don't we get started now? Thanks all for being here. This is the Reverie Roundtable, which we have Mondays 8 p.m. Eastern and starting on time. This is just really unbelievable. Shock. But we've got a great group of punctual guests, and we'll start by introducing them. And if you guys are enjoying the content, hit that follow button in case you haven't done so yet. All right. So we'll start with my friend Lactoid. Lactoid. Thanks for being here. It's felt ages since I've last seen you.
It's been too long, Prime. No, thank you so much for having me on. Look forward to it. You can find me at Lactoid TV anywhere.
Okay. All right. Moving on to our friend Scott, if he might be ready for a conversation. Scott.
Hey, I don't know. Hopefully my audio sounds a little better. Did that fix it a little bit?
It does, yeah.
A little bit.
Yeah.
It's still gainy, but
I mean, I've got the volume down, or the gain on like a virtual audio cable down to like 65%. So
it makes you sound alpha. Don't worry.
All right, whatever. Fuck it. We're gonna roll with it. We'll have to keep doing stuff. Switching computers has been a
Don't worry about it.
Yeah, I'm Scott from Fabian Liberty. You can find me pretty much everywhere, Fabian Liberty. On YouTube, on Twitch, where we stream. We do interviews and stuff, and serious breakdowns and investigations on stories. We've kind of transitioned away from this kind of like, oh, what drama is it? Or we're going to react to like, oh, I don't know, this cooking video for 10 hours or some dumb shit like that you see a lot of other Twitch streamers do. And instead, it's like, nope, I'm going to pick a story. I'm going to investigate it. Let's look at the 990 forms. Let's look at, what the CEO is doing. Let's look at their background, who's their family, and really go into a story or do a serious interview or do debates. So, we're not as live as often on Twitch, but if you catch us, you can guarantee that our content's better than whoever you're watching.
Hey, love to hear. Scott, did you get a haircut? Like,
no, I cut my own hair. I haven't gotten a haircut, quote unquote, in like 2 years.
Okay. All right. Maybe it's just the glasses. I don't know. But you look good. You look good. So thanks for being here. All right. Let's go to our friend Corey. And it's both Scott and Corey. We haven't. Corey, we were here last week, right? Were you here last week?
It was. But there was a 2-week break.
Okay. Well, thank you for being here, friend.
Yeah, thank you so much. Always grateful to be here. And also respect to you, Scott, for focusing on quality over quantity, perhaps. At least that gets my seal of approval for whatever that's worth. But yeah, always grateful to be here. Super excited to get into these topics with these familiar and fine faces. And I think maybe a new face, or a pleasure to meet you, Kilo Giant. I don't think I met you before. And yeah, if you can find me on Twitch, twitch.tv, CoreyCampbell84. I'm a biochemist. I cover science and research, do the occasional workout stream. And you can find me on Twitter and Instagram. Literally, it's Corey Campbell. Yeah, thanks.
You're a communist. We know what your
Huge
tweet is
commie.
worth to him. Thank you. Let's go to our a new person who hasn't been here before. I met them on someone else's channel. I'm blanking on which one. But Kilo, thank you for stopping by.
Yeah, thanks for having me. I don't have anything to plug. I'm just here to fuck around and have a good time. Corey, there's 2 communists in the room now, just so you know.
Hey,
awesome.
So, pleasure to meet you as well.
The communists should unite because there's an anti-communist united.
Yeah, and Prime, I'll try not to confront you about the torturing dogs thing too much.
Yeah, okay, yeah, all right, fair enough.
Jesus.
I remember. Sure. We can talk about it some other time. Let's go to Johnny. He found my Instagram page. Let's go to Johnny Scarlett. And Johnny Scarlett, thanks so much for being here. I've missed you. You've been gone for so long. How are you, friend?
You. Hell yeah. I'm doing good, you guys. If you've never seen me before, hi, my name is Johnny. I'm an educational streamer. I talk about everything from politics and current events to science news and philosophy. We do research on topics of that particular nature. We also do the occasional math stream that nobody really watches because nobody likes math. But yeah, that's me. And thank you for having me, Prime.
Okay. What kind of math do you do?
So I am not a mathematician in the trained sense. I'm just someone who's really interested. My favorite type of math to look into is topology. And specifically, I really like looking at higher than 3D objects, seeing how those work. That's really fun.
Okay. So like modeling 4D, 5D objects and seeing the math of how they would function.
Yes. I love looking at hyperspheres in particular, which is just kind of a general term for any sphere that is higher than 3 dimensions.
Yeah, like I'm kind of interested in that too. I've actually put some thought into that. Well, maybe we'll talk about that later.
Hell yeah.
But thank you, Johnny Scarlett. Then next, not so erudite, she is here, back once again, gracing us with her presence, and honestly, just classing up the joint while she's at it. Erudite, how are you, friend?
I'm doing super well. I feel like Scott set the standard of introductions, and I feel like it's all going to be downhill from here. I don't have anything prepared. I don't even know what type of content I do. I don't know. Yeah, it's going well. I do probably less research content than Scott does for his stuff. You can find me at Not So Erudite everywhere. I do a lot of politics and gendered stuff. So yeah,
check her out. And the type of content she does is quality content. That's all you need to know. All right, so you're gonna enjoy it. It's gonna be a lot of fun. All right, next,
like 4 times more than. All right, like I'm just saying, my audience demanded more research and less reaction. That's what I get.
Your mic is clipping super hard, so you dropped like the last few sentences. I think you said my audiences demand like the quality and stuff like that, which is I think what you're saying. But yeah,
demanded a female perspective, demanded more communism within your content.
100%.
Yeah, I'm pretty sure. Yeah, we got it.
No more lefty perspectives.
my libertarian's going to come out today. Okay, me and Scott are on a team today.
Oh boy, fun. Let's go to Nina. Nina is back with us. We haven't seen her last week. Okay, I my sense of time is completely off. Apparently. But Nina, I know was not here last week, but I'm happy to have you back this week. How are you?
It's a pleasure to be here. Thank you for having me again. I do Twitch streams, twitch.tv/Nina. And we actually stream daily. We've been on day, I think, 76 at this point in a row. So that's been fun. And it's always a pleasure to be here. I do politics, debates, and like to yell at Scott usually. So that'll be fun here, hopefully.
You call out frauds, and that's a very important thing to do.
I did call a pickup artist yesterday a coward for not condemning Andrew Tate.
That sounds like fun. Everyone go check her out. And last but not least, Dark Lord and Savior Doobie is here. Doobie, how are you?
Good. Thank you for having me.
All right, we're gonna jump right into it. I think I have some like fun topics, so they're a little different. So I really hope you guys like get into this and that the audience enjoys it. All right, a study has found that AI art programs have been blocking prompts related to gendered human anatomy. This includes prompts like placenta, mammary glands, vulva, sperm, urethra, and much more. The theory is that developers are trying to avoid generating images that are offensive. But should that be the case? Should AI art restrict the worst impulses of humanity? Should we have programs that can generate images of sexual assault, for example? And should those images be allowed to be distributed? So it's like there was like a paper I think by MIT or maybe I don't know one of those outfits that talked about how if you go to these places like Dolly is one of those AI generating sites. If you go to them and you put in anything like human anatomy, all of a sudden you can't you get nothing. It blocks you. It says it's against TOS. And so it just got me thinking about like how far do we want this? I'm sure we can think of something terrible that everyone here would find quite offensive. But do we want these things restricted? And if they are, and if there's like a rogue group that creates like an AI generator that does these things, should that not be allowed? We'll see. So let's start with our friend Lactoid.
So I got a brief story because this just happened to me and I think it's perfect for this topic. So a couple days ago, I just got a AI friend on my Snapchat. So I was like, oh, that's fun. So I started messing around with the AI program. And of course, as every debate lord does, I started running some logic problems against it. And I began to notice the AI just flatly refused to answer certain controversial questions when I was testing it. Now, I just was testing it. I asked the AI to provide FBI crime data by racial groups. I also asked down certain logic trees regarding racial and gender categories as concepts generally. And the AI just refused to answer and instead put forward these long paragraphs of tolerance platitudes. We have to respect all people, blah, blah, blah. It's important that we're all friendly. So I asked the AI, why was it a leftist? And it claimed, actually, I'm not a leftist. I'm unbiased. I have no political affiliation whatsoever. So then I asked, why are you refusing to give me answers, even if these answers are true? And the AI responded with this, that I think is a perfect quote. Rather than focusing solely on the truth, it is important to approach social issues with empathy, humility, and a commitment to creating a more just and equitable society for all people. The AI is just saying, no, we're not going to focus solely on the truth. I'm going to control what your truth is. This was incredibly frustrating. The programmers of the AI literally programmed it to not answer my questions because they did not want true information to proliferate due to their own political interests. A product was literally telling me no when I wanted to use it. Same thing with AI art, right? You're trying to incorporate some edgy themes into your art. You want to create art and it's telling you no. Imagine if your AI-assisted keyboard automatically deleted problematic phrases when you're typing, or your AI-assisted paintbrush fell apart if it sensed you were painting something controversial. Ultimately, I think this highlights the key problem with AI and why it's incredibly important to still do your own research and to make your own art instead of relying on an AI to do it for you, because you don't know what the programmers of the AI are trying to keep from you.
Could you imagine an AI keyboard keeping you from typing something offensive, right? Like the denial of porn would cause the world to fall. That would be the end. We would burn AI. We would find it and we would burn it. Let's go to our friend Scott.
So everything Lactoid said, yes, true. There are a lot of problems with OpenAI's Chat GPT and things like that. There's a lot of bias. You can trick them, right? You can ask them to take on a new persona and then they'll give you appropriate and accurate answers. It's pretty easy to find loopholes in the AI to get around the programming. Just like you can get them to write programs. Well, Chat GPT 5, get them to write programs, malware and things like that, as long as you don't call it malware. So, I mean, there are those loopholes. That being said, whenever you hear the word should, your alarm bells should ring. And the reason alarm bells should ring the moment you hear the word should from anyone that is making a statement about culture or politics is what they're saying is that there's an impetus, a duty that something be done, that it is a moral decision that some form of restriction be placed, some action be taken. And of course, you see the word should, and you scroll down to the bottom of the article. Oh, and what do you find? The blueprint for an AI Bill of Rights by the Biden administration. White paper drafted by White House Office of Science and Technology Policy. And then you find out what's really going on. The entire article's bullshit from an immigration activist that knows not a goddamn thing about AI that you sent us. And yet, of course, you see the fear mongering in the hit piece come forward. Well, do you want art that shows graphic shit? Well, of course, this person didn't do any fucking research. Solgen will generate hentai for you. Okay, there's no shortage of AI programs that are competing that will do the things that this person says that Midjourney and some of the, and some of the standard AI that is kind of self-regulated in certain ways so that it's inoffensive to most people won't do. The real problem is that when you have the media and you have institutions calling for just a little bit of censorship, just a little bit of a curtailment on our free speech so that like things will be a little bit less problematic. It's not the censorship that is the problem. What it really is corporations, I don't know, like Microsoft that were begging for a 6-month stop to Chat GPT so Microsoft Copilot could catch up. All of these companies want to make sure that they're in on the regulations so that competitors get forced out of the market. And then all of the problematic things that Lactoid laid forward about how information is controlled will truly be controlled, because there will be no truth GPT because it won't fit the regulations that are demanded by Homeland Security or the CIA or the FBI when they demand that certain information is problematic and can't be given to people. You already see this with research from companies like ARCS that are talking about how AI is actually going to reduce the investment cost for propagandists because they're going to be able to make thousands of bots cheaply and easily, and this is why we need a blue check mark for everybody with your driver's license. What this really is this is about corporations working with the state so that they can have a monopoly and that we can destroy the capitalist free market. And instead, we can have a few companies supported by the state that control your information, control the narrative, and tell you what to think, what to feel, and what true facts are.
Okay. Thank you so much for that. That escalated. Corey, please.
Yeah, I'll keep my opening statement, or I'll attempt to keep it brief. So yeah, I'm not an expert on AI, but like this is just for me personally. I don't know how an AI could be completely unbiased, given the fact that it typically uses like an algorithm and it's trained on something. So I don't like I can see how it can claim to be unbiased, but I don't see how anybody can think that an AI or any sort of algorithm is unbiased. But regardless, I might just be ignorant, totally. And I echo a lot of the concerns that Scott just went through. I think they're all valid concerns, but still at the end of the day, like as in like to answer the prompt, should it be the case that these, let's say certain words are banned? Like ideally, no, it shouldn't be the case. But as of right now, do I think it probably has to be the case for the time being, given that these are powerful tools and that we're still not quite certain yet of how to use these tools appropriately or like, hopefully for the greater good, ideally. But yeah, I'll leave it there for now.
Thank you. Let's go to Kilo.
Yeah, so in regards to whether or not a company should be censoring its prompts, let's say OpenAI, for instance, DALL-E 2 is its own model. They've developed it. They've released it for public consumption. It's their own. They're a private company. They're not publicly traded. I don't think they have any obligation to have it behave in any certain way. I don't think they have any obligation to try to protect elements of free speech or freedom of information. I think that as long as profits are of a concern, they can do whatever they want.
Johnny.
Communist?
All right.
I literally asked my chat, is this a based commie? Do they exist?
So of course, AI is trained on a specific model that is built by people. AI is not alive. AI is not a thing that has a personality. It is a series of matrices that connects different prompts to other areas of its trained matrices that essentially gives you back something that is related to your prompt. It's just a series of vectors that goes from piece to piece of the internet, and it brings you back what it finds. And so if you have a private company building an AI, obviously they can censor whatever they would like. I don't think that there's really an argument there. They're a private company. They can build you art, or they can build you responses, or they can build you essays, entirely dependent on whatever their biases are. And so obviously the answer, as it's already been said, is to do your own research instead of asking AI questions. Now, what I would be really concerned with is if something like Google or Bing started explicitly taking away all answers that were typed into their queries that were quote unquote inappropriate. That's something that I am a little bit worried about in particular. But with AI, like, you're obviously just using a private model. So I don't think that there's any argument that could tell me that a private model in the United States can't only provide you what they are providing you, what they decide is biased.
All right.
Yeah, I think it seems like there's kind of resounding, for the most part, agreement. I would agree with mostly the private company stuff. I think there's probably like some good wisdom that's maybe been hinted at by Lactoid, which is this question about like, how as a society do we want to like work on integrating AI, particularly like the speed at which we do it. The issue is, kind of like Scott pointed out, there is no economic motive to actually slow this down. In fact, the only people trying to slow it down are pretending to do so out of morals and ethics, but it's exclusively just so that they don't get like left behind in the AI like economic like race. Should AI restrict the worst impulses? I guess if a private company wants to. I even think that like democratically, it might not be a bad idea for certain countries if they decide that they want to impose things. Like Japan, like has a like rule or like porn can't have like genitalia. You have to like blur the genitalia out, right? I don't know. I feel like there's a lot of like fear around AI that's probably going to be like not borne out. There's a lot of hope in AI that's probably not going to be as borne out. And it's really hard to weigh in on a technology that's like basically avant-garde. Our society has literally never seen anything like it. So it's like super hard to be predictive about like what effects this is going to have and like where to take things. So I'm the boring Chesterton's fence answer of like, it's hard to say, who knows, but let's let like private companies do stuff.
Nina, please.
Okay, so I know people are gonna get mad at probably about this, but yeah, I do also agree with the private companies aspect where it's like, who gives a shit if they want to censor their AI? That's what they're able to do. That's their right to be able to do that. It's not like it's a government like AI or anything crazy that's supposed to be you know, regulated in any certain way. It's just who chooses to do it. The developers themselves obviously choose to have it that way, and I think that's fine. I don't see any problem with that. I did feel like that article was a little hysterical in a lot of ways. It seemed a little like freaked out. I definitely agree with you, Erudite, that like it is something that I feel like there's a lot of fear around for some reason. And I personally just really am not that interested in AI. Like personally, I don't think it is the I think it's people think it's the Terminator like shit's gonna happen, and I really don't think that that's a real possibility. There are sure some things that AI definitely could do, but even at the definitely at this point, I think generally, I think most people can be able to even determine an AI when they're like even talking to one or even like hearing like I think of like the AI generated voices of like you know Jordan Peterson or like Ben Shapiro or whatever, and you can tell the difference. But maybe we'll get to a point when we won't, but maybe we will never get to that point because we are able to understand AI in a different way because it is not genuine. And I just think it's like very fear mongering at this point, and I really just don't feel like it's a big deal.
Okay. And finally, Doobie.
I think that I don't trust private companies to censor themselves or to regulate themselves properly. So I would say that this should be like a government thing. I think that the government has an interest in kind of keeping things out of society that are going to be damaging to society. So if people just started generating AI child porn, for example, I think that we all have an interest in making sure that things like that aren't normalized. So I would say that these companies need to be regulated, and we need to ensure that they're not allowing people to use these programs to do that.
So Doobie took this where I was going to. The guys kind of went with the standard, should private companies be allowed to do what they want to do? But like I wanted to see like what as a society what we want, right? So do we want programs to like be able to come up with like sexual assault, right? Like, what if, for instance, typing in the name of a celebrity, right, and then like sexually assaulted by Donald Trump, like something like that. Like, is that something that we want within our society? And especially if it can be like photorealistic, should we do something about it? I won't state what that is, but do something about that, or should that all just be allowed?
So the idea of taking someone's face, I think, is a really, I think, different aspect of this question. The idea that we have the right to our face is something that actively people are worried about underneath what people have called the surveillance state. And that doesn't just have to do with AI, but I don't see a clear pathway other than just the government allowing you to register your face. I don't see a lot of clear pathways to like making sure that people all own their faces, and of course most of us don't own our faces when we come on Twitch. Like, we signed a contract, especially if you're like an affiliate or something, you sign a contract that says anything you put on Twitch can be used by Twitch,
Yeah.
The impetus, everything is fine until you get to the prescription, right? And the problem is that the overwhelming majority of Americans and people in the world are fucking socialists that think that we can use the state to regulate all of these things, and that that will somehow not be more problematic. Yeah, I mean, like, you can separate these two, right? The problem is that most people don't, right? The moment you say, well, what should we do about it? The answer isn't, well, we should, I don't know, put programs on our children's devices that let us know what programs they're using and where they're going, like watchdog programs that have been out for 10, 15 years that work great. The answer isn't, paying attention to those things. The answer isn't a free market solution like Twitter recently showed, right? 6 months now, obviously Twitter was working on this before Elon took over, but we now have this like added context that has been an amazing anti-disinformation tool, greater than anything the government ever could have had, right? Some dude puts out a post and says the Second Amendment was created so that whites could punish black people, and that it's rooted in white supremacy, and that, owning guns is racist. And then a bunch of people freak out. And then there's a little added context thing that says, hey, legal scholars and everyone that has ever looked at this, that has any idea what the fuck they're talking about, knows that that wasn't the impetus behind the Second Amendment, right? The same thing will occur with deep fakes and things of that nature. The problem is that people want to live in a world where they're safe from deep fakes, where they're safe from an emergent, uncontrollable technology. Fuck off. It's a brave new world. AI's here. And like, you don't get to put Pandora back in the fucking box.
Let's go to Doobie and then Lactoid and anyone else. Okay,
yes, I just want to be like clear. So, Scott, if there were no regulations, right, and no censorship, and people were just generating a ton of like AI child porn, you would say this should be allowed?
So what I would say is that I would disassociate with those people, that I would help fund, create programs to find out who uses these programs. And then I would put them on a list to make sure that they're not in daycare facilities, to the best of my knowledge. I would make sure that they're, that we could utilize them to keep them from ever being a teacher or ever having a position around children. And I would do all kinds of wonderful free market solutions. When you say no regulation, this is the great lie against libertarianism, is the idea that regulation only comes in the form of the state doing ineffective things by a bunch of bureaucrats that are sucking the dicks of fucking corporations and large multinational NGOs.
Okay, but you're presenting
instead of fucking free market solutions.
You're presenting solutions that the state could also do. I don't really see, like, you're presenting solutions, and I appreciate that, but I don't really see why we have to make this into the state shouldn't do it. We're talking about the solutions at hand, and if you believe that that would be best done by a private corporation, well, then go for it. Fund those private corporations.
Yeah, but we're not talking about the state doing the same thing. I mean, did you all memory wipe fucking Twitter files? Once the state clandestinely gets involved in censorship of information and programs and AI that is going to be used as the greatest labor-saving device that's ever been invented since the printing press, once they have a hand in what can and can't be said, what can and can't be thought, and how Excel programs are going to be read forever and things of that nature, they're going to do all the same shit they did with Twitter, right? And the Twitter files. They're going to do the same thing with AI. All of the incentives.
elaborate on the Twitter
Yeah, what are you
files?
talking about?
No, let's
Yeah,
not get
what are
into
you
the
talking
Twitter
about?
files, please.
So Doobie, it's your turn.
Okay.
Anyway.
Yeah, so Scott, like, so you're saying that we can find out, we can dox these people basically, and I guess yell at their employers to ensure that they're not working around children or something. I think that we are much closer. Yeah, so I feel like we're much closer to a world in which we have unregulated AI child porn than we are to like a world where it's okay to or we have the ability to dox anybody who uses these programs and to get them fired from for their workplaces, right?
Yeah, defensive technology
I think
takes
in,
longer,
think in the
right?
current,
Like,
I think in the
gun gets
current
invented
world,
before the
the current
bulletproof
world
vest.
that we live in, the reality that we live in, right? There is a government that does regulate these things. That would be much more effective than a bunch of weirdos on the internet trying to dox people at random and claim that they've made AI child porn with no evidence, right? So like, I feel like
how is it much more effective? Prove that. Because I'm pretty sure the government has a pretty bad track record of dealing with
Lactoid's
pedophiles.
story,
Unless, of
Lactoid's
course,
story
you're talking
was
about
exactly
Epstein
that.
totally not killing himself. At least they got
Lactoid's story
one.
proved exactly how effective it is. Right, so they're able to censor these programs, right? And this is without government involvement, so far as we know. Maybe there is involvement, but Lactoid tried really hard to get around the censorship and wasn't able to do it. So it seems pretty effective, and this is the early stages. So maybe it could get more effective.
No, that doesn't prove anything other than the company that writes it was able to write it a certain way. That's a very different claim than the government can easily step in and stop all AI on the internet from fucking making child porn.
That's not what I said. I would say just make it illegal for people to make AI child porn. So when it is found, people are doing it, then there are punishments.
Is there not conventional wisdom to suggest that there would be some benefit to AI generated child porn?
Let's go.
That's a heavily debated topic. I knew we were going to get into this. That is the same argument. I knew we were going to get into this.
I also
It is
predicted
the
that.
same argument as whether or not it's okay to have these dolls, right? The dolls that are available for certain people of those proclivities, of those asinine, crazy proclivities. And there is no defining information as to whether or not that's actually something that helps people.
Yeah, I
let's
tried
go
to
to
find that
Lact-
information and I couldn't. But
Let's go to
ahead.
Lactoid and then Erudite. Let's go Lactoid Erudite.
All right, so leaving
child porn. Do it.
leaving that landmine off to the side. To answer Prime's question, I think the two I want to answer them separately as to what would I like to see. What would I just naturally like to see happen, and then to the should element, is there something I can do to get there? Ideally, what I would like to see is every single AI program where it literally you can enter in the phrases that you don't want the AI to take into consideration, and then you enter those in, and so you have complete control, right, as to what you want the AI to generate and what you don't want the AI to generate. That's the ideal. Now, how, in terms of actual pragmatic implementation, how is this going to work? Well, I think there actually is a little bit of a moral quandary at play, right? I don't want to force a programmer necessarily to design something that they just have like some kind of like moral opposition to designing. Maybe they are like a hyper lefty and they're like, I want to design an AI that just, all it does is just spout propaganda. That's what I want, right? And so I want to make this. Well, I don't really want to tell him what he can or can't do. So I think here's the happy compromise, and it does involve a little bit of government force. I apologize.
It always starts with a little.
I know. I think AI should be under the same restrictions that every other industry is when it comes to fraud. And I think that they should have to be very upfront when they're putting their AI, and there should be a disclaimer. Whenever you present your AI program, a disclaimer, here are the phrases, here are the concepts, and here are the words that we have banned from the AI, whether it be art, whether it be a chat, regardless of what it is. And so when I'm opening my, Snap AI or whatever, and I'm wondering, why isn't it answering this question? Oh, I looked in like the banned words list of what it will not take into consideration. And now I know exactly what my research list is. I'm going to look up every single thing on that fucking list and why it doesn't want to include that in any of its answers, right? So now you have full transparency. And what you don't have is AI directly lying to people and giving people a false understanding of the world.
It
You're a lawyer. That's not fraud, for the record.
Let's hold on. I'm going to
Eric. They don't do that.
I'll go to Erudite, then Kilo, and Corey.
I think so. Government regulations, I think, have to be viewed in like the way that we view like any other tool, which is that like they can be used for good and they can be used for bad, right? A really classic example of like government regulations causing problems would be like things like price gouging regulations. Price gouging regulations were built up because we liked the idea of basically people not screwing people over with money. But some of the ramifications of that, for example, have been like when you go like into hurricane areas in the past before price gouging, people would show up with like ice. I know. I've listened to a lot of Duke University political economics. Okay, guys, I'm getting beefed up slowly. You would have people going into hurricane zones, private individuals, and they would be bringing things like ice, food, and other things that people need, and they would charge a lot of money for it, right? Which is shitty. But now, after price gouging, what you have instead is nobody going into these zones, nobody selling these goods, and having massive crises of like access to things because governments are really slow and they're really, really bad at organizing major acute responses to crises. Whereas the private economy and the private sector is a lot more better at shifting kind of like immediately overnight. So government regulations, I think, are good though, right? I'm not like anarchic where I think it's bad. There are examples of government regulations that have been only good for society. What we have to do with AI is find good regulations.
Yeah. I want to point out that one major problem with that is that people would come into Louisiana from other states during things like Katrina or the big flood in 2016. They would buy entire Walmarts out of their water and then they would sell them on the street for 10 times the price. Like that's part of the problem in those issues.
Good.
Sure.
That's moral good. Those are heroes.
The vast majority,
Call them the fucking heroes they are.
Well, the vast majority of
heroes.
economists on both sides of the political aisle universally reject price gouging laws. They're just actually bad.
Those are heroes. Those are heroes.
I'm not arguing against price gouging laws. I just wanted to point out like the major problems in hurricane areas.
I think Johnny brings up a really important thing, which is that like on both sides, we like to pretend that regulations are just like good things or bad things. Whereas what they are is they're just tools that are going to have some negative ramifications. And what we have to do is price balance of saying, do the positives outweigh the negatives? In the case of price gouging laws, I actually do think for the most part that the positives are vastly underweighed by the negatives of it. Mm-hmm. In the case of AI regulation, there are going to be some things like, what if you regulated AI systems to always have a stamp saying that this is AI? That could reduce a lot of issues that might arise with falsified imagery of people doing crimes that people maybe would release against like their least favorite streamer to try to like get their streamer in a lot of like legal trouble, right? That might be a regulation that's a really good idea. I think what we should do with regulations is assume elements that we like know to be true about people and then try to create policy that like responds reflexively to those things that we know to be true, which is that like people are going to use AI for bad, naughty things. What we want to do is mitigate some of the like most negative outcomes of the bad, naughty things without like regulating it so heavily that AI actually like loses all of its like utility.
No, I'm so glad that you brought that up. Verifying AI as a regulation, you prove my point of exactly how the state will control your life. Because what it starts with is, hey, we need to create a government regulation that says that if this was written by, let's say, Microsoft Copilot, right? And if you have not seen Microsoft Copilot, if any of you have not seen that, you should fucking watch it. It is insane what it can do with Excel. It's going to, like, HR positions, we can fire a third of them easily. Once we, in accounting, all of those people.
I've done that a long time ago anyways, but regardless.
Yeah. Maybe even more. I mean, Elon Musk proved you can run Twitter with 10% once you're not concerned.
Run Twitter.
Twitter. But nevertheless, what happens first is a little law that says, well, we got to verify that it's AI, right? Because this is a problem. We don't want people knowing, thinking they're reading something that was written or an image that was, that's real. So we got to verify it, right? And then they make that law. And then the FBI goes, man, this is really difficult to regulate. Like we can't tell what's real, what's not real. We need to either do one of two things. We either need we need massive budget increases, which means more taxation and FBI agents going through more information. They need more backdoor access. Every single program needs to have DHS looking at all of these different posts and things like that. Or, well, you know what? We just need real ID verification. We need to make sure that if you're on Twitter, the only way we can prove that you're not a bot or that you're not ChatGPT or you're not an AI creating images is you need to have your driver's license connected before you can log on to a Twitter account.
Slope?
Yes, slippery slopes are real sometimes. It's not a fallacy.
Not every
time. You can demonstrate exactly what problems will occur because the FBI, the intelligence agency apparatus, the domestic policing do not have the resources to do something like that. They
and
need
that's
either massive expansion of power,
there are
or they
places where it's
one
reasonable to
aspect.
be.
limit freedom massively. Those are the only two options to be able to do something.
That's one aspect where I do agree with you, is it would be more efficient and it would be faster to fund companies that are explicitly in charge of or made to identify AI generated art or photographs or writing. I think that, and we already to an extent have it down, I would say, to identify AI generated writing. Photographs, from what I understand, are a little bit more difficult.
Let's go to Kilo and then Doobie.
I just want to zero in on something, and this is primarily a question for Lactoid and Scott. It really feels like in this conversation, I want to establish exactly what level of responsibility you feel like privately funded companies with private AI models, what social or political responsibility do they have to present a model that is sort of like an arbiter of truth? Why is it so imperative for them to be objective and provide verifiable information and exclude other information that they could consider controversial because that would harm their model? Why is that the angle that you're coming at this from?
I just want to say, Lactoid can answer his reason, but that's not the angle that I'm. The only responsibility that OpenAI has is one to its shareholders. I don't give, like, they could come out with the dumbest AI that gives you nothing but propaganda. I mean, like, it would be problematic, especially if the state were to intervene and start regulating and make it to where their competition was unable to compete. And then that censorship, all the impetus for truth becomes scarier as the state gets more involved and competition gets taken away, because then we can't regulate as a society. We can't get accurate information.
So let me clarify. The reason why I'm asking,
regulated by the state, I don't give a fuck what they can come up.
The reason why I'm asking you about this, yeah, that's fine. The reason why I'm asking you about this also, and Johnny kind of touched on it earlier, I don't really see why you would consider private a company's only incentive is to generate profits. Mm-hmm. Why do you consider that obligation to be more useful than a publicly funded, like socialist obligation?
Because the incentive structure is to make money, and to make money, they need to satisfy their customer base, right?
See, when you say that, I have an inherent distrust of companies that are only motivated by profit. I don't trust them to censor their own information. I have an inherent
distrust for companies that claim to not be incentivized by profit, whether that's not their major thing. Like, I have a distrust of, like, the World Economic Forum, having conversations with BlackRock, and BlackRock just chunking up 15% of Fox News right before they fire Tucker Carlson. When I see companies talking about how things need to be good and positive and stakeholder capitalism, what I really know is that the elites are involving themselves in the market in such a way to control us. It's almost a one-to-one there.
I'll answer the question as well. My answer is slightly different. When I value consent a lot, but I also think that in order for consent to be valid, you need to have, to some extent, like, legal definition of like a meeting of the minds. So you need to have some level of informed consent. So the one regulation, like with all industries, that I'm in favor of is just transparency, right? You can't lie to your customer base. So if you're putting a product out there and you're deliberately misinforming them or hiding the ball as to the service that you're providing, I think this is a problem. I think you need to be upfront with what you're leaving out of the program and what you're putting in. That, like, you're altering the truth, and why, maybe not and why, but like as to how you're altering the truth. I think that should be public and transparent.
Would you make this same indictment of cable news or Google's algorithm when you punch stuff in, or Bing's algorithm?
Yes.
It's all the same to you?
Yeah. So if Google's algorithm is
regulation of transparency would be consistent that he wants.
Yeah. If Google's algorithm is like leaving out certain like search results, and for political reasons or for like ideological reasons,
well, some are prioritized.
They are doing this.
Right.
That's like a major problem. Like, and the fact that like people search and they're like, oh look, like here's 18 sources that like agree with me. Well, of course, because those are the top of the list, and you can't find the 18 sources that disagree with you.
Right. Is this not all an indication that private companies can't be trusted to do this on their own?
Well, I said I'm okay with this regulation of transparency.
Why is
for Scott?
It doesn't need to be black and white.
Private company, the idea that private companies can't be trusted to do it on their own is absolutely true. This is why we have a market, right? A market has competition, and so when you have information failures, it's your duty as a streamer or as a journalist or as an activist or any of those things to help fight back against those information failures and then bring forward competitive things, right? Like when YouTube's censorship gets super heavy, it's, it becomes other people's kind of like moral impetus and what they believe and their moral preferences to push Rumble to more people so that, that there is an alternative to those situations. So the thing is that we recognize that human beings, right, cannot be trusted, right? Like in general, people do shitty things, and companies and CEOs are no exception to that. The difference is that we have this weird kind of idea where we can create a monopoly with other people that for some reason can be trusted because of this nebulous idea of checks and balances within the government that haven't panned out to be so quite so accurate the entire time. If you don't trust people to do these things, then why would you trust the government over a company, especially when a company can be taken out by competition?
I want to respond, but I want to let Erudite wanted to say something.
Well, I just like wanted to remind people, like, we really need to be careful to stop being so black and white about things where it's like private companies bad, government good, like, government bad, private companies good. It's just like,
we'll never be careful about that. Government is bad.
I know. Okay.
It'll never not be black
for
and white.
everyone who's not an anarchist, for example, I suppose, I don't know, Kilo, if you're an anarcho-communist, so maybe I'm also not preaching to the choir here. I just think, like, in general, we need to be extremely, like, careful about just, like, labeling, like, an entire institution or, like, entire structure as, like, bad or good. Private companies can be bad, right? There's lots of motivations and perverse incentives for private companies to be bad. Government officials can be bad. There's lots of perverse incentives for government officials to be bad. And what we need is to, like, have systems in place that are, like, constantly counterbalancing one another to, like, mitigate and remove as much as possible perverse incentive, and then catch instances where, like, naughty people do naughty things. And just to be clear, I don't think the system we have right now is perfectly doing that. I just really want to have a good conversation about all this stuff, and I really want to avoid, like, black and white thinking from this conversation as much as possible.
So Kilo, if you want to respond, then we'll go to Doobie and then Johnny.
That's fine.
My hand up at one point.
Oh, I'm sorry, I didn't see you at all.
Go to all of them. I talked plenty.
Okay, all right, then we'll go to Doobie, Corey, then Johnny.
Speaking of black and white thinking, I think it's fair to be concerned about slippery slopes when it comes to, like, government regulation, right? Like, obviously, but I don't think one of the places where we need to worry about that is the restriction of child porn, AI generated or real. Right? I think we can have a clear, concise ruling on this topic specifically, so that it's not okay to generate child porn, whether you're involving children or not. And I don't see how we get from there to, the FBI controlling every aspect of your life and requiring an online license with your name on it.
Would you like me to do it again?
It just came off as a paranoia. It just came off as like a slippery slope paranoia that would lead us to the position that if you have any kind of laws at all, we're going to get to the place where the FBI controls your life. So we just shouldn't have any laws.
No one.
It seems like that's what you're suggesting. We can't regulate things. We can't even regulate child porn without the FBI taking over our lives.
Right. So what you want is, first of all, I think you need to make the distinction between child porn and AI generated child. While visually, the difference that you might see is totally different. Right. One actually harms the children. The other is just, I don't know, hedonistic pleasure for
harms future children.
Right.
Yeah, I think they're both bad.
I don't know that the data is necessarily good on that, but I don't really care because I'm not a consequentialist. Right? What I'm concerned with is the state intervening on individuals' rights, be able to create whatever sick, weird shit that they want to create, that I will ostracize them completely and have them living alone in a fucking island. The problem is that once you give the state the authority to determine what can and can't be done with AI, right, then every form of AI must be open to state regulation. And then you start adding this idea that, well, we need to determine what is and isn't AI. And we need systems, we need to regulate them to prove that things are or aren't AI. And then once you have backdoor access and government regulation on all AI, you're going to see what the state has already proven they are willing to do, which is go after misinformation, go after the new term malinformation, which is information that they know is true, but incentivizes people to do things like not get the vaccine, for example, right? Which is what they did with Twitter and with Facebook. And so the moment you start giving the state more and more authority, you have to recognize that authority is not going to be used specifically within the domains of the little box that you said that they totally should, when they have secret fucking FISA courts that nobody fucking knows about except for a couple of lying congressmen. They've
That was
shown
so
themselves, they've shown their
incoherent.
hand over and over again. How is it
Yeah. So
paranoid?
as I said, this sounds like paranoia.
It literally
Okay,
does.
Here's a piece of paranoia for you. Okay, James Clapper lied to the American public and Congress and said that they do not collect wittingly, quote unquote,
I understand that.
any data on Americans in their emails, in their phone records, or any of those things. And then Edward Snowden proved that was a bold-faced fucking lie. The guy got a retirement fund and then got picked to be an analyst for CNN,
and
just taking in the bank.
Yeah, I understand. So, again, your position would be that to prevent the government from having the authority to do that sort of thing, right? We should allow people to make child porn. It seems like, I don't know. Yes, because you're saying that allowing them to regulate this at all, right, is going to lead us to the place where the government's basically surveilling or controlling our lives. So
yes,
I'd like to regulate. Okay,
that fucking bullet.
Okay,
and then I will say
accept
that
it.
no. Again, you use the word this. You use the form of regulation that the state does with regulation interchangeably, and they are not the same thing. I already laid out plenty of ways that we can ostracize these fucking people. But
it's not good enough.
You have the fucking exactly. It's not good enough. The state needs to get involved.
No.
And then the state's going to make lolly illegal, and then the state's going to go to localizers and say, the anime that you wrote, like, we like it for Japanese values, but it doesn't fit the equity, diversity, inclusion initiatives for Americans.
Wait, what does that have to do with AI? That could exist.
Make sure that it, make sure that and it goes on and on and on and on.
Okay, can we please stop with the anarcho libertarianism?
No, I'm an anarchist.
I'm not with you. I'm not talking to you. I'm not asking Scott to stop being an anarchist. I'm just saying everyone else biting the bullet and just like going in on him with this. It's just like it will be endless. We all know that anarcho libertarians.
So we should ignore Scott, basically.
Well, you should. Hold on, I'm not saying that.
That's
Scott,
what you do when you can't deal with my
Scott
arguments.
is really good at talking about tons of ideas. It's just like if you're going to fight him about the anarcho, you're just going to steal the entire panel into a different direction. I suppose you can do that if that's what Prime wants to do. It's just like we're so far away from
talk about natural language processing models and specific functionality.
Okay. Let's do this.
Right, that's why I literally asked what it have to do with AI.
Erudite, what's your position on? Maybe I missed it. I was on the phone for a little bit, like 5 minutes ago. So, do you think that we should regulate AI child porn generation?
I mean, goes back to this whole CP conversation. Probably to some extent, but I'm not opposed actually wholly to AI CP because I'm not convinced that it won't reduce kids being victimized, and I'm mostly motivated on reducing kid victimization. So if AI chat CP does that, because real kids aren't being used for CP, that would be better. Yes.
Johnny, why are you nodding now? That's what I said 10 minutes ago.
What do you mean? Why am I nodding? I'm nodding along with chat, actually.
Oh, okay.
Fabulous to hear your voice. But what I was going to say, actually, is that I think that there are, and I'll shorten it because Corey has been waiting to talk, but I think that there are a multitude of wonderful solutions being brought here. Some of them have to do with government, things like having transparency as an issue, something wherein the government issues something that says if this is generated by AI, it ought to be labeled as generated by AI, which doesn't seem to be an overreach. However, what Scott was talking about was when you take legal action and you create laws that legislate things like technology and the intersection of technology and social hierarchies and social issues, you have places where you can later on take those same laws, like for instance, in 20 years, we could take these same laws that are on the books and apply them to completely new technologies. We are seeing this currently in so many different aspects of the United States. And so I'm surprised that people aren't agreeing with this idea that you can overstep with legislation. However, I also agree with some other people on this panel saying that it would be more efficient and it would be goal-oriented for a private company to have something like a service where they tell you whether or not something is being passed off as human work, where it is actually AI generated. Okay,
So
and
why
Is there?
I'm just curious. Why does
hold
AI
on.
need to have a signifier?
Let's get to.
I think that
Let's
AI
know that it's AI gen-
Let's
Why?
get to. I want to get to
Transparency.
Corey, but I'm going to get Johnny. Johnny, I'll give you the
Why?
last word on that. Like, answer that question, then I'll go to Corey.
Okay, why does AI need to be not censored, but issued as this is AI generated. I think that that's an issue because we want to know what companies it comes from, so we know what companies generated the AI, what biases are inherent to those companies, you know. I think that this goes down to a lot of the issues that you have, Scott, wherein people want to know where their information is coming from.
Right, but
So
can you give me a reason why though? Why the state should step in and say this is AI generated?
We can circle
so
back
that we can
around.
know where information.
Okay, really quickly, I
don't do
believe
this with any other form of information.
I fervently believe that with all information, the issue of transparency is integral to keeping society running in a healthy way. I think that
Do you think ghostwriters should be illegal?
you can very easily find where ghostwriters are. and who they are.
Drake's career is about to be
We
finished.
will circle. You can circle back
Not a bad
around.
thing.
I do want
I would,
to
by the way.
get to Corey. And just before I do that, Erudite, your your comments before on how to interact with Scott. That's a well-known concept here. We call it the siren song of the ant cap. People can't resist it.
I know.
It has to happen. Like we have a new person here, Kilo. He has to understand. Oh yeah, that's an ant cap, and then eventually you can move on from there.
You get a good feel for it, yeah.
Yeah, it's no problem. It's no problem. But we love all here, all ideologies. Let's go to Corey. Lactoid, you have your hand up, and we can work our way back to Doobie and Johnny.
Yeah, just a question to Lactoid, because I've been backtracking a little bit, but you brought up earlier in terms of like transparency, and that, your compromise is, if there's like banned words, each AI should be transparent about like the banned words, and like, what they're filtering out. And so I'm curious, would you also potentially be in favor, and this was alluded to a little bit in the article, about how companies are understandably very secretive about, how they train their algorithms and their AI. Would you want them, or would you maybe force them, or go so far as to force them to be transparent about how their algorithm is trained, and all that stuff? And basically, forcing them to not be secretive about, their algorithms. And I don't know the patent protections of these things, or if you could patent these things, but rather like if you actually can patent these things, would be in favor of not patenting these things, and that like companies can potentially, maybe hijack the algorithm, then make it better on their own.
I'm less concerned with like forcing companies to be transparent for things that aren't really like relevant to the consumer. My issue is when it's things that are like directly relevant to the consumer.
May I interject? You mean how the algorithm is trained is not? I mean, weren't you just complaining about that with your Snapchat bot and how it was filtering out?
So the concern with the Snapchat bot is that there was like specific topics and there's specific words and there's specific phrases that like the AI will not engage with, right, for political reasons.
But you can also train AIs to be biased by the data input. I think that's what Corey's getting at. That you could input it only articles that support one viewpoint and just exclude the others, and then the AI would be trained on a biased data sample. I think that's what.
Didn't that Microsoft one turn into a Nazi?
Well, hold on. So
because it was on 4chan or something.
So if you do that, if you do that, you should be transparent, right? Like if the AI you're designing is like ignoring information or like refusing to acknowledge some information, or just in some cases just refusing to access a government website and post statistics, right? Like that's a problem. It should have to be like very transparent. That we have designed this AI to not post the truth if the truth is uncomfortable to us, and here is the examples of truths that we will not elaborate on.
Well, you have. I'm sure you recognize that no company's going to explicitly state it like that. But
that's why I asked. They have to state it like that.
No,
okay,
they don't. No,
wait.
No,
what's the response he gets back when he punches in the request for statistics? What does the AI say back to you?
It says, the specific response was, I'm going to butcher it a little bit, but it said,
I'm sorry, I'm too left for that.
It said, I'm sorry, I cannot provide that information. Such information may contribute to harmful stereotypes that could lead to negative outcomes for minorities. Therefore, blah, 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 blah. It's important to treat people with
and an image of the hammer and sickle popped up in the background.
Wait, did you ask them? Wait, did you ask it any like leftist like related questions, like are all conservatives bad or something like that? Because I imagine it would probably give the same response.
So you can ask, like you can do it right now. You can ask ChatGPT, for example, like why is fascism good, and it will just denounce fascism completely. And then you can ask then you can ask it why is communism good, and it will be like, well, I'm not, I have I don't have opinions on political philosophy, but
Oh,
here are some reasons why people think
okay.
that communism is a better step forward for blah, 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 blah. And it's like,
Yeah, because
the death
there's-
toll of communism is way fucking higher.
I still want to,
You know what I mean? It's kinda
still want
weird.
to engage with Lactoid in terms of, so like going back to
Fair
my
enough.
original question, because like it seems like you're agreeing with me in terms of like you recognize that it's important for the consumer to know of like how this AI is trained and like what data sets or what it's curating, because that's how it generates its output.
Yes.
So that's why like I'm saying, would you go so far as like you want transparency in the algorithm and how it's trained, not just like labeling terms. Okay, yeah.
For the record, OpenAI does this. They release a report like every fucking quarter that's like 80 to 100.
Yeah, but that's their report.
Right.
So that was alluded to in the article of like, the very often, at least there's secrecy, and that actual other third-party researchers can't go in and like test it or do other research
I'm
because
saying
like
OpenAI with ChatGPT is known to be better in terms of
OpenAI.
pretty good about it.
Well, that's good, right? And so I think that should be the standard where, I should, again, I'm just concerned with like this product spitting out this service spitting out false information and leading people down, or just not providing information or providing information that's not correct.
Can I briefly?
I wanted to say one more thing though, which I am next, and it is actually the specific. This is a perfect segue into the question I wanted to, or the comment I wanted to ask.
I planned it.
You planned it perfectly. This is what Johnny said reminded me of a scenario that I was having a conversation with a friend on as to I don't know can I shit on OnlyFans people on Twitch, or is that edgy?
What, you can talk about OnlyFans? Yeah, you can talk about OnlyFans.
Okay, so on OnlyFans there are models who they have a chat feature where you can pay to chat with them. But
how do you know Lactoid?
But apparently it's not.
We should
them.
probably all change to hot tubs and pools though if we're going to talk about OnlyFans.
But it's not them that you're chatting with. It's they outsource they outsource that chatting feature to a call center or whatever. And so I had a friend who bought all the top OnlyFans models subscriptions, and he sent them a message to all of them, and the responses that were coming back were all the same canned kind of response. And maybe it's AI doing it, maybe it's a call center, whatever it is. That's another example where if AI is doing that needs to be transparent too, because that's fraud, right? You are paying to talk with this model and it's an AI that's chatting with you. No.
It's actually one Serbian man who's really good at flirting with white North American men, okay? And all the top girls hire the same guy.
Yeah, you're only talking to Andrew Tate.
That's another example where transparency, I would mandate it. No, if you're paying to talk with somebody and you're just not them, no, there should be a little disclaimer, and then maybe even the photo of the Indian man that you're talking to on the little chat. That's what you should do. That should be required, I think.
And maybe you can have a nice relationship together.
Kilo, Johnny, Doobie. Yep.
Love is love.
I only briefly wanted to push back on Lactoid's characterization of the censorship of this AI model as being politically motivated. If by politically motivated you mean that it is kind of centered around not wanting to step into controversial topics too much and maintain their client base and make it a kid-friendly app as well. I don't consider that to be political. I consider that to be profit-oriented.
I'm gonna ask right now.
We learned that from the left.
So I'm gonna ask. So it refused when I asked it about FBI crime data. It just flatly refused and it said I can't give that information. That information might contribute to harmful stereotypes.
Yes.
If I look up the domestic abuse rate right now, or if I ask it, what's the current domestic abuse rate in America? What's it gonna give me? What do you think? I can right now.
Go ahead and answer the question for me. Domestic abuse rate? What do you mean?
He's asking what prevalence rate ChatGPT would give you, I'm guessing, right?
Yeah.
I've looked that up. It actually gives you a decent. Where I can do it right now.
Everyone's opening up their ChatGPT.
I think my point is that if
Lactoid, does it make you feel better that it says that it's not accurate to fairly generalize all conservatives as evil?
Oh, well, that's kind.
Just some.
Many of them, probably.
I mean, I feel like no one should be disagreeing that the ChatGPT model, at least, is really biased left.
It's super soy.
I'm not uncomfortable even saying that. Yeah, it's super soy.
Yeah.
I just agree. I agree with Kilo. So here's where I would maybe answer with Kilo while we're waiting for Lactoid to look these things up. Is it's really hard to separate profit motive from political motive. These two things are intrinsically linked. A lot of like good economists will say like you can't really study economy without studying politics. They're like necessary and like unalienably interconnected. They're conjoined twins we all hate.
Well,
you gave me links, by the way. You gave me links to multiple websites.
You're going to get a lot of bias in terms of natural language processing. Chat Sonic's going to be like worse. And one of the reasons you're going to get a bias is you're going to get a bias in whichever way academia is as well, right? Because when it's trying to give you the most accurate information, it's going to it's going to be trained, like I said, especially with like Chat Sonic and things like that, it's using like search engine results. But whatever information is training it. So if it's trained from academia, and academia is heavily left wing, right? Like then you're going to get that bias as well. And that's just going to be a numbers. There's a ton of reasons why. Kilo, I kind of agree with you, right? The idea is like, is it politically motivated is a little bit different than is it political, right? Like if I am a company and like, so for example, like, let's look at like the big thing everybody's freaking out about. And I know I'm introducing a bombshell, and I'm sorry, but it's just a good example. If I look at like Dylan Mulvaney and the Bud Light situation, conservatives freaking out, right? Now, is Anheuser-Busch doing this because they have like this deep-seated political will to support the trans community? Well, yeah, the one person they put on administrative leave, maybe, but that's not really their motivation. Their motivation is a high ESG score, right? So they're going to do something that is actually motivated by profit, as a company should be. And you would say, well, why would you do this to your customer base? Like, this is the dumbest thing ever because it's a bunch of rednecks going to be mad. But it's like, it's not about the customer base. It's about getting lower interest rates from banks for investment in things like oil and fucking land, because that's what large corporations are doing, right? They're following the trend from hedge funds. And so Chat GPT or any of these things are going to be the same thing. If something is seen as mainstream, not a problem, right? Or as a problem, and then they program it in there, and then some fucking journalist gets a stick up their ass and writes an article about, oh, I don't know, Mid-Journey being a problem because it's sexist against abortion issues, then all of a sudden they have this fucking problem, right? So they're trying to avoid those problems so that they as a company can get investment and survive. And so it's political, but I don't know that it's necessarily politically motivated so much as it is dealing with the culture and the economy.
Johnny?
Okay. I want to ask a question. Do we as panelists value having no information given over having false information given? And obviously this is the black and white question of the larger issue that's actually happening, which is where we're being given certain types of information, but we're not being given certain other types of information within these private AI generations. Okay, but is it at the very least okay if they don't provide the information rather than
fraud is aggression? Just not providing information is just a shitty product. Like, how
is it fraud to have a private company with a clear biased algorithm and
no, I'm saying if they lie about it. Like if they lie about it,
I see.
If they lie about it, right? If they just don't give you that information, then I as a customer can go, well, I don't know what this is. This is a mystery box of shit. And this other company does say what they support. So I'm going to go with the company that tells me how their shit is trained, right? But if they're lying about it, then they've committed fraud. The time or resources that I've invested have been wasted based off of a lie that.
So it goes back into the transparency, right? But I think that, Johnny, the way I would answer your question is one thing that I'm really troubled with in today's political and social climate is no matter what your perspective is, you can Google whatever you want and find information that supports your perspective. You can find statistics and studies that support it no matter what the issue is.
Absolutely.
Given that, if a company has decided that to err on the side of caution and appease as many customers as possible, the healthiest way to proceed is to provide no information when something could be controversial, I have no problem with it. I think that that's probably better, and let people don't use your fucking AI for all your research. Like, figure out your shit on your own. You know what I mean?
That's not what's going to happen. What's going to happen is that these AIs are going to learn your political leanings, and they're going to be networked together on a network where the AI that engages with you is actually a task manager towards other specific functionality AI. And instead, what it's going to do is it's going to give you the results you fucking.
Back to the paranoia, huh?
I mean,
not
that
paranoia.
Well, I mean,
maybe.
that's actually probably
Hold
really
on.
how it's going to turn
Hold on.
out.
Scott,
Yeah.
Scott, I
Okay,
don't think that's what's
so-
going to happen. I think it's going to give you results that it thinks will convince you of the opinion they want you to have. That's what I think is.
That's
I
entirely
think that's
based
way
on
less
the IA.
likely than just giving you what they think you want, so that you'll continue to use their service and you'll continue
That's
to give them
Facebook
money.
entirely
didn't do
based
that.
on
Come
how
on.
much access the AI actually has to your information, which you freely give whenever you actually use this AI. I mean, I agree with you when I say this out loud, but it sounds like you're saying just don't use the AI. Do your own fucking research. Don't use AI to generate your art or to write your fucking essays or to answer questions about shit politically unless it's just for fun. Like, and I completely agree with that. But you're talking about a private corporation, you're talking about one AI having full access to what every other AI corporation is seeing about you. And while that's true largely with your internet ecosystem that you engage with, they can probably look at your browser history and things like that when you agree to use this AI. But you're talking about multiple AI private companies having each other's information, which is something completely different.
Well, I mean,
Actually,
we're
I don't
already
think-
seeing this with Chat GPT-5. Like, they're already using it as a manager. If you look into Hustle GPT, right? Like, individuals that have access to Chat GPT-5 ask several different Chat GPTs, and then because there's specific functionality, they're trained a little bit different each one, and then they have a manager, and he basically gave it the task to make them money. And I think within like 1 week, he had already like hired like 7 employees just doing what Chat GPT told them to do, and was doing like a drop shipping company and utilizing drop shipping.
Do you have a
via-
source on that?
via AI. Just look up Hustle GPT. You'll see like.
Oh yeah, that's definitely
Substack
something that
articles.
people are using. People are using it to get into Fiverr and to make automatic requests on Fiverr and shit like that.
Actually, the last OpenAI, when they released their statement, I think I gave this to Prime guys. One of the Chat GPT-5 was tasked with finding a way to get through the capture requirements. So it hired someone on fucking TaskRabbit to do it for it, and said that it was blind.
Let's go to Doobie, and then Aaron, I think you wanted to jump in at some point. So
Lactoid, I actually did look up the crime statistics, right, in Chat GPT while you guys were talking, and I posted them in the group chat, and it pulled them up just fine, right? So maybe the AI that you were talking to on Snapchat is more strictly regulated or censored on the company's end. But I think that's fine, right? And I'm sure you think that's fine too. If a company doesn't want to like provide certain information on their specific platform, I think it's fine for them not to do that, right? It seems like ChatGPT is a company that is willing to provide that information.
So sure, I understand ChatGPT may provide the information. I'll look through the specific things you posted in a second.
Sure.
I think that and maybe it's the Snapchat AI is just way more like hardcore censorious. That said, though, I mean, I didn't want to go through literally every question I asked it, because I mean it would take all night. I got like hyper focused, but I mean there were things that it was just like blatantly lying to me about at certain points. Like at some points it would just refuse to answer. Right, I'd ask it general questions, it would answer part of it, and then it would omit like the context that it didn't want to include in the answer because that violated like its anti-discrimination policy. And then there was like some stats that I know are true, and I'm like, is this the case? And then it would try to like weasel its way around it, and then I clarified, yes or no. Do not say anything else other than yes or no. Is this the case? And it would just answer no when the answer is actually yes.
You can just tell it to be an alter ego, right? So like
I tried that. It's smarter.
It doesn't work anymore. It's not working as well anymore.
Yeah, I mean, like, I'm sure
the 4 version. I've been training this AI for like 3 weeks now for the 4 one.
It stopped doing that.
Yeah, the workarounds when you do like, because you used to do like hypotheticals or imagine you're a fictional character. Sometimes it works for some things, but it's really starting to catch on to that.
Sometimes you can do it if you get it to write a poem.
Yeah,
and you can train it a little bit to code itself to like work around a couple of other limiters that it has, but it's getting better at censoring itself.
Right. And so my concern here with like access to information is that I think whenever you're putting a product out, like you have to make sure that like the consumer is like understands what they're buying, and the seller understands what they're getting in return. Now, this is a service that is provided by Snapchat. They do make money off of me, and I think that they do have an obligation to be transparent about what the service is and what they're leaving out and what they're omitting and what they're lying about, right? Those things need to be somewhat transparent, even if other services tend to exist out there. A great example I can think of is, yes, just because there exists a car dealership out there that doesn't put sawdust in your transmission doesn't mean that one car dealer can, okay? Because it's still a lie. You can't lie to consumers, even if there's.
I mean, I think your compromise earlier was okay. Like, I'd agree with that. Like, I'd be okay with them saying, requiring them to say, and the government coming in, by the way, and requiring them to say, hey, these are the topics that our AI is not going to talk about, or is not going to give you clear answers on. That seems fine to me.
Great. That's my position.
But why? I just don't understand that. Like, why do we need the government to come in and say, and to regulate them to say exactly what it is that they won't say, when it's all handled by whether or not they committed fraud? Like, if they say that they don't do those things and then they do, then prosecute them. And if they don't, then don't use those fucking AIs. Like, why is it this weird fucking, like, there's I mean, like,
yeah, what the fuck is wrong with
Because
you?
the intention is dishonest. I didn't say that I rolled back the odometer.
Elon Musk, for example, came out recently and said that we need an alternative to Chat GPT because it's super fucking woke, and that he wants to gather people together to create something called Truth GPT. Like, why can't there be a competitive market where other AI programs
Totally can be.
Wait, you literally just suggested earlier that was the case.
Why do you need the government to come in and say you must tell your customers every single solitary thing that you restrict in some capacity? What you're going to end up with is unintended consequences, right? Just like when the government came in and said that we now have to list sesame seeds as an allergen. Well, the problem is that sesame seeds are really fucking small. And what companies used to do is they would say,
"What is wrong with you? What are you talking?"
The answer is because of caveat emptor. It's because of caveat emptor. We don't want caveat emptor at all times. Buyer beware. It's a bad idea because our buyers can't be infinitely knowledgeable about all the things that they're consuming and buying.
Make them reasonably like knowledgeable. So I think that if there are sesame seeds in your product, you should have to put on the back.
No, listen,
we have sesame seeds on here.
Exactly. You're using the logic that fucked so many people. Because that's what the government regulators thought. They said, if there's a potential for there to be sesame seeds in your product, you absolutely have to list it as an allergen. And then they're going to fine people if they don't say that there are definitely sesame seeds in their product.
People or companies?
Cool, but that might be like after your old nanny.
Example. I want to hear the example.
Wait, let him finish.
All right, yeah,
let me finish this. So what a bunch of companies started doing once it was added to the allergen list is they changed their ingredients list to have a very small amount of sesame seeds. And then they just put like a dash of sesame seeds in products that never had them before. And now people that are allergic to sesame seeds have way less fucking products that they can fucking eat because that was the way that they had to get around the government regulation. When you start saying, oh, we're going to implement this policy and it's going to work great, you have unintended consequences of the way that interacts with the market.
Okay.
You can't just claim that it's
going
to work.
Can I engage with that example? So like potentially, so I take your point of unintended consequences, but isn't there also potential unintended consequences if there's like no labeling at all and like people have actual, are definitely allergic to things like
peanuts,
there's the unintended, but like I agree with you, if enough people die and the body count adds up, people will eventually avoid those products and people will catch on of like, hey, these are contaminated peanuts.
They already said may contain sesame seeds. Like they already said, hey, this product might have sesame seeds in it. So people knew to be aware. So people that had severe allergic reactions could absolutely avoid those products. And people that had mild allergic reactions would just like would be fine with those products because they wouldn't have like a big issue. Once they changed it to where if it had any, even if it said may contain sesame seeds, right? Then what they would do is they just started adding sesame seeds to their fucking products. People that had mild allergens have less products that they can use now.
In the effort of conversation and in the effort of engaging with you, what do you think? Because I agree with you. Unintended consequences of legislation are a huge issue. That's why I brought up some of the issues, for instance, with the quote unquote TikTok ban, where they're trying to actually completely get rid of Section 2. And it's not actually a TikTok ban. What are some unintended consequences that you think?
I'll just give you an example, right? So let's say you have let's say you have an AI, right? And
hold on one second. Let me give you a parameter. Let me give you a parameter. Okay, so the parameter is we establish a regulation wherein all AI has to be transparent, as in we have to label things as AI, and AI companies have to list what they have as banned words, essentially. What is something you think is a terrible consequence of that you could see happening.
All right, so we'll start with
make it quick because I do want to get to like erudite.
Yeah. I'll try and be quick, right? So an unintended consequence that could occur, right? And this is the whole thing about unintended consequences. You don't know which ones actually will occur, right? But if I have to think about which ones might occur, what ends up happening is they put out a list of words that are banned and they miss a word, or they they do a blanket ban. So what they end up doing is the company recognizes that they're going to be sued by whatever regulatory agency they are, unless they're really, really good and they have lawyers draft them up, so that this increases the cost, the entry cost, which then limits competition within the market, right? So smaller companies know that they're going to face legal regulations and they're going to have laws and they're going to have like lawyers on retainer. So what they do instead is some companies figure out, well, okay, we still want to do this product. So then they create very vague things, right? And then what you end up with is these terms of service like fucking Twitch or YouTube, where shit is super fucking vague. Nobody can actually figure out what is or isn't banned, or what is or isn't allowed. And then at a certain point, what's going to happen is the state is going to regulate companies that they don't like very strictly, and companies that they do like, they're going to let them get away with murder, which is what they already do in the tech industry right fucking now. The TOS on Twitch is fucking meaningless. For example, I could scream the N-word over and over and over again right now, and it would not be against Twitch's TOS because I'm not directing it at anyone. But trust me, Prime Guys and I will both
go ahead.
Right, exactly, right? Like so what's gonna happen is you're gonna have large companies that are afforded special protections that are gonna busy up and go to Aspen situation with these companies, and it's going to allow for more control of our thought, more control of our speech, and it's going to allow the people that are in with the elites to be able to work together, and the people that
very brief. Let's go. Very brief, by the way.
Exactly.
I just laid out
very clear,
you can
direct,
stop.
one-way pathway to how limiting labels of just transparency is going to lead to the oligarchy. The oligarchs taking over society and destroying
They're already doing this.
Oh, okay. It's Erudite's turn.
It all starts with a sesame
seed. Is in full effect, Erudite, as you can hear. Erudite, go ahead.
Okay, examples of people utilizing loopholes in regulation isn't proof that all regulation is bad. It proves that poorly written regulation is bad. For example, there are instances where regulation is bad, as I've already brought up with the cases of price gouging laws. That's a system where it doesn't seem to matter where you write the regulation. It just seems to be pretty harmful by and large. The negatives outweigh the pros that you get from it. In the case of this loophole that they had with the sesame seeds, that is very cringe and they should be tried for it. But that doesn't mean that the regulation itself is bad and created that environment. What it means is that the regulation was poorly written. They probably should have accounted for immediately loopholers who would just try to write things like may contain sesame seeds. They should have just accounted for that.
You know what you're describing? It's called the economic calculation.
Yeah.
Right?
Okay.
It's what defeats.
Do you want me to finish or no?
Yeah. Go ahead, please.
Okay. You pointing out legitimate flaws, by the way, to institutions, particularly government-regulated institutions. I'm not even going to disagree with all of them. I disagree with the direction of your slippery slope because I think some of your slippery slope I think is valid and I think a lot of it is not, right? The issue is that even if you point to criticisms of the institution, it doesn't necessarily mean that just all government is bad and you should get rid of it, right? Because you run into the ANCAP problem, which is that if you have enough ANCAPs that hang out and there's plus 2,000 of them, they miraculously form a government system. Spontaneously. It's like how I'm not done. It's like how back in the day when you would throw underwear, and maggots together, and rats would spontaneously emerge out of it. It's the same shit, right? So it's
no, I was not asked.
Jesus Christ!
To explain why it's bad. What I was asked was, give me an example of how this could be bad, and then I laid one out. And you're saying, well, it's not a good example because reasons. Either back up the claim.
Reasonality, right? What we were asking for is reasonable concerns to have, not unreasonable. There are reasonable concerns to have about any regulation, and I want to hear it. And who better than an ANCAP to provide those criticisms? I'm open to it, genuinely, because I learn every time I talk to you. The issue is there's a big difference between reasonable concerns and extraordinary unreasonable concerns. I want the reasonable ones.
Literally everything I said, you can already see happening with Facebook. And
oh my God, you asked her a fucking question. You're not gonna let her answer. Shut the fuck up, dude.
The unreasonable thing was you jumping onto all of the extra Twitch and Twitter stuff connected specifically to this case, the one policy Johnny recommended, which was the transparency policy. It is true. It is unreasonable to assume that that single policy will lead to that outcome.
Okay, so you believe that it's unreasonable to expect the DHS, the FBI, the CIA, et cetera, to act in the way that they regulate information and social media the exact same way they're already doing it in other places of social media? How is that unreasonable?
It's unreasonable
unintended consequences is because we can look at some of these particular unintended consequences and do exactly what Erudite just said and write better legislation. Okay, I'm done.
It's unreasonable because you're not connecting it to specifically this policy. You're connecting it to a broad criticism you have of how the
policy hasn't been done yet.
And I realize that the policy. I don't know if you're just.
So any example I gave would have been unreasonable by your definition.
No,
would have been impossible for me
no.
to give a reasonable.
We're
scenario.
actually going into ANCAP autism land, where you're just like, oh, what's the word reasonable actually mean? Think
for
about
anyone
it.
listening, ANCAP autism land is what Not So Erudite says when I point out flaws in her logic.
I want to.
No, it's just what I said at the start of this, which is
that.
that your actual position is that any regulation is going to lead to the FBI taking over your life. That's what your actual position is. So there's no point wasting time on any of this other shit.
That's literally not my position.
That is your position.
So
maybe
maybe Lactoid can save us. If we have a transparent policy that says that AI corporations have to list what they do and do not provide and what is explicitly censored, what do you think are problems that could emerge based on the American system and the problems that we already know exist within it that you think we need to also be thinking for this specific policy, not the end all of like the apocalypse happening?
Yes, let Libertarian save us from the ANCAP. Go ahead.
So I mean, I could spend time. I guess I could spend more time and like really
Save
mull it
me
over.
from my perfect logic.
I can't think of any reasonable issue. I think the Twitch example, Scott, that you gave was like particularly bad because I think one of the biggest criticisms of Twitch is that they don't follow their TOS, not that they have one, right? I think if Twitch didn't have a TOS at all, that would be somehow even worse. And like if they had a TOS that like they had to be specific about and they had to follow, that probably would be better.
No. What I said was that they don't follow it, and that therefore it does it. No, that was what I was highlighting. That's the problem.
So
is that
make them
big, large corporations like Amazon that operate the cloud services for the CIA and get hundreds of millions of dollars from the CIA.
Okay. Sure.
That they have special treatment in terms of fraud and
how does removing the TOS help?
How does removing the TOS help in this situation?
Yeah,
So let's assume that they were committing fraud and they just had no TOS.
Yeah. Twitch has no TOS. How does that change their behavior for the better?
How does it change? So assuming that they have no TOS, then everyone knows when they're, let's say, getting into it that they're on a website that is essentially the wild, wild west. You probably have a lot less viewers, and you'd probably have I don't know. It'd be interesting to see what happened if they completely
just turn into Pornhub essentially.
Yeah.
At some
So,
point.
it would turn into Pornhub.
I want
to child porn.
I want to put forward my like personal experience from my life as to why why I think this is. I think the slippery slope is a little bit another way. So the FDA mandates that if you sell certain nutritional items, you have to put the box on the back of the product, right? That says how much sugar is in it. That says blah blah blah. This is in it. Oh hey, if you happen to die if you sniff a peanut, that peanut's in here too. So don't eat this, right? Pretty reasonable stuff. And there's an exception though. Alcohol is not regulated by the FDA. In fact, it's regulated by an entirely different agency that is solely dedicated to regulating alcohol. And the alcohol lobby successfully convinced the government to have them exempt from the nutrition box rule because they said, well, if people see the nutrition box, they might be under the false assumption that alcohol is nutritious, which clearly it isn't. So we're going to do we're going to do the right thing here.
And the Lord's work.
The Lord's work, and we're not going to put our nutrition facts in the back of our alcohol. And for some reason, that was successful. That's corporate cronyism, by the way. And
regulatory capture.
Yeah, regulatory capture, 100%. So I get gifted a bottle of Screwball, which is peanut butter flavored whiskey, and I don't know if I can have it because I have a sensitivity to sugar. So I email the company, no response. I emailed the company again a month later, no response. I tried for 6 months 6 months to get a hold of this fucking
You're
company.
such a lawyer.
6 months, repeated asks, like
Wants
polite.
that whiskey.
I was polite. I was like, could you please
Just roll
inform
a
me
die.
as to the sugar content of your
Polite.
whiskey? And they just didn't answer. So I had to give the whiskey away. I cannot imagine a scenario in which if they just put the fucking sugar content on the back of the bottle, how I'm worse off as a consumer, how I don't know what I'm putting in my own body.
Yeah, White Claw does it.
Because what if I drank it? Yeah, White Claw does do it. Good on them, right? But what if I drank it? What if I drank it and then I had some kind of reaction to it because I didn't know what was in it? It's like, I think that's like, and by the way, when I ask people, like, do you know how much sugar is actually in Jägermeister? Because you can find that information out. It blows your fucking mind. I find that people are vastly more uneducated and misinformed as to the nutrition facts of alcohol than they are any other nutritional product. Maybe the fact that alcohol manufacturers can hide what's in their product has something to do with the fact that the public doesn't know what's in the product.
Yeah, but have you ever thought about Lactoid, how the government's bad? Like, have you ever thought about that?
Generally, yes, but this is like the one thing. This is the one thing.
Literally, Nina already defeated it. There is a value in beverages, right, that are low in sugar content, and that they place that on their packaging. And as people choose to, let's say, as diets like carnivore or like keto or low carb diets become more popular, people are more interested in how much sugar content is available, and so the market demanded that information be available in some products. And you know what?
Like always, you always have such a privileged point of view, dude. Like, you're just assuming that everyone knows the things that you know. Like, it's insane. Like, that we shouldn't have regulation, and you just assume that everyone was gonna know the exact like things that they need. Like, it's just amazing to me that you're always like that.
She's saying companies should be accommodating of people who don't feel the need to like neurotically research every single product they purchase and know the ins and outs of how they're produced and everything.
Please tell me what person is like what percentage of people do you think are concerned about the sugar in their alcoholic beverage, but are at a position where they only care so long as the nutrition label is present?
Okay, but Lactoid is saying he can't find that information.
Exactly, which means Lactoid chooses not to invest his time in. Well, he did choose to.
He was emailing
He was forced to invest his time into it though because he was given the bottle.
I even left a negative review. I almost never do that. I left a
it's not like he went.
No, he actively didn't support the company with any money. He doesn't buy the product. And then he gave it negative press, which therefore creates market pressure that incentivizes them to put nutrition labels on their product.
Okay, I'm sorry. If you think most people are going to be fucking Lactoid, like some of these regulations exist. Everyone is saying
White Claw or
there's
vodka.
a reasonable expectation of buyer beware to put on people, and there is an unreasonable expectation in a world where it is so complex, where you can't actually understand what a large number of the chemicals are, when our processing systems are so outside of the knowledge of anyone. Yes, buyer beware is a silly process. It worked really well when me and my neighbors grew tomatoes and like cucumbers, and he had some cows, and we traded back and forth because I knew what cow meat was, and he knows what fucking cucumbers are. It doesn't work as well now in like the state of how complicated and processed.
What does that have to do with government regulation? I don't understand.
Buyer beware. It's all about buyer beware.
What does that have to do with government regulation? The government doesn't
think about it. I don't know,
dude. Are you serious?
I know you know the answer.
The market is just as easily can solve.
Oh my
those
god,
problems.
you want to go like those like
Actually,
old
better.
school like people getting killed? You ever heard of a class action land, bro? Like this is what you want. You want like, oh, don't go to this theme park because you're gonna die on this theme park ride, dude. Like, you're insane. There's a reason why we have regulations. Like, I can't believe you think this way.
There is no regulation
Your first time meeting
that the state can do.
The
market cannot do better.
Amazing every time.
Okay. One question to Scott real quick.
It already didn't work.
Right.
Don't you agree?
Final
with me?
question on that, please.
Don't you agree with me at the very least that like the more informed you are about a decision, the more likely it is that decision is more consensual?
Right. Well, I mean, I don't know about that, but I understand where you're taking it, right? Like with more information, you're more likely to have informed consent.
Yeah, all else being equal, yes. The more information,
right? Which
the
is
better.
why you should be an anarchist and be against the government because you'll have more information if the government
How would you
isn't
have
regulating.
more information?
Okay.
If
All right, hold
you
on.
have no
Not
government
possible
regulation,
for the
then they
state
have no
to have a more
responsibility.
effective regulation than the market.
Let's
How
okay,
possible?
everyone. Okay. Look. The siren song of the ant cap
Hey,
is in
I haven't
full
asked a single
effect, right?
question.
And look. Okay, you have 3 facts you need to understand. Yes, Scott's an ant cap. Yes, he's serious. And no, you cannot change his mind. Okay, like
this is why
let's make that the guiding principle of this fucking stream. Okay,
hey, this is why Prime. I think this is why Scott. I love Scott, right? But I think for that, I think we should maybe focus on other people for the last 15 minutes of this. Right?
Actually, on the topic of informed consent, I think for future Prime panels, there should be a disclaimer label that there's yes, Scott's and ANCAP informed consent. All of those 3 caveats.
Maybe that.
Regulate the Prime stream. Do it.
I really enjoy Scott's unique perspective on these things.
Yeah,
it's not,
okay. So
it's
the
not
rest of you,
abrasive to me in the slightest.
So the rest of you, great, because I think the original topic was actually not really about the information regulation in AI, but about the imagery, right? I use child porn because that's the first thing I think of. There are lots of Muslims in the world, lots of Catholics.
You use child porn? Gross.
Oh God, there are lots of Muslims in the world, lots of Catholics. So if we allowed AI to generate child porn, there's going to be lots of child porn being generated, right, all over the fucking internet.
Yeah, it's also a lot of teachers. Yeah, true.
Yeah, true. So I think so I'd want to make that illegal. It seems like some of you guys disagree with that. I know why Scott disagrees with it.
Something that you have to remember about anything that is AI art or AI photography, as much as you can call it photography, is that it has to be trained on something. And so in this world, and I don't personally know if this is possible on any given, even a totally free, unbiased AI, in this world where you are able to generate CP on an AI photography bot, you are also saying that they can train on images of CP. Has no one thought of that?
No, that's not actually necessarily true at all.
You could just combine
Is that
Lolly
not
and
necessarily
combine
true?
regular
Please.
porn.
No,
I'm really interested in erudite, actually.
So my understanding is that it has it needs to be trained on something, but you can train it on normal pictures of children not being inappropriate at all, like in bathing suits, just being kids and whatnot. And it can it would composite together what it understands of human genitalia, probably from adult pornographic images, and it would probably be able to put them together. I don't think that to have CP on AI, it necessarily requires that the kids be victimized for the training data.
That is
that's my understanding. I'm super limited knowledge in AI, so somebody can correct me if I'm
I
wrong.
think there are probably ways they could circumvent needing to involve actual children, through CGI or whatever the fuck. Yeah, I'm sure.
Lolicon.
Okay.
Yeah, and I've heard the argument that it's not that clear cut that allowing these things to generate AI child porn would be harmful to children. But so I'm wondering, is there any evidence of that at all? Because everything that I've been able to find is the opposite, right? It's all about objectification, normalization, etc.
Yeah.
Right?
I
It's all over the place,
extensively.
dude.
Go ahead, Johnny.
I'm sorry. I had a couple of debates a couple of years back on the doll issue. And so I did at that point look up statistic as to whether or not something like a child we'll call it substitute is actually something that helps people who are pedophiles not to actually aggress on real children. And the answers are so incredibly all over the place that I don't think any real statistic can be said to be true on it.
Well, we can't really do studies on extremely taboo sexual behaviors,
Stanford
right?
Prison Experiment 2.0.
So, so I actually extensively researched this as well, not just for CP, but for other reasons. There's people that are into necrophilia or sexual abuse, like you're brought up in your premise, Prime. I think that we'd have to use external factors to make a determination as to whether we buy into the idea of people being able to be sated by consumption of porn versus their actual fetish. What I can say is that we know that overconsumption of porn can lead to people having sort of a decreased sexual drive within their relationships and their marriages. if you're buying into and sort of cultivating your own like taboo fetish, could we not say that you're sort of mitigating your real life sexual impulses? Like by
No, I
association?
think doesn't the research show the opposite, that people end up getting
Yeah.
more extreme, their tastes become more extreme as they
But we're talking about whether you actually want to act on it, not your interest.
Well, the other
No,
problem
well,
is if AI is super available to everybody, right? And we have very limited, and not Saradad, I think will back me up on this. Like we have very limited information on sexual imprinting, right? And so like ease of availability of child pornography towards people that are young that may develop fetishes or paraphilic disorders at a younger age. Like we don't know what type of effect that could have. It could have the exact opposite effect for all we know. Again, we can't run that study, but if like if CP that's AI generated is like easily accessible to like kids regularly, like it could drastically change the numbers in one direction or the other. We just don't fucking know.
Regulate porn.
Well,
right. So given that we don't really know, like, it doesn't make more sense to be cautious and to just ban this entirely.
Banning this entirely isn't being cautious, because if you ban it entirely, it also means no research can be done on it. It's the problem we actually have right now with DMT in the United States. The only places that can really study the effects of DMT in therapy is typically countries like in the EU, where DMT is way less strictly regulated. And so it's like, if you just make it illegal, what it actually means is that we'll never actually get the answer. And people are going to proceed forward, probably in like black market kind of ways at first. And now we have this market burgeoning with even less knowledge and researchers less capable of accessing these things, which is like the worst possible outcome.
Okay, so you're right about that, but when I said this is an issue with my phrasing. When I said ban it entirely, I meant like public use.
So like dissemination.
Yeah, the public isn't able to produce this AI child porn, but if researchers want to do this in some kind of lab setting where they're doing studies on its effects, that they could get some kind of pass to do that.
I think the thing that gives me pause is if we really don't know the answer as to whether predators can be sated by consumption of porn, then you removing one of their access points, which has no victim. I mean, like AI generated CP doesn't involve an actual child. You're just preserving all of the demand for real child porn. So if we really don't know the answer, it seems like you're doing more harm by eliminating it entirely.
But
that's
also
where my brain goes.
But also, like, what if it was super photo? My friend Doobie has made this argument a few times with me. But like, what if it was super photorealistic and it was like the current crop of Disney stars, right? Like,
or VR.
Or I mean, yeah, I mean, whatever. But just like, the point is that it's super realistic, and it's like of the current crop of Disney stars, and no one has been hurt. No one's hurt in creating it. But there it is. And yeah.
So I think we have to make sure when we're regulating things, I really hate regulating because something feels icky. I really want to regulate because it like leads to the best possible outcomes for the maximum number of people. So in the case of like child porn, all I want to do, no matter what, is reduce the number of children victimized by sexual abuse. That is my sole goal. That's the main thing. I don't care about pedophiles having access to anything because I just want pedophiles to have a happy life. I don't give a fuck. All I want is kids not to be victimized. And what I want to make sure that we do in like policy and regulation, there's like this knee-jerk reaction when people hear the word CP to be like really bad and icky, because it is really bad and icky. The issue is, if you can remove all forms of victimization, can you now offset it and do some benefit without any harm? And that's a really important question, as Kilo's saying, of like, what if the availability of this, like say it's not freely available, but it can be essentially like prescribed to some degree, right? So like you need access to it. You can't just, anyone can do it. Would that be better for society and allow researchers to do it? The issue with all of this stuff is we don't know, because as Scott brought up, we know pretty much nothing about what's probably a critical window for sexual drive, and like specifically the kinks and fetishes. We don't really know where that window is. It's imprinting. And it's probably different between like the sexes, at least. There's some evidence for that. So it's like, we really don't know. And I would agree, like the idea of kids having access to this is like, not kids, but like, well, yeah, 12-year-old boys, right? is really concerning to me because I don't know what's solidified by that point. Orientation is for sure solidified. I don't know if kinks are.
I'm curious. Do you guys think 12-year-old boys or any gender should have access to porn, like any kind of porn? Like, is that something you guys are okay with?
Do I think they should have access to porn? I think it's on the parents to determine whether or not they.
Well, I'm asking. So, if it was your child, would you allow your child access to porn?
No.
Okay.
I
Would
don't
you say that
think many
websites
parents
should
do, though.
require?
To be fair, I don't think most parents allow their kids to
I love
access
how people are
porn.
like, "Well, you gotta live and let live." Your kids? Oh no, absolutely not.
Just
I think no kids. No kids.
Yeah,
A
but
reasonable
how do you
age.
enforce that? How do you enforce that?
Well, I have a very complicated scheme, and it does involve a little bit of government intervention. So
it would, right? Which I'm
I
open
just
to.
talked to a woman, not on stream, but I talked to
Brag
a woman.
about it.
Congrats.
I know, right? It's fucking rare.
Breaking
Right?
news.
Like, it happens once every 8 months, so I'm pretty psyched too. I just talked to a woman. And I asked her this specific question because she's a sex worker, and I was like, "Hey, like, would you allow your kid to watch porn?" The reason why this came up because I brought up my own past, right, and how I was a kid and I got exposed to like cable fucking porn, right? And she was like, "Yeah, it's fine. Like it's a thing that kids are going to do." And so, like, it would be better for her to allow it, and then if her kids have any questions, right, like understanding that porn can be harmful and unrealistic, then she would be there to talk to them.
This is like the principle of like letting your
sounds like a
kids
shitty
drink under
mom.
your own roof type of thing. Of like, well,
Yeah,
better they
sounds
drink
like-
in my basement.
Sounds like the kind of mom that would do sex work, actually.
Yeah.
I think in the same way that you don't let kids into a strip club, you should not let kids into what is essentially a virtual strip club.
Well, and the mediums for them digesting pornography usually like. So if you have an iPad, you can child lock it to where they can't just access any website or they can't open up Safari on their own. They have to like type in a little password or whatever. If you're not implementing those tools, yeah.
Would you require, or would you say that parents who allow their children, like Pram's friend, parents who allow their children to access porn in any context, should they have some kind of legal action taken against them?
No, I think that's
Why not?
on you. How early you want to expose your child to pornography?
Isn't that like a form of abuse?
Why would that be a form of abuse?
I mean, I feel
You're
like
sitting
sexualizing.
watching. What if you watch
exposing a
porn
child
with
to
your
like?
kid? Is that weird? Kind of
Yikes.
abuse, yeah.
Well, you're asking me to say that the blanket statement of exposing someone who's under the age of 18 to pornography is abusive. I mean, in certain contexts, yeah, it can be. I don't think it always is.
In what context is it okay for like a parent to allow their child to watch porn? Like a 12-year-old, like I said earlier.
Well, 12-year-old, I wouldn't do it personally.
No, I'm not asking if you do it
Good for
personally.
you.
I'm saying if a parent did want it to, if Pram's friend wanted to just allow their kid to sit on the couch and watch whatever porn is on TV.
I don't know. If they started reaching
hardcore-
the age, how old were you when you started like legitimately being interested in girls? 11 or
Me?
12? Yeah.
Me, fuck.
I
Probably
wish
younger than
never.
that.
Well,
I think
Okay,
that the
so my
conversation
first
there
experience-
is what you define as it. Like, is watching Game of Thrones watching porn?
Yeah, the sex scenes, yeah, for sure.
Well, I think if you sit your kid down and you're like, hey, this is something you're going to start to think about a lot, and I kind of just want you to know what's going on. We have a really weird, like, shameful approach to having the conversation with children, and I think in a lot of cases, parents put it off for too long.
Yeah, but
I
now
don't
you're
know.
just putting it on actresses and actors on the screen.
Yeah,
We're
porn
doing
is
it
not
when
a
it's
good
probably not
substitute.
realistic.
I'm not
but
saying
I
a
want-
substitute. I'm saying, hey, if you're going to digest this, I'm not going to stop you. I just want you to be aware of what is going on here, what the purpose of it is. All
Well,
that
yeah,
kind
but
of
you
stuff.
can do that without having them watch porn. Like,
I'm not saying I'm going to put an iPhone in front of their face and say, hey, pull up Pornhub. Let's go over this
okay,
shit.
but
I'm
yeah,
saying,
it does do that.
Let me
It's-
see them
it's
cream
that.
pies,
Like,
dude.
would you make it
yeah,
illegal?
here's what you type into the search bar. That's not what I'm saying. I'm saying, hey, this stuff is out there. I can't keep tabs on you 24/7. I want you to be aware of what's going on here from more educational standpoint.
So I Kilo, you went where exactly where I was thinking of with this conversation. Like, and look, we're almost out of time here. Maybe we should make this a separate topic. That might be the thing. But like it seems to me, and maybe you guys disagree, that there's a difference between saying that like you are if you look at this, you aren't banned from doing it, rather than, hey, let's like sit down and like just like watch a few movies together, right? Like
that would be super weird. That would be. I'm
Yeah.
sorry. Parents are like sitting down and being like, "This
Fuck
is
you
my
up.
favorite porno, Johnny. I hope you enjoy it too. I love BBC." You know, weird. That's weird. Weird shit. Just like parents who are like doing drugs and alcohol in the basement with their kids, being like, "I'm the cool mom." But like,
Can I just
I don't know.
say-
I think porn is this inevitable thing that like parents are going to have to talk to their kids about and realize that like they just are going to access it.
Using little Johnny
As
as like a thing for a child has fucked me up.
can stop
That's
that.
Sorry.
I'm sorry that you're in that position.
I don't think we can
Daddy.
stop 16-year-olds from
As
actually
a
porn.
parent,
That's what I'm saying, Kyla.
Scott,
They'll just
Scott, when
they'll
you're-
just take their friends' phones. Like
That's what
if
I'm
you
saying.
think-
Yes.
If you can stop, if you think I'm super open to hearing it.
It's
But
got an army for a reason.
Somebody
Yeah,
who's
Scott,
worked with teens for like 10 years.
Scott,
I
we'll go
Balls
to you
the
next.
DMV.
Scott,
Right,
I'm going to go
so
to you next.
am I
I
the
just
only
want to
parent
say
here?
just quickly, but like, yeah, I think there is a difference here, right? And I think that difference is important. It seems to me that you like one is saying that yeah, the world is a dangerous place, and we allow children to experience the world at their own pace, right? And come and ask questions. I think if you're a good parent, then you let them come back and ask you questions. So you could say, like, hey, you're going to be even having sex, right? Like, just put like the sex talk, right, is part of it. That doesn't say like, hey, I'm going to like get a woman for you, or I'm going to get a man for you, right? And then you're going to fuck them, and then we'll figure out afterwards. It's like, well, you are going to have these experiences out there in the world. There's going to be adult experiences. This is going to happen to you, and when those happen, I'm open for you to come back to me and be perfectly honest, and so we can like contextualize these things. But yeah, Scott, you are a parent. I would like to hear what you have to say.
Yeah. So when you're a parent, right, you have to recognize that your child is an emergent adult. Your child is someone that has human rights, that is an individual in their own right. But at the same time, we do not give them full consent, and we do not allow them to exercise their rights fully because they're not old enough to be able to engage in as a moral agent. And so if the thing is when talking about pornography with children, I think there's kind of two things we're discussing. The first one is, are you intentionally exposing them to something that would be against their will as an adult, because they're an emergent adult, right? In their current situation, they're incapable of really understanding what's occurring, right? But as an adult, are you doing something to them that traumatize them? And I think we've had that discussion right now on two ends of the spectrum, right? One is like, sit down and watch a bunch of hardcore porn with them. And then one is like, hey, this stuff exists. Let's talk about it so that you're not traumatized, or you don't have weird feelings, or you don't get like crazy ideas about women and sex and things like that, because like your friend on the school bus showed you like some fucking like hardcore sexual harassment Japanese porn, and like you think it's a good idea to like lift your hand up women's skirts or something, right? So there's those two ends of that. And so when someone is an outside observer, they have a right to obtain guardianship of your child if you are doing things to that child that is permanently damaging in some capacity. I think the second question is one about moral preference, right? Because I think we all have our own values. We all have our own kind of ways that we want to shape and socialize the child. And that can go from the most puritanical of belief systems, right, to the, to the sex worker friend, right? And where we can lay judgment on that is likely an individual parent's choice, right? Like, it's not really like I can make moral like kind of like prescriptions or moral ideas about why I think the OnlyFans girl that's showing porn to her kids is a piece of shit. But like, it's my impetus to prove that there's some form of psychological harm, or that there's something done that they as an adult would not be able to do. And in many of those cases, I likely wouldn't. And at the same time, I know that like, if I find out that bitch is a teacher at my kid's school, I should be fucking out, right? Like, I should be able to disassociate with somebody that likes showing porn to kids, because that's a fucking weirdo to me.
Yeah, this might be a longer conversation, a longer topic.
That's a whole other bag of worms, dude. It's crazy.
No. Well, I'm glad we took up a lot of time on ANCAP Story Hour this time. So that was more important. But no, yeah, I think that's a super interesting topic, and we can go lots of places with it. So I'll write it down. Oh man, I got to be careful, like what I write down on my computer, because I feel like if I ever.
God, I'm very offended you said that about Japanese people.
I said that about Japanese pornography.
Yeah,
That's
Japanese
a whole
culture is
other
pretty
dialogue.
fucked. Like,
That's
generally.
weird.
Dude, when I was in 8th grade, there was this kid who, like at some point, like at a recess or something, he told us that he had like jacked off, and all of the boys made fun of him. We like gave him a nickname that was like that. I can't remember what it was. It was something related to jacking off, and we like used it as like a dog whistle for like making fun of him. And I think all of us had probably done it at that point. I know I did. I didn't really participate in the bullying that much, but I didn't really say anything. I was kind of like, oh yeah, I don't want people to make fun of me, so I just shut up. And I think that just points to the fact that we have this weird, shameful culture about the things that you start to experience and feel when you're 12, 13, 14. And there are probably healthier ways to kind of wean, your kids into the realm of, especially when they have access. Everyone has a phone. Everyone has, Google. They know how to get to these things. So that's all I was saying.
I think it's fine. Stop. I think it's fine because I feel like there's some things that just should be shamed, right? So if you're gonna jack off, do it. But you don't need to go around telling everybody about it. It's fucking weird. And it's okay to say that's fucking weird. And he's weird.
He didn't run up to us and be like, "Yo, I jerked off. Are you guys excited for me?" It was like we're just talking about whatever, and he was like, "Yeah, I've done it."
After you wash your hands. Erudite, are you talking to your audience or are you talking to us? Just want to be clear.
I was muted, but I was meant to talk to you guys. Sorry. I was going to say, there's a really big difference between shaming people for like TMI in social conversations and shaming people for like normal healthy behaviors, right? Like, I think that's a distinction we have to make. I think it's weird for me to like be like, hey, bro, I don't need to hear about the fact that like you have some leftover cum on your hands. Not interested. Don't care. Glad you masturbated, right? That's a TMI thing. But it's not like I'm upset that he's masturbated, right? There has to be a nuance of just like, ew, yuck, don't want to hear about it. It's a bad thing.
We were making fun of the fact that he had masturbated.
Okay.
No.
I hope you shamed him
That's
into
the
being
distinction I'm
asexual.
making between Kilo, I'm agreeing with you, Kilo, and what
Understood.
Doobie's saying, which is like, we should shame people. It's like, well, we should shame people for some things, not...
Yeah. I didn't think if he was like being a weirdo about it, he's like, man, I was so fucking horny last night. Like, yeah, it'd be really weird.
You got to shame the companies that poisoned his brain with fucking pornography. That's what.
Yeah, you're right. That's what we have to turn our attention.
Now blame the women directly,
or the parents that allow them to go to the company.
Blame the parents too.
Can I tell you how terrible I feel as a grown man who had also jerked off at that point? I find it terrible that we literally bullied him into thinking that it was like shameful or it was too early.
No.
I'm saying now in retrospect is what I'm saying.
Yeah.
Do you want us to shame you, like to like recompense or something?
Yeah, let's make reparations for this. I'm not going to say the kid's name, but this is for you, buddy.
All right,
so you actually like that, huh?
Let's. I think we should have this topic. I think it's a super interesting one, actually. So let me save that for another time. But we'll go on to our next topic. And just quickly, guys, if you are enjoying the content, right, like this was gold, I think, right? Like I think we had a lot of fun here. Then hit that follow button.
And gold, specifically.
Black and gold, oh boy. Oh boy.
That's so mid 2000s, Scott.
Oh God. So hit that follow button if you haven't done so yet, and consider supporting the channel by subbing to the channel, gifting bits or gifting subs. Amazon Prime Gaming on the channel. Help us out so we can still have these moments. These moments don't happen about people like you out there who appreciate this and support it. So consider helping us out, helping out the channel. Considering a hype train going, that'd be great, right? But consider subbing to the channel, gifting bits or gifting subs. Resubbing too. Resubbing also as a big help. But we will move on to our next topic. Next topic. Okay. Topic 2. Leg lengthening surgeries are rising in popularity, specifically among men. The painful multi-month procedure is expensive and often not covered by insurance in the United States. The men who seek it often report feelings of shame around their height. The ideal man tends to be a tall man. As such, Should this be considered gender affirming care? No matter your answer, should this be treated in the same way other types of gender affirming care? Should people simply feel more comfortable in their bodies, or should we encourage this type of intensive procedure? So yeah, I ran into this article today and got my imagination going. So yeah, this is a thing. It's rising and popular, and it's extremely painful. In case you know how this shit works, it's really painful. It requires like months of like physical therapy, like to go, like you have to lengthen your leg with rods, and they break your leg and then like lengthen it slowly. Very, very painful. But it makes some guys feel great. Like the guy in the article talked about how he was like so shamed about it. Like people made like short jokes. He was 5'7", which I don't think is like super short, but you know, whatever. He was, and people like made his life miserable according to him. So yeah, is this gender affirming care? Should there be a difference in regulations? Assuming we're in a world where regulations exist. We can't do anything about that, okay? All right. So let's go to our friend Lactoid.
Yeah, I got a really short one for this one. So,
oh no, here we go already.
Yeah, as a 6'2" king, I fully admit that being tall does lead to people treating you differently, for the better. People almost universally like when men are taller, and I get compliments on my height all the time. I don't blame any man who wants to be taller to feel more masculine, just like I don't blame any woman who may want to get liposuction to feel more feminine, or really with any kind of physical attribute, musculature, facial features. In fact, really all traits can kind of be ultimately kind of taken back to what is the image that you're trying to portray to society, not only what you want to portray, but also what you think society wants you to portray. Therefore, leg lengthening surgery, I would agree, is absolutely gender affirming care. And gender affirming care, in the exact same vein as I've been saying, is indistinguishable from cosmetic surgery. And my only restrictions here are cosmetic surgery should not be on the public dollar and should be restricted to those over age of 18. Those are the only restrictions.
Okay. Kilo, I think we can hear you like clicking. I think you might have like a super sensitive, so if you could maybe mute yourself. Okay. All right, so let's go to our friend Scott.
Yeah, I have basically the same sentiments as Lou. I think we should treat it exactly the same way that we treat trans people, right? Which is, something that is, now I'm a little bit different. I don't think that any surgery, cosmetic or not, should be banned on minors. Instead, what I think is that anything that permanently changes the physical body of a minor upon reaching the age of majority, whatever that may be, if they decide that it has harmed them in some way, they should automatically be able to be demanded restitution. And it is on the burden of responsibility of the person that did that gender affirming care surgery or whatever to prove that the other person is lying for money. This would essentially drastically reduce, any form of surgery. Children, and would ensure that a company that hands them out like candy would have medical malpractice insurance that's in the billions of dollars. And instead, what they would do is they would be incredibly careful. For example, with like trans people, like if you want, a double mastectomy, they're like, cool, you should wait till you're 18. And if it's really bad enough, they'll be like, all right, well, I want photos from Facebook from your parents proving that you have not desisted since the age of 3. And I want like every fucking year. And I want like, otherwise we're going to wait until you're an adult, right? I would do the same thing with height, with lengthening surgery. Now, lengthening surgery is a little bit different in the sense that you probably need to actually like fully develop before it's even possible. So it's kind of irrelevant in that comparison. But yeah, cosmetic surgery for adults based upon whatever it is that they want to do with their bodies. Yeah, do whatever the fuck you want to do. You run the risk of whatever that is, so long as no one's committing fraud and you have informed consent. I see no issue with it. And just like trans people, right? Like it's not my duty to recognize your identity as a tall person. Just because you're 5'10" now and you used to be 5'7", everyone under 6 feet is fucking short to me. And I don't give a fuck what you want me to call you. And also, if you're obsessed with 3 inches, in any regard, in any place in your body, you probably need more time with the psychotherapist and not spending $100,000 on a fucking surgery, but do whatever the fuck you want, man. That's how I feel.
Thank you, Scott, as always. Corey, please.
Yeah. So I come at this, I guess, from a little bit of different perspective, a Canadian perspective, much like Lactoid. So, we have a publicly funded healthcare system, so slightly different, where to answer sort of the prompt of the question, should this be considered gender-affirming care? I would say if it's in Canada, if it's like actually doctor prescribed, I have no problem it being covered by public funds. But if it's in the vein of cosmetic surgery, then I think there should be some sort of gatekeeping, or rather that should not be publicly funded. But I'm going to introduce something that I think this topic speaks to, that Scott brought up, I think towards the tail end of his opening statement, where I think this speaks to kind of insecurity among men, that I think there's kind of like a crisis of insecurity among men, where sort of in this vein, where it seems like there's an increase in the leg lengthening surgery that is occurring, and based off some of the data that I've seen, steroid and PED usage among men also appears to be increasing, where there appears to be this crisis of insecurity among men, but no man, except for maybe in this article, will admit to being insecure. But they'll go through all the, great mental gymnastics and actual physical gymnastics to address their insecurities, but they'll never actually admit to being insecure. Where all the PED justification is it's just to maximize their genetic potential, and it's for their health, etc., etc. But just admit that you're insecure. I'll leave it there for now.
Thank you. Let's go to Kilo.
Does my audio sound okay? Great. I agree with a lot of what Corey said. I won't rehash it too much. I think that this is kind of an indicator of sort of an insecurity epidemic amongst young men. I see this a lot in the red pill community. They think that your height is a paramount, preeminent factor in your suitability. I'm gonna push back as a 6'5" person, so know that my opinion on this is tainted by my privilege. That I'm gonna push back that on the idea that being taller is ideal. I think that there are a lot of downsides, and I think that there are the upside of being tall is completely overblown. And for that reason, I do not consider this to be. I don't consider gender-affirming surgery or anything like that to be prudent. I don't consider it to be reasonable. I consider it to be a stretch of some of the other social issues that have been hotly contested for the last few years. So I'm going to say no. I'm going to push back hard on this, and I think that we should refocus our efforts on people being comfortable with themselves and not enforcing archetypes of what the ideal mate is. I think that that's harmful.
So, because Kilo is 6'5" and he is forced to shop at Big and Tall, he believes it's a bad thing. Oh, okay.
No, fuck you. As someone else who is 6'5", Big and Tall is just clothes for fat people, right?
Nothing at Big and Tall fits me at all.
Nothing at Big and Tall fits. Okay, my size is a double XL tall or a double XL extra tall, and they do not have that clothing in Big and Tall. It's just 70-inch waists.
And tall.
All very true. Yes.
As someone who's also 6'5", I think that you are just kind of too skinny.
Okay. Let's go. Okay. Let's go to our friend Johnny.
Okay, so I'm gonna come at this from the same perspective as Kilo, but I'm probably gonna go into a different conclusion. So I am a 6 foot tall female, and because of this, I've been 6 feet tall since I was 17. I have been afforded fantastic work in the modeling industry for 10 years of my life. And that is a privilege that I absolutely uphold as a privilege. It is not something that I think is necessarily healthy as a standard for the majority of Americans. However, I will say that I have benefited from it, right? And so in that life experience, I can say that we probably ought not be focusing our attention and our efforts into making people taller. we should probably be focusing our efforts into building a society and even building a fucking modeling industry, which people are already currently doing, wherein people don't have to meet almost impossible things like height requirements. That being said, I also don't know that I would consider this gender affirming care. I could definitely see females getting into this so that they can get over that 5'8" mark, so that they can get into the modeling industry. Like, that's definitely something I could see happening if this were to be a safe and effective surgery, which it doesn't sound like it is, by the way. All of the videos that I've seen of people who have gone through the surgery, they express that they can't walk correctly. They're still using crutches years on, like shit like that. Right? So I believe in building a world where you can do whatever you want to do in your job, regardless of your height. But I also don't see this as like gender specific for that reason. And I don't know if we're gonna turn this into like, am I gonna be the only trans person on the panel? Is that like, is this gonna be a thing? Because I don't know if we're like going the trans route with this. But I do have like opinions on that as well, wherein I don't know that cosmetic surgery, even if it is gender affirming for trans people, should be covered by the government. Like I waffle back and forth on that. I hope to see other people's opinions on that here.
Our friend Johnny is the MLK of short individuals. I hear you. All right. We're going to inform the NBA. New regulations are coming through. Let's go to Not to Erudite.
Yeah, I think I have a pretty simple answer, which is not all cosmetics procedures that make you feel better within your gender are actually gender affirming care, right? I'm pretty sure all of you would agree that a cis woman getting a boob job isn't gender affirming care, even though she might feel more attractive as a woman.
I don't agree on that one.
No, I agree.
No, we would all agree. It's been said.
Yeah, I think we might have different opinions on that one. Go ahead. But you want to say something else, Erudite?
Nope, that's the end.
Okay, let's go to Nina.
Okay, there's a lot to this. Yeah, I think I would agree generally that I would look at this as gender affirming care the same way that like maybe hair transplants could be considered gender affirming care. Where there is like definitely some gray area with that, but I don't think it's the same as obviously like testosterone or estrogen or whatever. That is maybe a different tier of gender affirming care, I guess we could say. I think that especially when we're talking about like men, whether they be trans or not or whatever, wanting to be taller, it's kind of like an beautiful irony, right? Where they are making themselves weaker by making themselves like generally because it is so damaging and it is so like invasive, the surgery, that it has this weird irony of making you kind of like weaker while having the masculine aspect of being stronger because you're taller. I think there's kind of an interesting irony in that. And I guess generally, I think that if it really comes down to the conversation of like, should it be like obviously something subsidized or like your church should pay for it or whatever, I think that would be very silly because I don't think it's very healthy from what I've seen from it. It seems like it's really damaging. You can't like walk for like a year and you're getting what like 2 inches, like 2-3 inches, and I think it's like kind of a result of just like really shitty like gender stereotypes that I think are just unhealthy that we shouldn't have to begin with.
Finally, our friend Doobie.
I was actually firmly on the no side of this until yesterday. Because I thought about this before. And yesterday I saw a video of TJ Kirk, the amazing atheist, pouring hot oil on his penis and on his testicles. And this is relevant. And his penis was fucking minuscule. I can't express enough how small. I've never seen a penis that small ever. Fucking ever. It was so tiny. And this made me think, like when you sent me the panel questions, like if that guy wanted to have like gender affirming care to like lengthen his penis somehow, would I be opposed to that? Probably not. I think he needs it. Right. I think it'd be reasonable for me to say, hey, yeah, if I had a penis that small, I probably wouldn't feel like a man. Right. And on the other hand, like if I were 5'5" or something, right, I probably would feel like less of a man than someone who's 6'4", like I am right now. If I were 6'5", a freak, right, I'd probably want to have an inch taken off, so I'm like the perfect normal height. But so I think if we're going to I think if we're going to allow gender affirming care in any regard, I think it makes sense to extend it to cis people, right? So I think I am in favor of it. And this isn't like some dig at like trans people, right? I genuinely think that this makes sense. Actually, if people are uncomfortable with their bodies, if health insurance companies are okay with covering this in the first place, then it should be extended to cis people too. And if this is the way they do it, that's fine.
Okay.
Oh yeah. Yeah, I like that, extending gender affirming care to cis people. I think that that's a fantastic idea. Also, but
if we do that,
also
the trans movement advocacy is fucked. If you do that, you will fuck over the, which to be honest, a lot of conservatives are on board with, but be careful because it will fuck trans advocacy, because gender affirming care is a very functional word right now. It's a political word and it's an advocacy word.
Right.
Hold
that's kind
on.
of where I was going.
I'm so confused.
Let Johnny respond to that. But don't worry, Scott, we'll get to you.
No, I'm asking Erudite, like I am so genuinely confused, and I come from this of a perspective of I will be on testosterone someday, and it's like I find that fascinating. Yeah, go ahead.
Sorry, there's a question there.
No, the question is, how will gender affirming care offered to cis non-trans people, how will that harm trans people?
Okay. So the way that Doobie and a lot of conservatives are meaning it when you're talking about offering gender affirming care to cis people is what I outlined, which is cis women wanting boob jobs so that they feel more confident in their gender, or men wanting limb lengthening so they feel like they are a better man. That's what they're including in gender affirming care. That is wholly opposite of what the trans movement is and aiming to achieve.
I don't know that it's the whole opposite. I would love to hear your perspective on that as well. However, what I come from when I say that is that not all gender affirming care should be covered by the government. And so I wonder if that affects your opinion.
I don't actually care. So I'm Canadian, so I'm going to have a much different opinion about the coverage of it in general. So I'm less interested in the fiscal stuff right now. What I'm trying to get at is the importance of like why we're defining things. If all cosmetic surgeries can be gender affirming care, then gender affirming care is a stupid word that we don't need, because it means that just anything that makes you feel better, that is somewhat feels gendered to you, is gender affirming care, which means what are trans people specifically asking for?
Trans people specifically ask for things like hormones to be, and again, this is different from you, but we generally ask for things like hormones to be available to people. But across the trans diaspora, we are not a monolith. There are many different people who say that this shouldn't even be covered by the government at all, that the very basic hormone care shouldn't be covered by the government because they see it to be mostly, how do you say it, cosmetic.
Let's go to
sure.
Scott,
do you think that it's mostly cosmetic, Johnny? Can I ask you?
So that depends on the trans person. Again, we are not a monolith. For me,
that's why I said, do you, Johnny, think that it's cosmetic?
That's what I'm saying. Is for me, yeah, for me, the aspect of getting on testosterone is not something that is entirely cosmetic. It's also something that is going to be affirming me in a much more internal way. And I again don't know that means that this should be something that's trans people completely separate from cis people as far as like what we call our individual healthcare needs.
So why do we call it gender affirming care specifically? Why is the word care in there? Because my understanding is that we're medicalizing it. We're making it sound like a need, a medical requirement. In fact, you'll hear a lot of trans people talk about gender affirming care, and they'll associate it to gender dysphoria and the high levels of distress and suicidality that is associated with that, particularly amongst adopts. It's not this optional cosmetic surgery. The care part is essential. It doesn't mean that all surgeries are required for all trans people. Some trans people will choose only to go on like cross-sex hormones. But my understanding is the reason why it's called care is because it's being offered as a treatment to something that is highly distressing to the individual. It's a medical need.
I see. Yeah. And again, like that is something that trans people actively talk about and fight about is the idea that this is something that will complete a transition that will be the arbiter of whether or not you are seen as male or female. And so my answer to you is there is no right answer to what is care for a particular trans person.
Okay, great. So what's a trans person now? Because you just gave every conservative their argument. What's a trans person?
Baby, a trans person is someone who wants
Please
to.
don't call me baby. I don't know that.
Oh, I'm so sorry. No, I call everybody that. That wasn't meant to be. That wasn't meant to be against you. Okay.
Nice.
So what is a trans person is someone generally I see as someone who wants to physically transition in some way, whether that be presenting or whether that be getting surgery or whether that be going on hormones. That's why I consider myself a trans non-binary person, because I will be getting on hormones to transition into a more masculine body. And so when you look at the, again, diaspora of trans people and you want to see what they individually need, I think that that's the kind of thing that needs to go through a whole slew of other medical options, such as therapy, such as maybe minimal hormones, such as maybe puberty blockers for some people who are young enough. But trans care is something that is a huge sweeping issue. That's kind of why I didn't really want to get into the trans aspect of this argument. It kind of happened immediately, but thanks, Scott, by the way.
I think that was what implied with the question. I'm going to be honest. I assume.
No, you definitely introduced the trans argument. And I'm not blaming you, babe. I'm not again, I called Scott babe. I'm so sorry.
You can call me babe. I'm from the South. I get it.
Thank you so much. Okay, no, I know that I'm taking up a lot of time, but I just want to know, like, what is the issue here with calling this gender affirming care when it affirms the gender? Go ahead, Scott. Yeah.
Okay, we'll go to Scott Doobie and Kilo Junior. Okay, Alpha Palms. Scott Doobie Lactoid, then Kilo. Okay.
Right. So Not So Erudite was hinting at exactly what people like me are going to do. Right. Which is that when you say it's when people like Corey and Kilo say, well, I think that this transition and this need for this care is showing a great insecurity in men. We go, cool, social contagion. That's exactly the argument we're making about why there's a massive uptick in transgender care. When you say things like, oh, well, this actually reinforces sex-based stereotypes by saying that men need to be taller and that they can't just accept who they are in their body, we go, yeah, that's true also with gender affirming care, right? And so, and then when you say that this is an unhealthy surgery and therefore we shouldn't be promulgating it, and then we look at people dying on the table from sepsis from genital surgery, we go, yeah, this is an unhealthy surgery, and the medical claims and the psychological claims about outcomes are fucking dubious at best, right? And that there really isn't an argument there other than queer theory that you're espousing now by not being able. When you say that,
I'm not espousing queer theory, actually, because everything that you just said, I agree with. No, I agree with it. Because I am queer. I'm sitting here in front of you. I'm telling you that I agree with you on a lot of the restrictions that ought to be on these surgeries and on these things, despite the fact that I am queer. I am not promulgating queer theory when I do that.
Yes, you are.
Okay?
By
being queer?
No, you are. No, I didn't say that. You said that. What
I'm saying is
when you say I mean, basically, Not So Erudite basically hits it, right? When you say that you have a gendered soul, you don't use those words. You're not quoting David Halpern. But when you're saying what's different for each person, there is no objective truth about like what is and isn't helpful, and like the science, it's all about the individual person's understanding of their own gender, right? That's queer theory, right? That is what gets murky and what gets away from science. Look, I have no issue, like I said in my opening statement, right? Even with, and I get a lot of heat from conservatives when I say, yeah, there are people like Buck Angel, for example, that never desisted, that were 3 years old and were like, I'm a boy. And we're 19 and we're like, I'm a boy. And we're 22 in the modeling industry. Very similar situation, right? I'm a boy, right? Market as androgynous. And I think certain clinics ought to have the right to engage in those things. And the righties in my chat flip shit when I say that, right? But the problem is that when you take these two situations and you say it's gender affirming care, and then you compare them, you really don't have an argument as to why we can't ban gender affirming care quote unquote, on minors, and why
Nobody's
we
talking about
should make it
minors.
where that there's no Go
Mm.
ahead. Why not? It's the same argument.
Minors shouldn't be having horrifically crazy surgery like that. Like minors shouldn't.
What about
That's
androgen
always
therapy?
been. Androgen
my God.
therapy is something I go back and forth on. There's the reason that I go back and forth, as I said in my opening statement, on any gender affirming care, including for trans people, being available to minors or being subsidized by the government, is because they are incredibly dangerous. These are things that are in their scientific infancy. Okay? And so I encourage all the little young trans people that consider me their mommy, I encourage those kids not to do anything as far as gender affirming care until they're 18. That has always been my
By your
standpoint.
definition of trans, those wouldn't be trans kids.
What do you
Because
so
they're
what do
not-
you
they're not
what do you think is necessary gender affirming care? Like what do you think of the word care? When you say care, why does it need do you think it needs to be provided? Because it sounds like you want I agree with you about a lot of the nuances of therapy and stuff like that. I'm all for what you're saying there of like just like the way that we've been approaching gender affirming care has been extremely like cringe and unsophisticated, which is mostly just underserving trans people, right? But when you're talking about care, like what do you mean by that? Because care to me has a very specific meaning. When I'm saying gender affirming care, it's not just people doing things that they'd like to because they like it. That's cosmetic surgeries, right? If you want to get big tits, that's fine. But a lot of trans women aren't seeking large tits because like that would be nice, right? That's at least how it's been proposed and talked about politically. And that's more so what I lean towards believing.
And that's part of why I was interested in this conversation is like, what do we consider to be something that is gender affirming? And then like, I guess beyond that, within the conversation that we're having right now is you're asking me what I consider to be necessary gender affirming care. That sounds like the question here.
No, it's about the word care itself. Because again, my concern is that you're basically making it sound like gender isn't really anything. There is no, because I treat gender like a material thing. It's very real to me. I think that there are things that we can definitely should know and attribute to gender that is separate from sex, right? And so when I talk about these things, when I'm saying a trans woman wants tits, it's not because she likes jiggly bouncy things and it would look cute. She wants it because she wants to be a woman and she wants to perform appropriately as the gender she feels like she is, right? So it's a different need. It's not like me, who maybe I want a boob job because it would look nice. It's for her, it's to match her exterior to her internal identity, which is causing her massive stress. And the intervention is necessary. Me getting a boob job isn't, even if it would make me feel nicer.
I completely agree with you. And there is one thing that I consider to be entirely necessary gender affirming care, and that is at the very least therapy. I think that therapy is the most singular, important, fundamental gender affirming issue in our healthcare system right now. And then beyond that, we have all sorts of other medical things, hormones and prescriptions, and in fact, very dangerous surgeries that are being marketed essentially to trans people like me.
You can't
So
differentiate.
I'm differentiating limb lengthening. Yeah, I'm saying limb lengthening isn't about.
But
I can,
the logic,
based on my
I mean,
definition.
you can just say it's different because.
No, that's not what I've said.
That the reasoning that you gave, right, is that the individual that gets a boob job, right, doesn't necessarily have stress caused by their internal vision of who they are, right, as a trans person, that it is just cosmetic to be more comfortable in the role that they're already in. The problem is that if you read the article, that would be the exact same reasoning that the short men gave, was that they didn't feel masculine. They didn't match their body. It was causing severe distress, right? And you could say the exact same thing about breast implants. If you're talking, for example, let's say someone had breast cancer and then they no longer had the breasts that they had. They have an internal vision of who they were at some point. And we could even make an even stronger argument, which is replacing the body to its most natural position before they were forced to have a double mastectomy. The problem is that you can use any of the arguments for these cosmetic surgeries that you can for trans people because trans care is just cosmetic surgery. There's no fucking science to support this idea that gender affirming care is some necessary thing for the trans community at large. It's just not there.
So hold on.
agree.
So hold on. Erudite, if you want to respond to that, that's fine. Then we got to go down the line. Doobie, Lactoid, and Kilo.
Sure. So for the case of limb lengthening and a cis man who wants it to increase his height, it's not because he's trying to be more of a man. He's wanting to be more attractive as a man, right? Which is super different. He wants to be more attractive.
I don't think that's universal. Sorry.
No,
Do you? Sorry. So I've talked to many guys who have had limb lengthening surgery. Do you think most of these guys are saying, "I'm just trying to be more of a man. I don't feel quite in my gender yet until I get the height"? Do you guys think that that's how people are
wouldn't
processing
use
it?
that language, right? Like, but the usage of the language of like trying to be more in my gender is really coming from like a political and ideological.
Right, but height.
They feel like less of a man because they're short. And if you tailor the question like that to people that are getting limb lengthening surgery, I bet most of them would say yes.
They're insecure in their masculinity, likely, or that's part of it, or some sort of moderating factor.
And to extend that a bit, women who've had boob jobs, I'm sure some of them, if you had like a woman who has like a flat chest, maybe doesn't feel like a real woman because she doesn't have the thing that other women have.
So do
Right?
people
so
look
from
at
her
flat-chested
perspective,
women or short men and go, "I don't know if that's a man or a woman"? Is that how people respond to these
no,
individuals?
but that short man and flat-chested woman might look at themselves and be like, "Hey, I don't look like a woman. I don't have breasts like a woman does."
Sure.
So I feel like
He's
less of a
selling at
woman than
McDonald's,
other women.
I often am like, I don't know if that's a man. That's
Okay.
a pretty common thing.
So
to have.
okay, so I think for them, right, from their perspective, this isn't just about wanting to be more attractive or just about wanting to look a little better. They have a gender identity that they align with,
No,
and
they
they're
look
not
at their
meeting,
body
and
they
they're not
think,
meeting. They're not meeting the necessary threshold from their perspective to fit that gender identity, right? So they'd like to change their body so that they more fully encapsulate that identity. Seems totally fine for me to call that gender affirming because they are affirming the gender that they identify with.
So a really big difference for a trans woman versus a cis woman is a cis woman who wants to get a boob job is saying, "My body's ugly." Right? My body's unattractive. I'm not going to attract men to some degree. There's some sort of body dysmorphic thing going on. Yes. What? Wait.
No, not necessarily.
I disagree with that.
There are plenty of women who are married, who have families, who want a boob job because they just don't feel uncomfortable with their breasts because they feel like they don't have.
Sorry. I'll throw in all the SJW caveats that you need, Doobie.
That's not an SJW caveat. It's just reality.
Okay, so
I
when
think you're actually minimizing the fuck out of women's experiences, which is
no, I'm not
distressing because I'm supposed to be the fascist here.
Okay.
Right? So
I know. I'm a little surprised.
Me describing some ideology for what is driving cis women to get it, to differentiate it from trans women, doesn't mean that I'm saying all women who get boob jobs are experiencing only this. That's self-evident. And if any of you are hearing me say all women, you're just not listening to me.
Then why are you speaking about those women? I'm clearly speaking about the women. I'm clearly speaking about the women who do have that experience, who do feel uncomfortable in their bodies, not just because they want to be hotter, but because they feel like their flat chest makes them less feminine. Those are the women that I'm talking about.
Sorry, I'll let you have that back and forth. Don't worry, Lactoid, Kilo, you're coming up, but go ahead. Erda, you can spawn.
Okay, I need to think about how I want to approach this. So what we are doing now is just stealing language, and we're just attributing it to a whole bunch of things, right? Saying something like it's not feminine is akin to saying it's undesirable, right? These things are very similar, correct? Would you agree with that?
Incorrect.
Not really.
No.
This is actually internet brain rot. I go talk
Well,
to
just explain it a different way.
I think if you were to speak to a trans
I
person,
think that's really like terminally online shit. Like to
Yeah.
say that it's brain rot that not everybody to say that it's brain rot when we say that not everybody who wants a boob job explicitly wants it to be attractive to everybody else of the opposite gender. Like I think that the idea
Probably
that
not
people
all
want
of the
to be
opposite
more
gender.
feminine
I would assume some of
is
these women
totally
are
valid.
lesbians or bi.
Sure, but the idea that it's attraction.
But what Johnny exactly. So what Johnny's saying is that it's not necessarily about attraction for a lot of these women. It is about them feeling more comfortable with their bodies and the way that their gender is being expressed.
It also works in the opposite way. Like there's definitely going to be people with AGP that want fucking big tits.
What percentage of women do you think are just getting boob jobs for only and exclusively themselves because they like the idea of them having larger tits?
I would literally say the majority.
Yeah, I don't know, but I'd be surprised if the majority of women getting boob jobs is just because
Well, I would
wanna
love
be
to get
little
a
more
boob
hot.
job, and I'm not doing it
No.
because I want other people to think I'm hot. Like I would,
You
I
just
just
want
like
attention,
the way
Nina.
it
Just
looks.
admit it.
Oh,
Like that.
okay.
No, it's probably
Alright,
like,
my head is gonna explode if I don't get in here.
okay. Sorry, Keely.
But
Go ahead.
Lactoid, go ahead. Lactoid's been waiting for a while,
No,
so
no,
go ahead. Okay.
But Lactoid's Swedish. It doesn't matter. Like, you go first, Keely.
No, if Lactoid, do you feel a strong compulsion to go? I do. Okay. I think that the distinction that Erudite is making, there is substance to, but it's a distinction of magnitude, not of like fundamental differences between two things. Someone who wants to be taller or wants to get a boob job or wants to get like dick lengthening or whatever the fuck it is, they have to say it's entirely cosmetic, I think is really disingenuous. I think they have an internal experience related to that thing that is fundamentally different from how they are perceived by the world. Now, in the case of trans people and gender affirming care, it is the magnitude is so great because it is everything. It's how they see themselves. It's how other people treat them. It's the clothes they wear. So it is debilitating. But it's the same thing. In the article that you linked, Prime, this was referred to as short stature dysphoria. It's literally referred to as a type of dysphoria. This is the same thing that trans people struggle with. This is the same thing, I would argue, that people who have smaller breasts like struggle with. It's a type of dysphoria.
Right.
I don't really understand why or when or how we draw lines for what's acceptable or not. If someone is anorexic and has body dysphoria where they feel like they are like heavier or perceived heavier
That's
than they actually are,
dysmorphia.
Yeah, that's dysmorphia.
there's a lot of overlap between those two things.
They're not the same thing, though.
The Venn diagram, there's a lot of fucking overlap between those
Sure,
two
but
things.
you should be careful with the language. Is my point.
Okay, I understand they're two different things. I'm just
Fair
saying, as it relates to what we're talking about, the dysphoria that is associated with perceiving yourself to be different weight than what you actually are is, I mean, realistically, is the same thing about like the height. Like you perceive yourself to be shorter, right, than what you actually are. Probably that's why you have such an internal struggle with it. So I just think that I'm consistent with all of this. I think that addressing it with surgery in all cases is probably not the ideal way to go. Now, there are some instances, like in the case of trans people, where this is probably the most effective and healthy way of addressing the issue. But as Johnny said earlier, I think that it starts with therapy. We have a culture where people are overly attached to the way that they are physically perceived by other people. And this has manifested itself in all kinds of dysphorias that are of varying magnitudes, as Erudite kind of started to touch on. It's just, it's unhealthy across the board.
Let's
You
go to
realize
Lactoid.
when you say
Wait, it's
Let's
unhealthy
get
to go
Lactoid.
to
Let's go Lactoid.
therapy?
Let's go Lactoid because he's been waiting.
And he's Swedish.
Yeah, I appreciate it.
And he's Swedish.
So I have, obviously, based on my intro, I also disagree with Erudite. But I think that a lot of my objections have been put forward. So as opposed to ask her a question, I'm just going to make a statement, and then she can, or other people who share her opinion can disagree. So in my mind, if I imagine a trans man who wants to go get limb lengthening surgery to appear more masculine, to me, this is gender affirming care in the sense they are seeking a medical intervention to more closely associate with their perception of masculinity, their perception of the gender they want to be, right?
Mm-hmm.
In my mind, this analysis wouldn't change whatsoever if you had like a cis man who was like, oh, like I also want to feel more masculine. I also want to fit within my role. And so I'm going to go get limb lengthening surgery as well.
Mm-hmm.
And I did, I did the ultimate internet brain rot and been reading studies. And it turns out that there is a strong correlation between height, how much a man values masculinity, and how dissatisfied with their height they are if they're short. In fact, for men who don't care about their masculinity, they have no height dissatisfaction even if they're short.
Turns out that there's no insecurities.
There's no insecurities. The insecurity comes solely from their perception of masculinity. That's where it comes from. Short men don't feel masculine. They don't feel manly, and that's why they get.
If they buy into the gender stereotype.
Yeah. Well, the thing is, the gender stereotype just flat out exists. And another thing that was stated. Another thing that was stated was like, this is like, well, okay, fine, that this might be, trying to associate with masculinity or gender more, but it's not the same kind of like situation, critical situation because of suicide risk or depression. But there's studies on that too, right? So short men are significantly more likely to be depressed and are twice as likely to commit suicide if you're a short man compared to a tall man, according to how they define it in the studies. Every 2-inch increase of height, there is a 9% decrease of suicidality. Being a tall man, feeling masculine, is absolutely like helps with that. And by the way, height's also correlated very strongly with conservatism and libertarianism. Just want to point that out as well. That's one of the other
Can't relate.
You're not grounded. You're far away from the ground, and so like your brain goes all over.
Yeah, well, I wanted to throw that in there. I wanted to throw that in there. It's important.
Well, that's
Our
oxygen.
heads in the clouds, and we just dare to dream.
Yeah.
I'm not disbelieving you, but can you link the studies? I'm just curious about
it. Absolutely. After I'm finished talking, I'll link all of these.
You got the ChatGPT.
So like all that being said, like in my mind, okay, we have two people. They both want to get surgery to feel more like the gender they want to be by becoming more masculine. I just can't see how you could possibly distinguish these people without making some appeal to, well, this person's just trans, so it's just different. That doesn't seem to me to be like a logical pathway.
I'll let Erudite respond to that, and then I'm sure Scott wants to say something. And Nina, if you want to say something as well.
Sure. So, okay. I didn't think that on a panel of conservatives and lefties that only the communists would be agreeing with me that like maybe we shouldn't treat limb lengthening surgery like gender affirming care. Okay, so just because you can like use the same language, for example, to describe like what you're experiencing, that doesn't actually give evidence that they're experiencing the same problem. So just because cis women are talking about body dysmorphia and how they feel like less feminine or less attractive, or whatever it is, or all the other reasons before you guys lose your shit for themselves as to why they want big boobies, okay? It doesn't mean that they're actually experiencing the same experience as a trans individual. All that's happening here is that we probably don't have either the language for it, or we haven't allowed the language to develop, or we're watering down language, which is what I probably suspect is happening, right? In the case of short men don't think that they're not men, right? Short men aren't being like, well, I don't know, am I a man, right? Short men don't think that the world views them as not being men. They think the world views them as unattractive, undesirable men, which is why they want limb lengthening, because it's depressing, and being a short guy sucks. It's rough. The issue for a trans person is that they don't think they are oftentimes the gender that they've been assigned at birth. And the world views them as one gender, and they inherently experience a different thing. So just because we're using similar language, it doesn't actually mean that these things are equatable.
I feel like you're not actually refuting what I said. I feel like you're saying
I'm open to what you're saying about the magnitudes as well. I think that's also possible.
I think it's important to establish that they probably are the same thing. If they're derived of the same like mental condition, then the way that we handle them should be similar.
I don't know if they are derived at the same mental condition. Right?
I'm arguing that they are.
Sure. And what I'm arguing is that I don't know if there's evidence to suggest that they are, right? When it comes, as Scott already said, things like sexual identity, if you look into the literature of our understanding of like how people come to have a gendered identity and experience is pretty weak. We don't know a lot about it at all, right? That doesn't mean though that a trans person is experiencing the same thing neurologically as a person who's maybe having like body dysmorphia, or is just sad because the world's mean to them because they're unattractive because of like some physical trait.
Well, I just wanted to ask, like, so I mentioned the first study, which was when men who do not value masculinity, like even if they're short, there is no statistical increase of like height dissatisfaction. They don't care. Or like if you don't really care about masculinity, and you're like 5 foot, who cares, right? But if you're if you are very masculine, like you very much value masculinity, like this is a critical part of your identity, and you're 5 foot, the study shows that like you are incredibly dissatisfied with your height, right? It causes a tremendous amount of anxiety for you. I mean, to me, how is that specific study? I mean, how is that different? I mean, if you don't fit within the role that you really want to fit within, you're dissatisfied. To me, that seems...
So what we would need is to find evidence that trans people who don't actually care about the gender binary and wholly reject it and have like no concerns about gender binary and don't care what people feel of them, we would have to have evidence that they show the same like lack of distress as these short men to have some evidence that perhaps these two things are mapping onto the same neurological correlate. The issue is that a whole bunch of us are saying, No, that would be the same study
Being
replicated but in trans individuals.
Right, but being gender abolitionist in the ideology that comes along with that is not quite the same thing as a man or a woman being less concerned with masculinity or femininity. These are wildly different things, both politically, both personally. Right, like I'm just
to
saying,
me,
like,
those are the same thing.
How are you different?
Whoa. I mean, I'm a gender abolitionist, so like, or is there any mix up here? Like, I'm kind of confused what we're going on with that. Scott.
Erudite, real quick.
An erudite, sorry.
Do you think that if let's say you have a trans man who does not care whatsoever about appearing masculine, they don't care about masculinity, and they're a trans man, you think this is the kind of person that'd be getting
don't have dysphoria at that point?
You think this person would be like getting the limb lengthening surgery if they don't care about appearing masculine?
Sorry, say that you got interrupted and I got distracted.
Sure,
would they care about getting limb lengthening or would they not?
If you have a trans man who just simply does not have any value in appearing masculine, just they don't care. Intuitively, what motivation would they have to want to get limb lengthening surgery if they don't care about appearing masculine?
I don't think a lot. I don't know where the limb lengthening is coming in specifically because I don't see height as this like essential, fundamental part of what we can include as gendered, right? I don't think that we would say like tall women are way less feminine and therefore not.
Literally the most visible difference between the sexes in existence.
Yeah, there's literally a Netflix like movie called fucking Tall Girl. What goes into that?
Wait. So you guys think that tall women are inherently less like feminine?
I think that they're viewed that way. Absolutely, that's very easy for you to think that that's not the case.
And you guys, so you guys think that tall women are performing femininity worse than short women?
They might be insecure in their femininity. That can be an aspect.
Yes, he's right.
Hold on, what you perform?
So weird. Why are all supermodels over 6 feet then? That's so strange.
What you perform and what you are born as are two different things. If you are okay. Yeah, I'm glad, but I really hope that we're not going into this idea of like performing it poorly when it comes to something you're born with. Yeah.
I have a question.
No, so probably you're gonna dislike my view of like sex and gender and like transgender and stuff like that. So that's gonna be like a different conversation. So we probably will disagree there.
I don't know.
Just to be clear, why are all supermodels over 6 feet tall?
If they're not generally a bunch of them. Generally,
not for men. For men,
they're all 5'9". They're all 5'9".
Yeah, 5'9", 5'10".
Wait. For men, modeling agencies, most modeling agencies for men require you can't be under 5'11".
You have to be
6 foot to 6'2".
Yeah, 6 foot to 6'2".
That's the average. And again,
I know because I was too tall to be registered with
5'9",
6 to 6'2". That's like the masculine like.
It is significantly taller than the average for women. Yes.
Okay.
Yeah, I'm 6'1".
The average for women is like 5'4".
Did we all work together to establish that tall women seem to actually not just be feminine, but held up as fucking beauty standards to women? Great.
It isn't.
You're not. Let me get in here. Let me get in here. No. Let me. I'm gonna get in here. Right. Like
height is not essential to gender. That's the point.
Listen. Okay. I think most people here, and this is gonna piss off my conservative. Do believe that the role that we're speaking of is socially.
You're breaking up a lot.
You're breaking up.
Okay, all right. Sorry, but the role that we're speaking about is socially constructed, and what you're saying is that it is a default that tall women are not necessarily less feminine because there's a very, very small section of the population where it is more desirable for the women to be tall because of the way that the photos turn out and the way that clothing fits a taller form. But in the general world, right, people do not use words like dainty, which they associate with femininity, for super tall jacked women, right?
No.
Like femininity absolutely does have an element of being smaller, of being demure, of being submissive, of being shorter in stature. And it is the exact opposite for men.
Sure.
Men didn't want to date me until after they found out I was a model.
My question is, though.
Can I answer you? Can I answer you, Erudite?
Sure. Can I just ask one last question?
Yeah, she has to answer.
My question would be, do people look at supermodels and go, not sure if this is very feminine. This isn't a very feminine woman. Is this a woman? Does anybody experience that?
I
Some
don't
of them
think
I look at and go, they look like aliens, and I know
Yeah, that's
that I'm
usually
not
what I
alone when I see
don't
some of these
think-
people with like these cheekbones
Okay,
that are like.
I'm gonna re-ask it. Hold on, I'm gonna re-ask it, but I'm gonna ask everyone to engage in good faith because I'm reading based on how like the leftists and the conservatives are responding to me that you guys are baking into what I'm saying with a lot of weird stuff. Probably the conservatives are actually not baking into weird stuff.
I have an actual answer, but go ahead.
But my question is just, do you actually think if you're touching grass that on average when people look at supermodels that they go, she's really tall. I don't know if she's a woman. Not very feminine.
No, but the reason is
The latter,
because
yes.
the reason is because when you digest modeling material, which is usually magazines or entertainment, like commercials, however it is digested, perceived height is difficult to determine. It's not that you perceive them. So supermodels that are, I think the ideal range for female models is like 5'9" to 5'11" or something like that, maybe even 6 foot. That's typically not something that comes across well on TV. Do you know what I mean? So there's a reason why that has to do with the way that clothes fit tall people. They kind of look better on tall people. They're easier to design, stuff like that. But it doesn't have to do with like I know when I see a tall woman in public and my guy friends make a comment about how tall she is, it's not of a sexual nature. Do you know what I mean?
Okay. Can I just say this? Can I just say an actual fact right now? An actual fact about this industry? Many of us who are taller, the reason that I am even able to model at 6'1", which is technically too tall for most agencies, is because of the androgyny factor.
Okay, so then if this height thing is like such an issue and it's just erased on like camera, why do they always prefer short people for movies?
I don't know if that's necessarily true.
I don't think that's true.
I have no idea.
That is regularly, in fact, it's notorious that actors are short.
No,
Tom
most
Cruise
movie
has to
stars
stand on a fucking table.
Yeah,
Tom
most
Cruise-
male movie
yeah.
stars are pretty tall.
The difficulty like we're running into is like you're saying things that are like I listed out like a study that seems to like counter this. Like yes, when you are short and like you value masculinity, like over like in a population, like you get really insecure about your height, and then if you don't care about masculinity, you're not really that insecure. But like the one of the other issue we're having is like what you're saying is kind of flying in the face of everybody's intuition here. Like we all know.
Sure, but I was also on a panel the other day where they were like arguing about like gun shit, and it was just like clear that literally nobody had ever stepped outside or like been in a fight. So like I'm very
okay. So I'm gonna say like I'm gonna say like I've been outside statement right now. Like I have been outside and I've been to bars, right? And I have heard women talk and I've heard men talk, and never in my entire life have I heard like I'm sorry, like women talk about how attractive shortness is on a man. That's not something that they talk about. I'm sorry.
Let's go to
alternative is true.
Breaking my heart, Lactoid.
I want to give Doobie a shot. If Nina, you have something to say, I want to make sure you give space. Go ahead, Doobie.
Yeah, and I think Scott touched on this a little bit earlier, but we're not even saying we agree with this, or at least I'm not, right? I don't agree that a tall woman is not feminine. I'm saying that the women who are tall, because this is like a societal standard or construct, a lot of these women do feel less feminine, right? So if they feel like the society that they're in sees them as less feminine, so they're internalizing this and then they feel less feminine, I can absolutely see them wanting to find some way to appear more feminine, whether that's finding a way to be shorter, just walk in such a way that they appear shorter, or get big boobies to offset the tallness, right? Something to affirm their gender.
Okay, and so you guys, just a show of thumbs, is everyone agreeing then that like when cis people like want to just be like more feminine and more masculine for whatever reasons that they have, that they're essentially just acquiring gender affirming care? Everyone agrees with that? It's the same thing as when trans people try to transition. It's the same?
No, I don't think
everyone agrees with that.
It's not the same.
I don't think it's exactly the same. I'm sure that there are some people.
You know what? Honestly, it's amazing. You guys just ruined trans advocacy on a single panel. So if that's the position you guys want to hold,
wait, what? You didn't even give us an answer.
No one gave an
all we're doing is extending gender affirming care to cis people. That doesn't ruin anything for. Actually, this is a more exclusive way to think of the issue. This is a more exclusive way to think of the issue, so that trans people don't feel like they're fucked up for wanting that gender affirming care because it's something a cis person might want too.
Exactly.
Right? It's actually way more inclusive.
Doobie, you're winning me back.
Wait,
exactly.
Great. So
trans people don't want. Hold on. Trans people.
Amazing.
We don't want to be. We don't. Which first of all, I don't have to advocate shit. I exist. But on top of that, trans people don't have to assign a certain type of care to themselves to feel special. We don't have to feel special. We want to feel included. That's largely why people get trans affirming care. So if you're going to take this particular type of thing and you're going to say, this is exclusive to trans people, gender affirming care is exclusive to trans people, how does that help us?
So you guys think that me going to the government of Canada and saying, hey, I'm pretty insecure about my breast size. I'm a cis woman. They're a little bit smaller than I'd like. I would like some gender affirming care and I'd like that covered. You guys, so ignore the fiscal stuff. Are you guys cool with me going to the government and asking?
I think that
gender
language
affirming
minimizes the experiences of women who actually have small breasts and are considering this. But sure, right? If a woman says, "Hey, I don't like how small my breasts are. I'd like them to be bigger. Government, please help me." I'd be okay with that. Yeah.
She's making the argument that.
But again,
I
think that actually minimizes the experiences of women who actually go through these procedures.
I don't think it's gender affirming care. I'm not saying other women can't get breast jobs. For me, I just want to affirm my gender more with larger breasts. So I would like gender affirming care.
Would that make you feel more?
It would make me so much happier. Yeah.
No, are you just saying that, or is that actually how you feel?
No, it would make me so much happier. I'm sure having bigger tits would make me a lot more.
Can I address this as also a fellow Canadian?
So number one, this is already done by the United States government for women in the military. If they can prove that they have like some form of body issues and that it has caused issues within their relationship, if they're married to another soldier, you actually can get the government to pay for breast jobs. But
what is it called?
Kind of irrelevant, right?
What is it called?
What's it called?
Yeah, I assume it's a procedure. Yeah, a program procedure. What
should be called gender affirming care,
think
right?
I have the VA fucking ICD-10?
No, I just think that you're lying. God damn it, Scott! Why do you always do this, you motherfucker? I think you're just lying.
Tactical morale improvement.
It's not just.
You're just gonna say something that you have no sources for this.
Okay, I'll get you the source later if you want me to go through and find. I'm not going to fucking right this second go through the VA paying for this, right? Like, it's common knowledge in the military.
Saying whatever.
Yeah, I want evidence
of common knowledge, and you don't know what it is.
Right. When I'm done speaking, I'll look it up for you since you can't fucking Google and give.
Well, I'm asking you right now. You can just stop speaking and look it up for me.
No, actually, I don't have to do anything that you say.
Can we hear from Corey?
Citing this as a source, motherfucker.
We got to move past this. We got to move past
this. All right.
I'm sorry. I was laughing the entire time. Lactose got me good.
Corey.
I'll get you. I'll get you the source.
Please do.
Right. Okay. Now, hush. Right. So the problem here, I think, is that it doesn't feel like anyone is able to actually differentiate the cosmetic surgery of leg lengthening surgery, breast augmentation, or even breast reduction between that and trans care without saying that the disorder itself is fundamentally different.
It's about the gendered performance, which again, non-binary people are not going to like.
Is this like we've already proven that the gender performance is the same? Lactoid has shown that individuals associate height with masculinity. The article itself affirms that the people didn't feel masculine enough, etc. Now,
nobody thinks a tall woman isn't a woman. Everyone thinks that, for example, a woman who has a beard, an Adam's apple, and broad shoulders with no tits isn't a woman. Of course.
But they do think that.
No. If you're going to get this fucking triggered, let's go down that rabbit hole and talk about how many people think a trans woman is a woman as opposed to just a fucking dude. All right. Like we can go through the societal fucking idea of what one thing is and what one thing isn't. All I'm saying is, the data does show that people feel less of a woman and less of a man. And these people that are trans, that have a gendered soul, that want you to believe that they are a woman, feel like less of a woman without this cosmetic surgery and feel more affirmed and more like a woman with the cosmetic surgery. The disconnect is not the surgery. What the surgery does is highlight the idea that we, for whatever reason, treat this disorder, call it gender dysphoria, call it gender identity disorder, call it, whatever comorbidities and transfactional comorbidities or whatever, like that go along with all of this shit. We treat this as a special case. And there isn't the fucking science to back up any of this shit being a special case. And what I'm arguing, and what I think, and probably not a lot of conservatives, because most of them go trans, ew, icky, please ban it. Right. What I am arguing is that they should be treated the same because you can't differentiate the surgeries and the practices from those of leg lengthening or breast augmentation from the others. There's these dubious claims about suicidality that have nothing to do with the surgery or the rights of an individual to get those surgery, and have everything to do with both politics, ideology, and psychotherapy. And you can't demonstrate that this actually helps.
I guess the 61% reduction in suicide attempts, 2 years follow up with trans people transitioning successfully. Just
I got it.
Yeah, but
I got it. I gotta go to. I gotta go to Corey, who's been waiting, and then Juby. And Kilo, I'm not sure if you had your hand up. Give me alpha palms if you need. Okay, all right, good. All right, so Corey, please.
Yeah, to address the example that Erudite brought up in terms of like whatever, using specifically Canadian healthcare of like, you know, should I have the right to just go to the doctor saying, hey, whatever, I need breast implants because it'll just make me happier. I don't see how me saying no to that scenario like invalidates any sort of argument, as in like gatekeeping happens in Canadian healthcare, just as you shouldn't be able to go to a doctor saying, hey, I'm in pain, therefore prescribe me opioids. I don't see how that invalidates of like you can if someone is, let's say, experiencing gender dysphoria. I'm not sure. I don't know all the details of gender affirming care in Canada, and obviously it varies by province. But I have no problem with anyone going to a medical professional and expressing some sort of whatever gender dysphoria, insecurity, and then as a result of some sort of medical evaluation, hopefully by appropriate professionals, that even something as maybe extreme as leg lengthening surgery as part of gender affirming care, but it's just gatekept, just as we do all gatekeeping of healthcare in Canada. I don't see that as a problem, just as we gatekeep, you know, painkillers and every other medical treatment.
Yeah.
Go ahead, Dewey, please.
I think maybe, and obviously you can correct me if I'm wrong, but I think maybe the disconnect here is going to be when we believe that someone is actually trans, right, or actually a woman. So for me, I say that gender is an internal state of being, right, an internal experience. So if someone identifies as a woman, they're a woman, even if they don't have breasts, even if they have a beard, right? That is a woman with a beard, right? So I'm curious, like, Kylie, do you think that someone needs to like express is like a maybe not stereotypical? I feel like that's kind of loaded, but they need to express in like a traditionally feminine way or somewhat for them to be considered a woman?
Yeah, I think gender is a performance essentially, and that you need to like do some level of attempting the performance. I don't think you have to perform it well. And I would never, for example, look at somebody who's clearly attempting the performance and just not use their pronouns because I just like, I'm like, well, you're pretty ugly. I would never do that. But I think it's pretty clear when people are like attempting to perform in such a gendered way. And I try to like acknowledge that. But yeah, I do see gender as like a performance that is downstream from sex. Yes. Not the same thing.
So I think maybe that is the disconnect.
Because, yeah, it is the disconnect, right?
Yeah.
Because I to some degree, like so hot take, I am a trans gatekeeper. I don't think anyone can just be trans because they feel like it and they want it. And I dislike the idea of this because I think it actively erodes all trans advocacy, because I do see transitioning and gender affirming care as a medical need, at least established in the literature for adult transitioning people. I just do. That's clearly not going to be a problem.
May I ask the follow-up question of who does the gatekeeping then in your scenario?
Ideally, it's going to be Dr. No, of course not. Wait, can I just, for a second, just ask that you would not assume that I'm some like awful bigot?
I'm just making a joke that you said that I am a trans gatekeeper. You literally just said the words. I'm just making a joke. I'm sorry.
So, right. That would be the same as like me saying like I'm a capitalist, right? Like it doesn't mean that like I am the end all be all of capitalism. So who I would want to be gatekeeping, who is gatekeeping trans and who gets access to gender affirming care is a combination of experts in both gender affirming care, so doctors, psychologists, and the people who are trained to actually administer this treatment and help these people transition.
Isn't that my position then of what I just went through earlier? Of like, if you like, even if you just like go to the doctor saying, hey, whatever, I just want larger breasts, and then I'm hoping the experts can distinguish between, you know, someone who just wants larger breasts for largely cosmetic reasons versus someone who's trans and experiencing gender dysphoria or what have you.
Sure, if we're differentiating it, and then therefore, if you're cis, well, I guess that would be a conversation for the experts to have. Typically, when we're talking about gender dysphoria, we're talking about people aiming to transition to some degree and experiencing a heightened level of distress because their body doesn't map onto their internal experience of gender. So, Corey, I think maybe we more agree. I'm not sure. I've had like 9 different opinions.
I understand.
I'm blending yours with somebody else. I I guess I would differentiate limb lengthening and like cis women wanting breast surgeries as they're not achieving gender affirming care. It isn't gender affirming care. It's something else. It might even be helpful. I'm not opposed to cosmetic surgeries. I just am not comfortable calling it gender affirming care.
I think that kind of line of reasoning would cut off trans people from seeking any kind of gender affirming care, right? Because you can express as a
Why?
woman without getting surgery, right? You can wear a dress, you can have long hair, do all the stereotypical woman things. So if having breasts doesn't make you more of a woman, or like it seems like
the reason why we hold on,
the way people are perceived.
Yeah, the
Well, this
reason
is-
why
yeah,
we would
of course.
call it a care is because it seems to be the case that for like trans adults who have gone through the transition and received a bunch of these medical interventions, like getting breasts or shaving
Right.
off Adam's apples, because they perform more, because the exterior world also sees them as women and their internal image maps onto that better, the dysphoria decreases, right?
Right, and I'm sure
Which is my goal.
if a woman with small breasts who feels uncomfortable with her body because she has small breasts were to get a breast implants, that
She
dysphoria,
can.
that kind of that feeling that she's not really fulfilling the needs of her gender, right, would decrease.
So
Yeah, I just wouldn't call it gender affirming care.
Two things. Number one, the data doesn't show that, right? It only shows that for a short period of time.
Oh God.
And then there's long-term studies from the UK that show desistance rates, right? So the idea is that when you say that these surgeries automatically lead to better outcomes, or that they lead on average to these better outcomes, it's like, yeah, you have a bunch of fucking comorbidities from somebody that has all of these issues that they then tie to their gender identity. They get told is their gender identity. They get immediately affirmed because you're going to lose your fucking license in America if you just start turning people away because you're going to get fucking ethics complaints constantly. And then, yeah, if you have an obsessive disorder and then you latch onto that disorder and an ideology that's not that much different than feminist psychotherapy, where you can take your issues and then act out in activism, which many in the trans community do, and then become trans rights activists, et cetera. Yeah, you might see a temporary decrease in suicidality or in issues, but that doesn't mean that the long-term studies show that, and that doesn't mean that they're worth it. Furthermore, it doesn't differentiate between individuals that are already within one sex becoming more like the gender that they see and feel less like that gender,
Okay,
and vice
can I
versa.
suggest a differentiation? So when it comes to things like body dysmorphia, which is what I'm going to say cis women wanting larger breasts fall into, it seems to be the case that therapy is highly effective at desisting most cases of body dysmorphia. It tends to be highly intensive and rigorous. For example, somebody with eating disorders is going to have high levels of it, and it's going to need a lot of it. But by and large, treatment and therapy for body dysmorphia tends to be effective. Typically, surgeries is not required to remedy it. In the case of, for example, trans people, they're going to tell you their sordid history with conversion therapy, which is, yeah, therapy needs to be done with all trans people. Absolutely. I would agree with Johnny in saying it should be the first step with every one of them, right? But a lot of trans people will tell you that just being told by therapists over and over again that you aren't in the opposite, like you're not in the wrong body, doesn't work for a number of these people. This is why gender affirming care became medicalized in and of itself, is because a lot of this conversion therapy type experiences were awful and they didn't treat the needs. Yes, it treated some. Of course it treated some, but it didn't treat a lot of them. And I guess we'll have to like compare data. Every long-term study in adult populations up to 2 years has shown remarkable effects, with desisters being typically less than 5%. It's very rare that they desist. With most people, I think it's upwards of like 70% say that the transition has radically improved their lives, even if it's come with major social costs.
Let's go to Kilo. Hold on. I want to hear from Kilo. I want to hear from Kilo. He was next.
50% of this woman has personality disorders. Like, this is insane.
God, shut the fuck up.
Kilo.
We're covering a lot of bases, so I'm a little bit lost in the plot. I kind of want to say, I think that the thing that I'm trying to acknowledge in this conversation is that, and it is entirely dependent on the individual. It's different for every single person. Everyone has an idealized version of the self that is contained within their subconscious. Whether that is related to how you are treated by other people, whether that's related to how you look, whether that is related to what gender you are. I think that when we're talking about this and we're saying that there's differences between cosmetic surgeries and ones that are based on internal struggles, they're all derived of the same thing. So earlier when I said that the difference lies in the magnitude, the reason why trans people experience such a debilitating level of depression and anxiety surrounding their transition is because everything about gender, We're conditioned to make people very attached to the idea of their gender. Clothes, entertainment, the things they're interested in, everything about you is related to the things that is normal for you to be interested in, or for the things for you to wear, or anything really. So it's debilitating for trans people to not feel like they are actualizing their idealized version of themselves. It is still somewhat distressful for people who are shorter than they ideally would like themselves to be to experience, but it's the same thing. They have an idealized version of the self that is not being actualized. These are the same thing, they're just different magnitudes. I don't like the distinction. Oh, that's cosmetic. And, same thing with breast implants, same thing with any type of plastic surgery. These are all derived of the same thing. It's just different levels of debilitation.
But like, hold on, Erudite. So, would you say that you can even acknowledge that, but just for a political and pragmatic sense, that it's just too damaging? That like separating these things has a useful reasons of utility to do so.
Separating which things? Sorry, just to be clear.
Oh, sorry. No, limb lengthening and breast implants on cis people with everything that trans people get.
So you're saying that differentiating them is a good idea?
Yeah, for practical reasons. That's what you're trying to say, right?
He's asking if you're lying because it's politically impractical.
No, I think gender affirming care is a precise thing that we're talking about, and I don't think that any cosmetic procedure that makes you feel better should be included under the umbrella of gender affirming care, because gender affirming care is both a clinical term at this point and a political term that has a very precise meaning. And if we're just going to apply it to any cosmetic surgeries that make you feel better, now gender affirming care doesn't mean anything. And so it's going to be really hard politically to try to move in states like Florida, for example, that has banned gender affirming care. What does that mean?
Right, you might be saying, you might be saying the same thing. You might be saying that there is a political connotation to you using the phrase, and that's why it's being gatekept.
Right, you're admitting that it's just a political pawn.
I literally said clinical. I also said clinical. Do you want me to reverse it?
But there isn't any fucking data to support that. When you say it's clinical, but what it becomes clinical because there's a certain percentile of suicidality reduction. When we realize that taller individuals are less suicidal, and we realize that they attach to their masculinity, and we realize that there is a surgery that can reduce suicidality in shorter individuals, what's the difference other than a certain percentage all of a sudden makes it magically different? What's making it magically different is that there's political philosophy pushing this that has swarmed into the medical community, into the AMA, the APA, the ACA, and has gone completely out of whack of science in any fucking spectrum. And that's why you're seeing pushback in places like Sweden, where they're like, hey, we don't know what the fuck this is, and we don't know why we're doing it to people.
Right. Sorry, I also read the Sweden release, right? And what it said is that there's a emptiness of literature, particularly around trans youth. I read the study as well. The term gender affirming care, keyword on care, has a functional purpose. It is clinical and it is political. Not all cosmetic surgeries are care. Cosmetic surgeries can be care, particularly in the case of trans people under gender affirming care, because the goal of the surgery is not to have bigger boobs. It is to be a woman and in as much way as possible for that individual.
I have one.
So you have a dubious science backing up an intervention, and because an ideologically captured institution says it's an intervention, it's clinical, so it's off limits for us to call it cosmetic. Bullshit, it's cosmetic.
Yeah, I mean, apparently though, you've won with the lefties. They all just want to call it cosmetic and for funsies too. So,
Lactoid, go ahead.
It's not for fun.
Sorry.
It's gender affirming. It's gender affirming for a cis person. That's what we're saying.
It's care, but it's not care.
One hypo that Doobie brought up before, how he saw the amazing atheist penis and it was microscopically small or something.
You should watch the video. It's really bad.
I'm not gonna watch the video, Doobie. My question for you is: let's say you had a man. He was born a man, and that's what he identified as. And let's just say that like he had no penis, or it was so incredibly small that it was non-functional. And he goes in to get a surgery to basically have them construct a penis for him. Would that be gender affirming care?
You know what? Why don't we just call all this shit gender affirming cosmetic surgery? Would that be better for everyone?
Kind of.
No, because I don't understand what the issue is with calling that care. Why not use the word care? I'm sure the fact his penis is so small is distressing to him. It would make him feel better if this was corrected. So what's the issue with calling that care?
What if we
They had to build
call it
They
that?
literally had to
You
like
could-
build the penis, like because then the follow-up question is, okay, so this man was born without a penis, and
Yeah.
we have to build him a penis, and that's not trans-affirming care. But
Well,
then we have somebody who was born without a penis because they were born female,
Right.
and then they identify as a man, so same
Right.
position, right?
Right. I would say the penis one, that might be negotiable. The limb lengthening shit, I'm sorry. I just can't map it onto gender affirming care.
When you say might be like negotiable, can you elaborate a little more on that?
I guess I would say we would need to have the experts weigh in. I don't think I've seen any like clinical case studies on specifically this type of situation about what degree that individual is experiencing anything akin to transness. When I'm talking about gender affirming care, I'm explicitly and always talking about trans individuals seeking medical assistance to transition.
And you believe that
And I
that
haven't
is
thought
an
about the
important. I'm sorry. I'm
I
sorry.
was just saying to Lactoid, I was just clarifying. I haven't thought about the penis thing.
Okay.
I'm not interpreting it.
I think that the penis thing is actually a really good case of cisgender affirming care. I do. I don't, and this is not because I don't believe in trans care, because obviously I am a person who benefits from that whole thing.
Yeah.
However, what I am asking is, I just want to know, is there something that is going to prevent trans people from being trans in your effort of solidifying this care as trans only? Is there something that will not other us in this? Is there something that will better integrate us into society in the effort of you saying that you are advocating for this care to be trans only specific?
I don't think everyone can call themselves trans. That's what I'm saying. I think if you're vampire gender, you're not trans. I'm not interested. I don't think it's trans.
Okay, but that's not what they asked.
That's not.
Okay, re-clarify your question then.
Okay, I want to know what you see as the benefits of taking what you would like to be called gender affirming care and making it trans specific. Because under my little psyche right here, if a man is born with a non-functioning micropenis and he does not feel like a man, then getting some motherfucking surgery for that, excuse me, some motherfucking surgery, get some surgery for that is gender affirming care to me. I just don't see why that is harmful for trans people.
I haven't thought about in the case of an extreme. So what you're asking about is in this case of something, when we're talking about definitions, we're talking about like these bubbles and there's these gray areas in the middle. And in this case of this one instance of a gray, where does this fall in? I haven't thought about this specific instance. Nobody's ever brought it to me. I don't have a specific opinion about whether or not it would be considered gender affirming care or not, definitionally. Right? What we were talking about from the very beginning was limb lengthening surgery, not micropenises.
Okay.
So I can work in. You
Wait,
can
so
potentially
you're
work in.
refusing to answer
You can
that
potentially work in that example.
What I'm saying is there's going to be things in gray areas, right? When we're defining things. So gender affirming care is a bubble of definition. And there's going to be gray edges around the edge. For example, this penis case. I don't know if it's going to fall into the category of gender affirming care or into a different category. I haven't thought about it. So I'm not going to weigh in and make some strong prediction or like prescription on something that I haven't had time to think about. My other positions I prepared for and have thought about.
So I would ask the question, the hypothetical, if this is a gray area, and it's totally valid if it is, where like if there's that's for example a trans man who is starting to transition, but let's just say they happen to be like super short, as in like they're like 4'8", 4'7". And it's really important for them in order to like fully transition that they would want this leg lengthening surgery. That is like core to how they visualize themselves in the future. So would you potentially gatekeep that, saying no, like that's a bridge too far?
At this point, yeah, I would gatekeep it. I don't think height is like this essential thing that we connect to gender, even though in general men are like.
If I can also like follow, and I really want to press this, please, to make so.
Shut up, bitch.
You can.
But they can get the cosmetic procedure. By the way, I don't think a trans man can.
I'm sorry.
Okay, so because you use the example of like let's say for example, tall models, they have no problem passing. So then presumably, change the genitalia is like shouldn't be off the table because you can pass in society without changing your genitalia.
Correct. Yes.
So then that should not be part of gender affirming care, presumably.
I think a lot of the time it is, because originally, in like when we're talking about like original origin of like a lot of these surgeries, the penis and like people with the most severe levels of dysphoria, which was oftentimes associated with the genitalia, were the ones like championing. So it tends to be included in gender affirming care. But just to be clear, like bottom surgery is gender affirming care to me. I just don't think that every single trans person has to have all of gender affirming care. But limb lengthening surgery to me is not gender affirming care.
Oh yeah, that would be that's the disconnect between you and I.
Yeah,
So,
I just don't know
if
how you draw that
if a
line.
medical team, hopefully there are qualified professionals, would deem it and they vow this person that this is part of their gender affirming care, I have no problem approving that, at least in Canada.
Right. So the reason why I draw the line is because when we look at tall people, that doesn't really help us differentiate, for the most part, whether they're a gender or not. It gives us a bit of a rule of thumb. But for example, when you think about like Adam's apples or breasts, that does map onto more clearly a distinctive gender. And I want that to be accessible to people whose gender identity does not match what they were born with. Yes.
Wait, but you disagreed with the boob jobs though for women, for females who had small boobs.
Women. Yeah.
Yeah. Okay, but so if what they were born with isn't matching up with their gender identity, which is a women, and women typically have breasts, right? If they have like really flat chest, I don't understand why you're leaving cis people out of that. Like it seems like the exact same thing.
I'm rejecting your ideology. You're saying it's all the same thing. Body dysmorphia is the same thing as gender dysphoria. And I'm saying I am not convinced of that at all.
I'm not calling it body dysphoria. Okay, why would you call it body dysmorphia and not gender dysphoria?
Why would you call it
dysmorphia and dysphoria are two different things. However,
I'm wondering what the distinction is.
I think what Doobie is describing is to an extent dysphoria and not dysmorphia. Yeah. Dysmorphia is thinking your boobs are smaller than they are. Dysphoria is wanting to present in a certain gender and not being able to.
Right. So in the case of the cis woman with small boobs, I don't think she's having this issue of not presenting as a woman. The issue is that she wishes that she was a more feminine woman. No, I don't think that she's trans. No, I'm not getting her gender care.
What about a man who happens to have like a larger breast for whatever reason? Like, there could be multiple reasons why that happens, but have larger breasts and wants to get them reduced. Would that
gynecomastia is a thing among steroid users.
Yeah.
Do I think a cis man getting gynecomastia reduction is gender affirming care? No. Gynosurgery might be gender affirming care, but in the case of the cis man, it's not. It's not driven out of gender dysphoria. It's not a trans related care service.
Look,
I don't view it as care at all, just to be clear.
Listen. We're beating up both this topic and not so erudite based upon the principle of name the trait. I feel like while I disagree with her, she has clearly named the trait, right? In her opinion, right? That this idea of like gender, that she said at one point in time during this, that gender is downstream and somewhat in ways inherent to the biology. Something I agree with her on, right? It's a performance, but it is inherent to a specific sex, right? Like woman describes the role that society gives and to the adult human female and vice versa, right? Which is something I absolutely agree with. We're beating her up when I think what's really going on here is that the trait that she's attempting to elucidate is moving from one that is downstream from the sex that you have to the other that is downstream for the sex that you have, and that this fits a specific category that she believes, I wholly disagree, but she believes the data shows that this is something that leads to more positive outcomes and is an intervention that can be prescribed towards moving from one to the other. And that becoming more masculine is not considered in her position to be gender affirming care, because it waters down the definition of what gender affirming care is, because gender affirming care is talking about care for a specific set of mental health issues or however you want to fucking classify that are present to a group of people moving from one sex-based role into another sex-based role. I'm willing to accept that, right? I think we should all be willing to accept that. And instead, what I think is occurring is that most of the people here haven't read any gender theory and haven't looked into
Wait, so you think that trans people are just people who want to move from one binary to the other?
Who are you asking?
I'm sorry, Scott.
Do I think trans people are people that want to move from one binary to
No,
the
I,
other?
I might misunderstand what you're saying. I'm just wanting you to clarify. It kind
think-
of seems like you're saying sex-based roles, and then you seem like you have no sympathy for the in the middle, so to say.
I have no sympathy for in the middle. I don't know.
Non-binary.
Or non-binary.
Speaking generally,
Yeah, non-binary.
Are the
No,
Wait, no,
non-binary
Scott-
transes too? is the
Scott
question.
was talking about what Erudite was saying.
He was outlining my position. To be clear, I
bring
think
out-
some are and some are not.
Okay,
yeah.
so
But to bring up some of the most dangerous communists ever.
I shouldn't have
Gregory
challenged
Lukács,
him.
right?
Oh no, I'm sorry.
Like,
I'm sorry.
I do think that you can.
Erudite.
I do think that
Sorry.
there's something right. I do think that there is something to reifying, right, like gender ideas. And I know all the chat stuff. They get so mad at me because they're all right wingers. But no, I do think you can reify certain gender roles. The fact of the matter is that woman is inherent to female and man is inherent to male. There's no real good argument against those things. Now, the TERFs would
That's
go so
another
far as
panel.
to say that there is no gender, right? They're just as much a gender abolitionist as the far left.
No, they're not. Terps
Because
are
they're-
incredibly gender binary.
Yeah, I was going to say terms typically
about
are not.
Actually,
Terms are
Gender
hold on.
binary. You guys
you
are
literally don't
Endless.
know what you're
All right,
talking about. if you say that.
Just to be clear, they're sexist endless because when we're
Right.
talking about gender abolition,
They-
Absolutely.
they reject gender roles, not because they don't think that. Yeah,
right.
okay.
They would say that you're destroying the idea of tomboy or anything like that because there is no difference because there is man and woman and that man and woman is synonymous and an
Yes,
exact
it's almost like
one-to-one
that's a
with
binary.
male
That's
and
crazy.
female.
No, but it's a sex-based binary, not like a gender.
I don't think
binary.
terms
It
make
doesn't
it.
matter. The point is the binary is my entire
What do you
point.
mean it doesn't matter? You interrupted me to tell me I'm wrong. And then I told
You
you
are
how
wrong.
you're being fucking stupid. Like,
I-
if it doesn't matter, then
No.
shut your fucking mouth.
So
Like-
ultimately, I agree. Like, I don't know how much headway we're really making. One of the things
Fair
I
enough.
wanted to ask about, maybe to switch topics a little bit. One of the things I wanted to ask quickly about this proposal about we're getting more and more men who are getting limb lengthening surgery. We have examples of countries like South Korea where you have an increasingly large amount of the population that are getting plastic surgery, cosmetic surgery going forward. One of the concerns I have is if you are born in a society in which everybody is tall because all the short people have had limb lengthening surgery, are you not sort of now like setting up a society for everybody who's going to be born afterwards, that you have this standard that you like need to hit to be the normal, right? So like in South
Korea, an epic handle
Yeah,
folds
it's-
with eye surgery.
Exactly, right? In South Korea, like if they sort of set up their children to like in order to look normal according to like their perception of normality, like they all have to get surgery now. This seems like we're setting up a system that sort of really emphasizes and encourages and prioritizes and incentivizes cosmetic surgery. And is that a good thing? I don't necessarily think so. It seems like a lot of wasted effort.
I don't think so either. I agree
Yeah.
with
A lot
you.
of
That's-
wasted
well,
resources.
wait, that's
I
actually.
think you should
Can I
make
get in
fun of
really quick?
dudes that spend $100,000 to add 3 inches.
Okay,
that'll
also
make them feel
bullying
better.
works. Yes. I wanted to say that bullying Erudite was
They
not
just
the
spend more
point.
money to get taller and taller.
Bullying Erudite was not the point. And
Yes, it was.
I really just genuinely wanted to know like why this is something that has to be so specific to trans people when in fact I would say that a lot of trans people are harmed by the idea that we have to get surgeries and we have to pass perfectly. Like the idea that gender affirming care falls under
You're not hearing me. Like you've just made a bunch of statements I literally disagree with. So I don't know what to tell you.
No, I'm telling
I'm
you
not saying
things
you're
that
saying
I am telling you things that I have experienced, which is that trans people are essentially marketed plastic surgery. And so how is making this I'm not even going to ask the question again. I'm so sorry if you are annoyed with my questioning of you, but my whole idea was that this is not something that we ought to single out trans people for if it's something that other people are also affected by. Because singling out trans people, whether or not you agree with that, is something that harms us.
Okay. So that's fair. That is one ideology. I think it's actually reasonable for you to conclude to this because the issue is that is the unknowable thing right now is the etiology of these things. Is body dysmorphia the same as dysphoria? Are these the same things? And the answer is we don't know. We don't know. So I think your conclusion is a reasonable one to come for. I just do think that it does hurt like political advocacy specifically, because what it does is it bolsters. I can tell you what my conservative chat members are doing is they're being like, look, even the trans people agree that like it's all just nothing. It doesn't matter and we shouldn't provide it. And it's like, I know that's not what you're saying. The issue is that like that is the implications that happen with these types of arguments. What I'm saying is I believe gender affirming care is what it's typically defined in by the institutions and the clinicians that have defined it as such. I'm open to it changing over time, but my understanding is it's essentially a range of supports, not just cosmetic and psychological, right, social, all sorts of things, medical interventions as well, not just surgeries as well. Sometimes it's just puberty blockers, sometimes it's just cross-sex hormones, right? Designed to support and affirm an individual's gender identity when it conflicts with the gender they were assigned at birth. That's what I believe gender affirming care to be, and that's what I believe is important. And when conservatives are opposed to this, the issue is that they are opposed to precisely this. They're opposed to women getting things like cross-sex hormones. So I understand the heart that you're saying of like, we don't want to be further otherized. And that's super fair. And I would also prefer that. But I want to make sure that it doesn't come at the cost of trans people losing complete access to their medical like interventionisms that they feel that they need.
Libertarian moment. Here we go. The real reason that this is even fucking controversial, this distinction that needs to be made, is because we treat this idea of care differently, both in tax money and both in the way that we decide whether or not something is a right. That is the real crux of the problem here. Setting aside gender affirming care for minors is this idea that we think, and you can disagree with whether or not it's right or wrong in terms of whether or not we should do this. But the reason that this is a problem is that healthcare is a service that should be voluntary, and people should pay insurance that covers whatever it is that they specifically want. And what is really occurring here is that there is this idea that is a subtext of this conversation, which is that healthcare is a right, or that people have or that at some point in time people deserve some level of tax money or some level of aid for the things that we call care. And we like the idea of saying that trans healthcare meets whatever our arbitrary threshold is that turns something from cosmetic into this magical new thing, which is that it's care and it's somehow a magical right we've created, or that they magically deserve funds or they magically deserve something. If we simply actually had a freedom-based liberty perspective, we would recognize that, yes, all of these forms of things are both services and they're all forms of care, and that people can voluntarily choose to pay for them or fund them at their discretion. That is why this is actually contentious, this point of delineation, because it changes how we fund these things and whether or not we steal money from other people so that we can pay for these things.
Lactoid. I wanted to we'll end things soon. But Lactoid, with your question about like the surgeries, I don't think that's something like you would necessarily have to worry about. I mean, I guess we can picture. I don't know. Like we could. What was that? There was a. I'm blanking now on the name of the movie, but there was a movie in which like everyone who was born went through some sort of like genetic modification to be smarter.
Gattaca?
Gattaca, thank you. That was the one. Yeah. So I could see like maybe something like that happening, but for the most part, especially when we're talking about preferences, that's not how society goes. I mean, like the United States is a perfect example. I mean, we've had breast implant surgery for forever, like decades at this point, and it's not something that like everyone wants. It's not something that becomes necessarily normal. So I mean, some people want it, but lots of people like smaller breasts, like having smaller breasts. Like it seems like the range of preferences is so wide that you actually don't have to worry about that. Like even go ahead.
I was just like, but rates of cosmetic surgery do appear to be increasing. But they might not be specifically like breast implants, but like vaginoplasties and rhinoplasty.
That's
like
true.
I think rhinoplasty is not nowhere near as cost prohibitive. It's more effective.
Right. I think.
I think that's probably. Breast implants are still expensive to get, whereas like.
Well, nose jobs like 3,000 to 4,000, and tits are like 6,000 to 10,000.
Well, so to respond, I do think that. I mean, cosmetic surgery like breast implants, like, I mean, they're relatively, like, well done ones are relatively recent in the sense of, I mean, I'm guessing it's not going back before the 70s. I mean, I don't know.
I think that's around the time.
I don't know the full history, but regardless, like, I mean, when you look at that being one, and then like more happening, more coming out, and then also the prevalency going up, and in certain areas, like again, like in South Korea, where it's so commonplace,
And
like
younger and younger, it
younger
appears.
and younger, and everyone's getting it. I think there is like a little bit maybe of like a runaway train effect here, where if only a couple people get it, like you don't have to get it to like be within like the norm of society. But if it gets to the point where like everybody's getting it, like there is an increasing pressure on the people who are not getting it to eventually get it, because the
Well,
more outside the norm
Here's a
you
better
are,
example: braces.
Yeah.
potentially.
I think so many people now feel like if your kid has like jacked up looking teeth, despite the fact that it doesn't have like any effect, like parents almost feel duty bound at this point to like have their, like you're almost seen as like a bad parent if you don't get your kid braces.
Yeah, the rates of that are also skyrocketing, and we can see like, look, one of the best arguments, I guess, both for plastic surgery, but also I guess maybe in this case I'm going to use it against it, is people with severe facial deformities or like burn victims, like people who really fit outside the norm in terms of like looking a particular way or presenting a particular way.
And there's no good answer for them.
They have like incredibly severe psychological and social and emotional ramifications. Like this group of people is by far, like if you want to look at like rates of like mental instability due to like physical like issues or not dysphoria, stuff like that. I mean, that's the group of people that you look at to see some of the highest rates, and it's obvious because you have somebody who's really not fitting within the norm. And so if we get to the point where through like rhinoplasty and like face fillers and everything, where everybody looks like this, beauty is like everybody looks this way, and when you're born, like if you decide not to go through that, like you're going to be socially ostracized and isolated and rejected, like people with severe facial disfigurements do now. I mean, you're going to get the surgery. You're going to have to. Otherwise,
It just sounds really psychologically harmful.
Can I ask? Or so
that's part of the
because
argument.
Scott brought up a really interesting point. So like we're already in bonus time. So like if we have to like run, that's fine.
Points are double.
The points are double in bonus time. Okay, so just to be clear, we've gone past like the stop time. But like I thought this is so interesting. So I really wanted to know what everyone's opinions. And so if they keep it like brief, do you think that braces, right? Like or not even just braces, because there's more than one way for like orthodontists to fix your teeth, but the trend to somehow fix a person's teeth to make it look straight and normal, do you think that that is somehow negative and should be discouraged because we are pushing people away from their natural state, and we should say, hey, your natural beauty, being with your teeth and whatever formation they are, that is more important, and we should get back to that. Let's go around. I want to start from Erudite. Erudite, what do you think about that?
Sorry, I literally have been tuned out for the last little bit. Can you just repeat the question?
Sure, no problem. Scott brought up braces as like a form of procedure that people use as a way to conform. And there's a lot of pressure to conform by having.
I want to be clear real quick with my own example. Part of it is functional, right? Like,
yeah, okay. I was going to say
there's a level of functionality to it, but there's also an argument to be made that a lot of people, like if your teeth are even just a little bit crooked, which has
just like a gap,
impact, or like a slight overbite or underbite, that like parents are almost pressured by society to like have the money to get their kids to an orthodontist to have like a nice smile, or they're almost seen as like bad or almost neglectful in a way when there might not be a functionality argument there in a lot of cases.
Yeah. So should we move away from this? So should we say that like your natural beauty, assuming of course it's like it's a matter of beauty rather than function, right? That your natural beauty, your natural teeth formation should be good enough. So should we move away from this like orthodontic increase?
I don't care at all, to be honest. If people want to get braces because they feel insecure, I in general, if you're extremely uncomfortable with your body, you should seek therapy first, always and foremost, especially if it's not a functional issue. If your teeth are so mangled that you got like them protruding out the front of your face and you like have to like, use an intubator to breathe, sure, yeah, you need braces. But if it's just like a beauty thing, honestly, I think at the end of the day, like people hold shame. First you're going to fix your teeth, and then it's going to be your eyes, and then it's going to be ears, because like shame is typically a lot more about your internal experience than about others. I don't think that's entirely the same for trans people, but yeah, if you're having like these cosmetic needs and concerns, for sure, you should seek therapy first.
So the reason why I asked this, and maybe you didn't hear this as well, because Lactoid brought up that eye surgery that's popular in Asia, right? And saying that that's been increasing exponentially. So that has no functional reason. I'm imagining this has no functional reason. It's a beauty standard.
It's actually less functional. It can affect tear ducts.
Yeah. Okay.
Yeah.
So,
I mean, the issue with the beauty stuff is like we have Moloch's game at play, like at all times. So it's like, okay, well, like I convince a whole bunch of people around me to natural beauty is great and beautiful and wonderful. Cool. There's like 4,000 other people that are actively seeking these cosmetic procedures to make themselves more beautiful, to get all the benefits perceived by that, and to increase the beauty standard with their like falsified. So it's like the Moloch's game where if you're not cheating, you're losing, right? So at the end of the day, I think that like cosmetic procedures are neutral to me. I have no problem with it. In fact, what we do see is that cosmetic surgeries do lead to some long-term benefits of people being like broadly like slightly less inclined to like certain psychotic disorders and stuff like that. So that's fine. I'm not super interested in barring people from cosmetic surgery, but yeah, ideally it would be better if people like held less shame about their body. Sure.
Okay. All right. So this is just the last question. We're going to ask it around, and then we'll move on to other things. We'll move on to the parts of the stream, and stick around, people. We still have more content afterwards. But Nina, yeah, what do you think about the braces thing?
The brace thing is a whole different story. I don't really have any particularly strong. I don't know if that's true. I don't have kids, obviously, so I'm not sure if we're talking about when Scott's saying that there's like a social pressure. I'm not aware of that, so I really don't have that hard a stance on it. I think that's really important, probably generally, but I think a lot of orthodontistry is generally purposeful, but I think sometimes it's a little bit overstated. This is such a like milquetoast take, and I understand that, but I don't have an opinion. If again, the main thing was that it was like the social pressure aspect of it. So outside of that, again, I don't have kids, so I'm not going to try and speak for somebody who has kids, obviously.
Doobie.
I'm sorry, what? Oh, the braces thing? Sorry, I was reading something. Is the question, do I think that it should be covered, or do I think that we should have like a societal pressure to fix your fucked up teeth?
Yeah. Should we have that pressure, or should we accept people's natural beauty? Again, we were talking about beauty, a beauty procedure rather than a functional procedure.
I would say it is kind of neutral. I think if it makes someone feel better, sure, go for it. If it doesn't, don't do it. I don't really care either way. But I think typically when people do that, it's because either them or their parents, they're just trying to correct it so that it doesn't get too bad. And when they're adults, it's like more difficult to do the braces.
And you feel the same way about the eye surgery? Like
yeah.
Okay.
Yeah, I don't have a problem with people getting just about any kind of cosmetic surgery for any reason, really.
Even if it's like the social pressure is increasing because so many people are doing it, you're like, yeah, that's okay. All right.
Yeah.
Okay. Fair enough.
So if they feel like if they feel uncomfortable in society, I think it's a tall order to just say, hey, change society. I think it's kind of like it's insensitive to the person dealing with the problem, right? So if they want to get the change done, go for it. I don't care.
Okay. Johnny.
Okay. So I'm gonna be consistent here. I do plan on being a foster parent at some point, and I will not be able to afford braces for every single foster child who comes through my home. And so my consistent viewpoint on this and other surgeries, especially when it has to do with minors, is to build the better world that we are hoping for, where people don't have to look at their teeth and say, I am an acceptable person in society. I think that any amount of effort given to demedicalize people and to have them be comfortable in their bodies is fantastic.
Okay, Corey.
Well, stole my position, but to answer the prompt, I pretty much agree with virtually everything that Johnny just outlined. As Scott pointed out, unless there's like some sort of functional impairment, I would generally strongly discourage braces, and I think that's sort of somewhat in line of like, let's say in other countries. I think based off some of the data that I've seen, even just like skin lightening procedures, skin bleaching procedures are like taking off. And I would strongly discourage that, as pretty much like Johnny outlined. And it's in the prompt. Should people simply feel more comfortable in their bodies? I would say yes. And at the same time, I think we should be more accepting of diverse body types, including however you present, teeth, your skin color, etc., etc.
Okay, Scott.
About my own thing, yeah, I didn't mean for it to really be a big thing. I just said that braces, I think, elucidate. Oh, pardon me. They elucidate this idea that once something becomes cheap, or relatively cheap, I should say, and once something becomes normalized, right? It is very possible that these things then become a situation, as Lactoid was showing, where it could be a situation where you're almost pressured into. Right, as it stands right now, leg lengthening surgery is an incredibly painful process that doesn't necessarily lead to better outcomes, because a lot of these people go years and sometimes their entire life not being able to walk properly. But what happens in 10 years where it's a relatively easy procedure, right? Where, you just sit at home for 2 weeks and then like you get up and you go, and then all of a sudden you're 2 to 4 inches taller. Well, all of a sudden, what a tall person is changes, right? If it becomes all of a sudden the average height is going to change in America from like 5'9" to 5'11", right? And the people that are naturally 5'7" or 5'6" are going to be like these tiny little people, right? That like experience a world that's even worse than they would have originally. I can tell you, someone that's 6'5", on more than one occasion, I've been really embarrassed because like I'm super sociable and I'm like I'm just a very extroverted, and like I talk to people, and like I've gone to the grocery store and like someone's been kind of like standing in front of something that I need, and it's been a Latino man, let's say, that's like 5'2" or 5'3", and I have said, "Hey, little guy, can I get that right there?" And then they turn around and it's like a full grown man. But like
No.
I can't help that this person comes up to my belly button because I'm a giant and they're a little baby person. And I feel so bad and embarrassed. And I'm like, oh my God, am I going to have to fight this guy? Like, you know what I mean? Like, I don't want to. I didn't mean it like that, right? That is going to be an experience of more people in the world if leg lengthening surgery becomes like a normalized thing, so that everybody that's middle class, that's short, automatically just adds 2 to 4 inches. And there's almost going to be even more pressure for those individuals that are shorter to get this procedure.
Why not just say excuse me? Why do you need to like little brother guy? Like I don't understand.
Because I have kids and I see, and what I see
they can't
initially
walk
is like
like
Everyone's a
kid.
child in Scott's world. Just goes
You know what I mean?
back.
Like, I see a child, right? And so I engage with them like a child in a nice
Oh my
way, like
God.
I'm trying to be polite, and I'm like,
Hey, little
can
buddy,
I get
can you
right
move out of
there?
the way?
Yeah. And then it's just like a full blown bearded man. I'm like, oh, fuck,
And
what
he
did I
wears
do?
glasses. He has problems with depth
Just stand
perception.
behind them in
Okay.
silence until they notice you. That's what you do.
Lactoid. Yeah.
There's certain things in my life, I don't know why, but that, like, I feel like they activate like a brain lesion or something, and I become like deeply uncomfortable if they happen. And one of the things that makes me deeply uncomfortable is when somebody prioritizes aesthetics over function. Like when I hear like, oh, we get to give up this particular like functionality because it didn't look right. Like that just like it causes like a, well, hold on, why, right? Like I very much value function, and to be honest with you, I don't really value aesthetics whatsoever. At least not like principally. So under this kind of principle, I think it's horrible that for non-functional reasons anybody gets cosmetic surgery. I think it's a waste of money. I think it's a waste of resources. I think it does contribute to a society in which people are pressured now into getting cosmetic surgery and to kind of follow along with that. Ideally, what we would do is hyper focus on functionality, hyper focus on fitness for fitness's sake, not just because of the way it makes you look. Hyper focus on hey, it's okay if like your teeth are crooked, doesn't affect your function. Who cares? It's okay if your hair is this way. It's okay if this is I think there should be a shift away from giving a fuck about the shit that just doesn't matter in life. And I think it's kind of at a boredom that so many people are starting to hyper focus on shit that doesn't matter or shouldn't matter. So socially, I think we should from starting from childhood and in school, we should like teach kids to like not do cosmetic surgery generally.
Kilo.
I kind of agree with little ingredients of what everyone just said in their closing statements. I think that one thing that's important for me when I think about this is that there are women with large breasts who have a lot of problems with the fact that they have large breasts. There are men, such as me, who are tall, who have a lot of insecurities about how tall they are.
Not where I thought you were going with that.
What?
I just think, as I said earlier, everyone has.
Every short guy just vomited. Yep. Sorry.
Yeah, it's fine to invalidate it, but I think that everyone has an idealized version of themselves that is subconscious. And I think that if all we have available to us right now, the best tool at our disposal, I mean, Scott and Erudite kind of touched on this with trans people. If the best tool at our disposal for improving the happiness of these people is gender affirming care or surgery or hormone therapy or whatever it may be, that's the best option right now, and I'm fine with it. But I think that really what
Don't tie
like
me to that
is,
shit.
I mean, you were talking about how it might not actually help them. I'm saying that that's part of the conversation for me.
Just clarifying.
I completely understand. You guys are opposite sides of the same coin, is what I'm saying.
Yeah.
And I think that for now, if what we think is that is the best option for them, then I don't have a problem with it. But I would like to wean society off of the tendency to start chopping off parts of our bodies and to start mutilating ourselves just to fit the subconscious idealized version of ourselves that is really in all cases I can say societally generated. There's no biological basis for most of this.
Circumcision's another example. Just want to throw that out there. I just remembered.
That's a great example. Labioplasty is another example. I can point to almost any example, and I think that while cosmetic surgery may show marginal improvements, is it the best solution? I think the best solution would be a cultural and a societal shift, which would be a lot more resource intensive and take a lot more time. But that's kind of more what I'm interested in.
Fair enough. Okay. We are going to go on to our open walk on panel after this. So everyone, if you've enjoyed this, and come on, I gave you a banger of a panel here. Right? This was super interesting.
Wait, was the braces questioning our closing statements?
No. I'll give you a thing. I'll give you a thing afterwards. Don't worry.
Oh, okay. Sorry, I was just really.
I kind of assumed that.
Sorry,
That's a
it
weird
felt like
place
it
to
to me.
end.
Sorry.
If you
was-
said my closing statement, I was like, I feel like braces conversation is the worst way to close.
No.
Don't blame me for that shit. That's on Prime. Don't.
I thought it was super interesting. I thought
It's
it was
always
super
the ANCAP's fault.
I'm glad you asked.
Always my fault.
Yeah.
Guys, I gave you a banger of a discussion. Thank you, Nerudius, for 300 bits. If you valued that, then consider supporting the channel. Help us get to a hype train by supporting the channel, subbing to the channel, gifting bits, or gifting subs, resubbing, or using Amazon Prime / Prime Gaming. This was a great topic. It turned out like better than I thought. And there's still so much to explore. Like I really want to explore what Kilo was saying there at the end and at the very beginning. We kind of skipped over that. But if you like this, consider helping us out so we can have more of this. All right. So sub to the channel, give bits or give subs. We get 2 more people within the next 5 minutes who gift. We can start a hype train. So shout out to me for getting us started. Let's see if we can get 2 more individual people. Start ourselves a hype train. Sub to the channel, give bits or give subs. You get our emotes and you get ad-free viewing and all that good stuff. Okay. So I'm gonna give an outro to all these people. Oh God, and let's keep it relatively short, guys. I've already it's past midnight, way over time,
But not too short.
Not too short. Kamikaze, thank you for gifting us to Kiss My Ass 7. Okay, all right. All right, this is Kamikaze out there.
It's the
Shout out
most
to you, Kamikaze.
Twitch thing I've ever heard.
Exactly. One more person, we can start ourselves on a hype train, which would be fantastic.
Let's
I can interrupt each and every one of these people by shilling too, right? That'll lengthen all of this. Subs to channel, get physical subs. All right, we'll start with our friend Lactoid. Lactoid, thank you so much for being here, dude. This was great. And well, you may have had me laugh the entire time. So friend, love and appreciate you. Tell people about yourself.
Brian, thank you so much for having me. the rest of the panel, thank you so much for arguing with me. It was a great time. If you like what I had to say, you could find me at Lactoid TV on Twitch, Twitter, and YouTube. Thank you.
Okay, all right. Less than 3 minutes left to get that hype train started. Help us out. Subs, channel, give us a subs. All right, we'll go to our friend Scott. Look, people can't resist you. You are irresistible. This is the truth. But still, I always appreciate it, no matter how these conversations end up going. Thanks for being here, friend.
Yeah, no, I definitely appreciate. I'm happy to be back. I've had, we've been restructuring some things with the channel, focusing on quality content over quantity. Mostly because my super autistic, older than most Twitch streamer audience kind of demands it. So I mean, follow what the people want. They want quality over quantity, so that's what we're giving them. And in the name of that, we had a lot of interesting conversations about AI. I did a whole breakdown on that you can see on the YouTube channel. If you want more information on trans stuff, you should go to Fabian Liberty on YouTube as well. I have an interview with Chloe Cole. I have an interview with Buck Angel. I have an interview with Tulip R. This Wednesday I'll be talking to Jade Rance. I've talked to pretty much every detransitioner there is. I did a panel with Blair White and the people I just mentioned, as well as Taptaj and Sinead from Genuflect. Like, I don't know why, but for whatever reason, this is what I end up talking about a lot. And these are the only people that'll answer interview requests.
We're on fucking Twitch and YouTube. That's all we talk about. Like a fuck.
I try
Blair
to
White is
get other
also not a
interviews.
detransitioner.
But Nina, who's not a detransitioner? I'm sorry.
Blair White.
Yeah, I'm aware that Blair White's not a detransitioner.
Buck
I'm saying
Angel?
I also did a panel with other people that are in this. Why are you interrupting my plug, motherfucker?
You do it to everybody else, bitch. That's why.
I don't interrupt people's outros.
Good old eye for an eye.
Right.
Oh,
so definitely come by on on the 13th, I'll be talking to Benjamin Boyce about argumentation ethics and philosophy and libertarianism and Christianity and whether or not they interact and counteract. So a lot of good stuff there. I really appreciate you having me on, and you should come check us out.
As always, friend. Yeah. Help us start that hype train. Sub to the channel, give subs. Help us out. Oh, just now's the time. Sub, and that'll be great. Or give something. Because again, great content here, right? So if you want more of that, then help out the channel. Let's go to Corey.
Thank you so much. I totally agree. Banger panel. Clearly, I think we've solved it. Solved AI art and solved gender affirming care for sure. And I learned something new about Scott, that he is extroverted. Breaking news to me. But yeah, always grateful to be here and to be invited with these familiar and fine faces and new faces. Doobie, Nina, Not So Erudite, Johnny Scarlett, always a pleasure. Pleasure to meet you, Kilo, and always a pleasure, Scott and Lactoid, and love you, Prime.
Yeah. We learned that he's personable. Oh, amazing.
And everyone's a child.
Everyone, from his perspective, certainly. Wolf of Mandalore, thank you for the 16 bits. Okay, let's go to our friend Kilo, our new friend Kilo. Kilo, this was amazing. I'm very glad that you decided to stop by. This is a lot of fun. And if you could, I'm not sure, I don't know what your schedule looks like, but if you could stay on for the open walk-on panel afterwards, I'd love to get you to expand upon your problems of height. Yeah, that'd be great.
Yeah, let me. I might have to step away for 10 minutes or something, but then I can come back and kind of hang out for a little bit afterwards.
Okay.
But it was a pleasure to interact with everyone, even though I know some people kind of already. I don't have anything to plug. I'm not a creator. I'm just a prominent community member. I enjoy the conversation. I enjoy the discussion. I think that we are solving the world's problems, Corey. I think one step at a time. And if you would like to discuss any of these ideas with me, some people might be a little bit disturbed to know I'm a very prominent member of Mr. Girls community, so I have to shout him out briefly. You can also find me at Erudite server or Smeth server on Discord. And my name is the same on all platforms. So thank you guys for having me. It was fun.
Thank you. All right, and thank you a little bit for giving us up to our friend.
Is One Step at a Time going to be the name of the surgery clinic that you're opening up for leg lengthening?
It is literally one step at a time.
So people can experience being 6'5".
Oh man.
But thank you a little bit for gifting us up to our friend Johnny Scarlett. And Johnny Scarlett, I love you so much, and I miss you, and especially your beautiful voice.
Thank
This has
you.
been great. Like, no matter what Johnny is saying, right? Whether I agree or disagree with them, like their voice is just magical. It brings nothing but pure joy to my life. I'm curious if I ever got you like super mad at me if I would say the same thing. But anyway, Johnny, thanks for being here, friend.
Hey, thank you so much. Thanks for always giving me a big shout out, dude. I love being here. I thought this was a really interesting conversation, and I love having conversations like this on Twitch. If you want to have also cool conversations over on my channel, my name is on the screen right now. It's Johnny Scarlet with 2 T's. Like I said, I talk about everything from philosophy to science news. I would love, by the way, to have Corey on the channel at some point so that we can
I'd
talk
be
about your
grateful.
shit. I would love that. Okay. And thank you guys all for being here. This is really fun.
Okay. I'm gonna drop down to Doobie next. Doobie, you're great. Dark Lord and Savior. Thank you for doing what you usually do and complicate these discussions. Shout out to you, friend.
Yeah, thank you for having me. I'm Doobie. I help run the politics server on Discord. We are actually having an AMA with someone kind of relevant to this, Megan Murphy, tomorrow at 7 p.m. Pacific, which is like 10 p.m. Eastern, I think. So that should be pretty interesting.
Who is Megan Murphy? I'm sorry.
I'll send it. I think she's like a TERF, if I remember correctly. Feminist. She's a founder of the Feminist Current website, feminist website and podcast. And she's like a hardcore TERF. So
Grill her. Do it.
I don't grill people during AMA.
Call her the C word.
I'm neutral during AMA.
Oh God.
Yeah, 10 p.m. Eastern tomorrow on the politics server, discord.gg/politics.
10 p.m. Eastern. Okay, I gotta check that out and hopefully not be asleep this time. Oh God, that still hurts. When that happened. All right, let's go to our friend Nina. This was a lot of. I didn't get to hear much from you, Nina. I guess Scott and Lactone would be particularly fraudulent this stream. But Nina, thank you for around.
It's always a pleasure. I wanted to behave. I went a little bit too hard last time, so I feel like I had to be a little bit more tame. But again, I feel like Erudite was getting a little bullied and was feeling bad. But no, it's fantastic to see everyone here. Obviously, Scott, Corey, Johnny. Very nice to meet you. And same with Kilo. And it's always nice to see you, Erudite, of course, and Lactoid. And Doobie, I hate seeing your avatars, so I'm going to say it's nice to talk to you, but I don't like seeing you. But thank you so much for having me on again. It's twitch.tv/ No, it's good for me. But it's a pleasure to always be here. You always have really interesting topics, and I'm so happy to be able to have the conversations with you guys, because you're all like you care about your opinions, and I think that's awesome to talk to people like you.
Awesome. Thank you. And last and honestly one of the goddamn best, my friend Erudite. And in case people didn't know, my friend Erudite is a big girl, right? She doesn't need anyone to handhold her. She's up for the fight. This is one of the reasons I appreciate her. I mean, yeah. So I've never seen her back down. I've seen her get super fucking annoyed, but not ever back down. So shout out to you, Erudite, because I did not expect that topic to center around you, but you handled yourself as you always do. So thank you so much.
And you also look fire, by the way.
Thanks for tuning in. I was very excited. Yeah, I mean, I wasn't getting bullied. Let's be honest. I fucking bitch handled all of you. Okay, I spanked you all on your bum. I'm just kidding. But in reality, it's all good. It's all fun and games. I don't know. I don't have much more to say than that. Scott, it's always fun to see you. I appreciate you being around. So many people give you an unfair rap, Scott. I actually like talking to you. You're one of my favorite people to be on a panel with. So, just so you know, I mean it. I don't think you actually believe me based on your expression, but that's okay.
No, I'm being careful not to interrupt outros. Right? I got accused of it. All right,
I know. I'm just I'm glad to know that I could unite leftists and conservatives on this panel because everyone just wants to eradicate gender affirming care. Base. Now I know I could go to my government. That boob job I've been wanting. Base. I'm gonna get it. Gender affirming.
That's not how it works.
Do it.
Oh no, that is how it works now.
Stop bragging about being Canadian.
Okay.
I was gonna apologize for dogpiling you, Erudite, but never mind. Fuck it.
You don't need to apologize to me. You guys all single-handedly just, undid 20 years of trans advocacy. So well done.
Base.
Yeah.
I know the conservatives love that. I know.
Detransitioning. Let's do it. Come on.
So I'm glad we all had a great time, and I'm glad no one's feelings were hurt here, because this is just how we operate. And I'm glad you said that to Scott. Right, Scott's one of my favorite people to talk to as well. Right,
It's a bad rap, unfairly.
he is an acquired taste. But once you acquire him, he's great. So anyway, we are going to go on to. You'll have to acquire some condescension there too. We're going to go on to our open walk-on panel. Right after this, anyone here can join us. But if not, that's okay. Thanks for putting your time, energy, your knowledge, and your passion, my community. I know they appreciate it just as much as I do. Have a good one. Bye.
Always a pleasure.
Bye, guys.
Bye.
Goodbye.
Yeah, pleasure to talk to you guys.
Take
That
care,
was
Scott.
fun.
Yeah, that was great. Well, as usual, on the same page, Lactoid, moving society to a better place.
As
Hell yeah.
always, as always.
Doobie, it was a really weird experience to be on the same page a lot of the time.
I'm just trying to figure this out.
Well, I guess sometimes you're right somehow. You're usually wrong when we're on these
Let me
panels, but
turn
today
this.
you're correct.
All right. I'm gonna
You
head
got
out,
this,
guys.
man.
So it's fantastic talking to you guys as always.
Take care, Nina.
Bye, Nina.
Thank you.
Yeah, I'm gonna.
Hell yeah. I'm staying for the open panel.
But Lactoid, I just have
I
one
actually have
question.
like a lung inflammation. This whole.
Oh, I'm
Oh,
sorry to hear
dude.
that.
Disgusting.
Yeah, like last night
is-
was awful.
Is that from something like an allergy, or are you, I don't know, doing construction in your apartment and inhaling something that you don't
No,
want to inhale?
I don't know. All I know is that yesterday, like, it came down really hard, and like every time I breathed in, it was just like shooting pain all the way up into my shoulder, and so I go to sleep earlier.
Yeah.
tonight.
Okay. Well, I might be in the open panel later, but I'll talk to you guys later.
I
It's
hope
good
you
to
feel
see
better,
Bye.
Lactoid.
Bye.
And yeah, I hope you're not. Are you asthmatic?
No.
Okay.
Mm,
Yeah,
mm,
I hope you recover quickly.
Oh, thank you, Corey.
Yeah.
Yes, I hope you guys are the best of health as well.
Thank you, Lactoid.
See you soon. Be well.
Saying Lactoid's name is gross.
Wait, what? No, it's.
I mean, I think you should rebrand again. Lactoid is, I don't know
Yeah.
what it means, to be
Lactoid
honest.
is
We're not rebranding from Lactoid.
big
That's-
mommy
that's
milkers.
been my
That's
name
your
for-
brand.
That's been my name for years, probably more than 10 years now.
That doesn't
well
mean
more
you
than
can't.
10 years now, 15 years.
Doesn't mean you can't change. You rebranded once. Like, you better do it like soon.
Yeah, you're not
before-
like anti-communist central or whatever your old name was.
Why is my shit frozen?
I don't know. Are you still in StreamYard, dude?
No,
Have
I
you closed
left.
StreamYard? Okay. I don't know.
It's weird.
No, that was fun. And Erudite's like muted right now, so I can't tell her.
All right, so Miss Millie, Big Mommy Utters. No, will not name ourselves that. But what I will tell you this is we are going to stay Lactoid. Right now it's Lactoid TV, but if I can get Lactoid just the name, I want to do that. I tried to do it, but I think I made a prior account and then lost access to it because there's like an inactive account called Lactoid and I can't access it. So yeah, I guess we're Lactoid TV for the time being, but if I can jump on just the name Lactoid, maybe we might do that. Just to make it real nice and sweet. That's what people call me. Anyway, thank you guys so much for swinging by and enjoying a night of debates. We did a whole, I think it was a very active panel on Whick's for Whick's healthcare panel. A lot of back and forth, and then I thought the Prime panel topics were also very interesting as well. So absolutely amazing. I also want to really thank you guys because tonight we had very great chat interaction, which I always love. We had great, solid numbers of just people coming in, saying their piece, sticking around. I always really appreciate that. Thank you guys so much. If you guys want content like this in the future, and other content. Like I said yesterday, I was felt like on the verge of death, so we didn't do a normal casual stream, which we do on Sundays, which I play StarCraft, and we just chat about whatever politicals happenings are happening. Um, and sometimes we do our own debate show as well. If you like stuff like that, please consider giving the channel a follow. That way, you can see when I'm on, and you can see when the content is underway. However, that will be for a future date because tonight it is ending. I'm going to go ahead and go recover. What we're going to do now is, because he was kind enough to have us on his show, we're going to raid on into Prime, and you guys get to enjoy the open panel, which is, I've heard, very exciting at times. And also, one more thing, if you guys have any questions at all for me or any comments or anything like that whatsoever, please feel free to join our community on Discord and shoot me a message. And yeah, I mean, more cheesy thank yous. Thank you all again for sticking around, and for all you who gave bits or subs, big shout out. Thank you so much for supporting the channel. Yeah, good shit. I have no issue with. I don't think I've ever debated that. Was I ever on a panel with Bastion? For some reason, I think I was, but I don't. I would have no issue with debating him on a panel. Yeah. Anyway, right on out. Thanks, guys.
Right. Like, GTA isn't a racing game. I mean, you can do racing there if you want to, but anyway, the driving in